morning, RNs to be. Before we start our session, let us place ourselves in the presence of the Lord. Thank you for that feedback, Glennie. Let's all bow down our heads and let's begin with a prayer. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Join me in this prayer of trust. My Lord God, I have no idea where I am going. I do not see the road ahead of me. I cannot know for certain where it will end. But amidst the chaos, remind me to always trust. Though I may seem to be lost and in the shadow of nowhere, I will not fear, for you are ever with me, and you will never leave me to face my perils alone. Heavenly Father, allow me, with the support of my parents, to continue in my mission as an aspiring nurse to help preserve life, your greatest creation. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Okay, good morning, good morning, good morning. Good morning. So let me just shift our screen once again. Those of you who have their handouts, kindly print them or have them ready on your computer screens, and we will begin our session right away. Okay? Get ready now with your handouts and materials. And of course, your pen. To start, I'd like to introduce my co-facilitator with me today, of course, one of our excellent Junior Gapus mentors. And he has been with us before, and she is still with us now from the shift. She's at the second floor of Gapus building. Prof. Jem, good
Hi,
morning.
good morning. I'm here in Alaska.
Obvious ba ako yung nasa studio? Daya, nandito ako sa ground floor of Gapus Building. Good morning, everyone. At ito ang challenge ko sa lahat-lahat ngayon. The moment you pass your test, I'm going to give you this RN medal. So, pwede isabi, mine. Okay. We'll send you an RN medal. Dapat susuotin nyo to, ha? We used to give this sa aming RN ceremony. Ayan, pamain na. Ayan, o. Ayan.
True.
Dapat may ganyan. Okay? Prof. Jem, mamaya magsuot ka nito. Gusto ko suot mo lahat to. Okay, mine. Okay, yung mga sigurado ng magiging RN, pamain naman. Okay, we're gonna send you yours and we'd like you to take a picture of yourself wearing this. Okay?
Oh,
tapos mag-virtual ano tayo ulit. Naalala mo yung ano, yung oath of healthcare professionals ng Gapus. Yan, gagawin uli natin yan. Good morning, Ma'am Jem. How are you?
Hi, sir. I'm fine.
Sinong kasama mo dyan sa second floor?
I'm still looking for him.
Wow, wala nang masabi. Okay, pakibati mo muna ang ating mga RNs and top-notchers to be. Go!
Hello, good morning, RNs! Wow, feel na feel ko na magiging RNs nila.
Good morning. Okay, anyway, are you ready to start? Okay, syempre, alam mo nung ano binabasa ko tong material kagabi, ako rin mismo natatawa ako sa mga pangalan no, parang katawa-tawa lang. O sige na, bago natin pagtawanan ang ating mga sarili, eto na, ready na sila. Get ready with your pens. Please mark mark the answers as we move on. Okay, Prof. Jem, nakikita mo ba kami dyan? Nakikita mo ba ang aking fina-flash?
Yes!
Okay, so please, paki-download nyo yung set A. Kasi di ba ano yan? Set A, B1, B2, C1, C2, set E, and then set F. Siyempre, kasi akong gumawa niyan. Walang set D as in video. Dahil yung set D, bukas pa yun ng umaga gagawin. Ay, may paganoon. Correct. Okay.
Correct.
Let's begin. Aning is 2 months pregnant. Her parents do not know this. Waning informed her friend Pining.
Okay.
About the problem. Pining referred Aning to Basing, an abortionist. Aning had an abortion. O naintindihan nyo ba kung anong mga sinasabi nito? Okay. If those involved will be charged legally, he is considered as the principal. Is it Basing, Aning, Pining, or none of them? Okay. First and foremost, you have to know what do you mean by principal. Who is the principal? The principal is the head of the school. Hindi. Ano ka ba? The principal is the one who commits the crime. So, kumbaga siya yung gumawa ng krimen. So in this case, kung sino yung abortionist, siya ang principal. Therefore, sino ba yung abortionist? Is it si Basing, si Aning, o si Pining? Ang abortionist ay si
Basing.
Basing. So letter A. Now this is a question that requires you just to analyze. The answer is already in the stem. It's just a matter of trying to figure out alin ba dito would definitely answer what is being asked by the question. And in this case, the question is asking for who is considered as the principal. Okay, so number one, the answer I see Basing. O ngayon, ano naman ang role ni Aning at saka ni Pining? Prof. Jam, ano kaya apelido ni Pining?
Girl?
Girl siya, di ba?
Pining girl? Charot.
Si Mrs. Girl siya yan, okay?
Okay.
So anong full name ni Pining?
Pining girl siya?
Okay, si Aning, ano kaya apelido ni Aning?
Aning?
Ang apelido ni Aning, Aning din. Oh,
Aning?
Ang pangalan ay? Ang buong pangalan ay?
Aning?
Correct, okay. At saka si Basing, alam mo kung ano apelido ni Basing?
Ano siya?
Gersy. Oh,
Basing
so
Gersy.
ang pangalan niya ay?
Basing Gersy, confirm?
Gusto ko yung sabi ni Michael. Sabi ni Michael Cruz, ang apelido daw ni Aning Lingus.
Anilingus?
Ano yon? Papaita Kilawen? Anilingus? Kunilingus? Gano'n?
Correct.
Okay, let's move on to number 2. Diba? Wala tayong magawa dito. Okay. Now, let me differentiate the terms accomplice and accessory. Okay? So, who is considered as an accomplice? Ano ba ang kaibahan ng accomplice at ng accessory? Okay? An accomplice participates in the commission of the crime. The accessory may not have direct participation but may assist, okay, someone to break the law. So in other words, the accessory's contribution is after the fact. Ano ibig sabihin ng after the fact, Ma'am Jem?
Ito yung gustong-gusto ko ba? Charot.
Sabi nung isa after the fact daw, after sex, ano ba yun? Iba yun. Okay, so therefore, pag ikaw ang nag-refer, di ba, sa isang tao to commit a crime, ikaw ay tumulong directly. Okay? Tumulong ka before the commission of the crime. Yan ay accomplice. Pero kung ang tulong mo, pinatakas mo yung abortionist nung aarestoy na siya. So after the fact na. So matapos na yung pag-commit ng crime tsaka ka tumulong, then that's an accessory. So once again, accomplice, if you participate in the commission of the crime, okay, you refer the person to the abortionist. Accessory, if you assist someone to break the law, usually after the commission of the crime. So who is considered as an accomplice? Si Basing, si Aning, si Pining, or none of them? The answer, syempre, pag sinabing accomplice, sino ang nag-refer? Si Pining. Okay, so therefore, ang accomplice ay si Pining. Okay? Ay, ang gagaling na mga nandito sa chat box natin. Okay, next. Number 3. If during the investigation, the pieces of evidence were not found because Rosing the maid of Aning burned it. So in other words, yung participation ni Rosing, okay, yung participation ni Rosing ay after na ng commission ng crime. Therefore, ano ba siya? Accomplice, accessory, principal, o din?
Accessory.
Meron ba namang kasambahay pero di ka na? Ang lakas ng tawa ni Cassandra.
Correct! Ano ba
Sabi ko
yan?
nga,
Si
binabasa ko
Dean.
itong mga question kagabi para kung buang mag-isa dun sa study room ko sa bahay eh. Okay, so sino si Rosing? Kasi siya ay sinunog niya. So after the fact, therefore, accessory si Rosing. Okay, very
True.
good. Sabi ni Jerome, kaaliw daw. O itong session natin, oo, wag ka lang basta maaliw, tandaan mo yung concepts.
Correct.
Para top-notcher ka sa board at makakatanggap
Yes.
ka pag naging RN ng RN medal. Ganito
Yes.
itutuloy natin. Okay, ano ba ito itsura ko? Hindi ko mawawaan kung reincarnation ba ako ni April Boy Regino.
Kanta naman dyan. Charot.
Wala na akong time kasi magayos ang sarili ko. Kasi nga nagmamadali ako, ayoko malit sa klase ko, kaya yan. So hindi ayos ang buhok, anong intervention? Lagyan mo na ang sombrero. Diba? Okay. Sabi ni Maylin, ano daw sample? Di ko kayang tanggapin
Yeah.
na mawawala ka na sa akin. Number 4. A
Yeah.
nurse is liable as an accomplice in an abortion if she, now take note, we are talking now of being an accomplice. What did we say a while back? If you help in the commission of the crime, ikaw ang nag-refer. Therefore, the answer is letter B. Refers the pregnant mother to the abortionist. Okay? Again, sino ang accomplice natin dito? Sino ang nag-refer? Si Pining. At ang ano uli ang apelido ni Pining?
Gersi. Piningger siya.
Number 5, abortion in the Philippines is a or an a legal option, an ethical alternative, crime, form of misdemeanor. O hindi pwedeng misdemeanor lang yan. Pag sinabi mong misdemeanor, that's an infraction that is inferior to felony. Okay? There is usually, meron kang, kumbaga, pitik, di ba, na parusa, pero hindi ka naman makukulong. Kasi misdemeanor could be vandalism, petty theft, hindi mo na-renew yung PRC-ID mo. That's a form of misdemeanor. Hindi ka makukulong, pero definitely, meron kang konting pitik, may multa.
Yes.
Kumbaga ganon. Okay? So, pag sinabing crime, therefore, there's a chance na ikaw ay makulong. O, di ba? Crime, crime, crime. So, yung naka-answer ng 5 out of 5, okay? Anong sagot mo, Joy? Abortion in the Philippines is fine? Ay, hindi. Fine na multa. Ano ba? Okay. Next,
Okay.
let's talk about quality assurance. Now, if we talk about quality assurance, don't forget the concept of, wow, naka-5 si Glenna. Congratulations, Glenna. The concept of standards of care. So what do you mean by standard? So if you are asked, what is the purpose of having nursing standards? Your answer should be, it is used to assess quality of service. So standards serve as your set of criteria. So it is a means of establishing accountability. So if you have standards of care, that means you are accountable for the care that you are providing. Okay. So let's pay particular attention na. Wow. Congratulations, Eloisa. Okay, 5 over 5. O, 5 din sila. What a way to start the day. Ready na sila to top the board. Makaka-receive na sila ng RN's medal na ganito na isusuot. Okay?
Yes.
Alam mo ba, 3 box pa yung ganito natin dito, Prof. Jem. Okay?
Oh, ibibigay na natin
kaya
sa kanila
papadala
yan.
natin sa kanilang lahat yan. Okay,
True.
go, go, go. Let's move on. Number 6. The hospital has an ongoing quality assurance program. Which of the following indicates implementation of process standards? Now, wag nating kakalimutan, ano ba ibig sabihin ng process standards? So, process standard refers to the activities in the delivery of care. In other words, this refers to the practice itself, like application of the nursing process. So process standards yan. How is it different from structure standards? Structure standards pertains to the setting, okay, the equipment, the staffing. That's your structure standards. Now, what do you mean by outcome standards? It pertains to the results, okay? So isa-isahin natin. Pag sinabi mong the unit has well-ventilated room, this is about the setting. So this is structure standard. Average waiting time for medication administration is measured. O, mineasure mo. Once again, this is part of the activities that you are doing within a specific system. So this could be considered as your structure. Okay? The nurse reports adverse reactions. This is an outcome. Adverse reaction is the effect. Okay? The nurse check client's identification bond. Checking is part of assessment. So we said a while back that nursing process is in itself, okay, part of your process standard. So your practice as a nurse, your implementation of the nursing process, your delivery of care belongs to your process standard. So in this case, ang tamang sagot ay letter A.
Correct.
Marunong. An advantage of automated or computerized client care system is the main advantage is that information concerning the client can be easily updated. However, the challenge is actually protecting the client's data. Okay,
True.
so it's very, very important that you know the provisions of the Data Privacy Act. Okay, next, number 8. Nursing audit aims to compare actual nursing than to establish standards. So once again, your standards are considered as a means for establishing accountability, and these are used to assess the quality of service. Number 9. In conflict management, the win-win. Ay, may artista kayang ganyan, Ma'am Jen.
Correct.
Win-win Marquez. Okay? Win-win approach occurs when you say win-win, so in both situations, okay, both parties that are involved in the conflict would not, hindi masama ang loob. Kumbaga pareho silang kahit papano na pagbigyan mo. Di ba? Yan yung mga ginagamit sa mga political solutions. Okay? Letter A, there are 2 conflicts and the parties agree to each win one. No, this is not a win-win approach. Naghati lang sila. Each parties involved are committed to solving the conflict. This may not necessarily be a win-win approach. Ito ay compromise, okay? Both parties involved are committed to solving the conflict, okay? So we can consider the conflict is settled or court to the legal system and the parties win. No, this is a win-lose approach. So the best answer is letter C. Okay, number 10. The obligation to correctly perform one's assigned duties is known as, the answer definitely would be, now, pag ang pinag-uusapan, ito ang keyword mo, okay? Nurses, duty, okay? Duty means that's your responsibility. Now, your being able to answer for the effects of what you did, that's accountability. So that's the difference. Now, you have to remember the concept of responsibility and accountability when you talk of delegation and assignment. Okay? So when you delegate, you just delegate the responsibility, meaning your duty. But the accountability, okay, remains with the nurse. Gawin nating simple para hindi sila malito. So kung meron kang nursing assistant, inutus mo sa kanya na paliguan yung pasyente. Okay? Okay. So, you delegated the responsibility. Ngayon, pag nadulas yung pasyente habang pinapaliguan niya, sino ngayon ang may kasalanan? Ikaw, because the RN retains the accountability. So, the RN is is accountable or answerable. Okay? When you talk of assignment, it's an entirely different thing. O, inassign mo yung pasyente, alagaan ng nursing assistant. Dahil inassign mo yung buo, okay? Binigay mo yung responsibility at saka accountability. In essence, pag may nangyari sa pasyente, hindi mo nakasalanan. That's the difference ng delegation tsaka assignment. Okay, okay. Let's move on. Number 11. Which barrier should you avoid to manage your time wisely? Well, we always do this. We procrastinate. O bukas na ako mag-aaral, bukas na ako mag-aaral. Tapos bukas board exam na. You don't do that. Okay, number 12. Your head nurse in the unit believes that the staff nurses are not capable of decision making, so she makes the decisions for everyone without consulting anybody. Nako, ito ang tinatawag na leader na autocratic. Okay, question. When do you need an autocratic leader? When you have a health emergency. Ngayong panahon ng pandemya, ngayong may COVID, o kung may mga nangangailangan ng CPR, or kung kailangan lang ma-revive, kung kailangan mo, okay, ng liderato sa mga sitwasyon na emergency in nature, you need an autocratic leader. Eh yung pinabayaan lang kayong lahat, laissez-faire yon. Okay? Eh yung tatanungin ko anong gagawin natin, tapos tatanungin uli yung ibang party ko anong gagawin, okay? That is democratic leadership. So if we talk about number 12, pay particular attention to this class, okay? Okay, pay particular attention. Basta emergency, you need an autocratic leader. Okay, so let's move on. Number 13. Management by Filipino values advocate the consideration of the Filipino goals trilogy according to the Filipino priority. Ano ba unang nagiging priority ng Pilipino? Okay? Definitely family goals. Okay? Pagkatapos ng family goals, saan tayo susunod? Kasi tayo, mahilig tayo sa collective. Okay? Situations. So ang mga Pilipino, collective din mag-isip yan, grupo-grupo. So after family goals, organizational goals, then national goals. The answer would be letter D. Okay, number 14. Okay. In scheduling staff, all of the following are true. Except, in scheduling staffing ito, sorry for the misprint. All of the following are true except Now, always remember, you do not count the student nurses as part of your manpower because the student nurses are supposed to be there to learn. Sa related learning experience nila yan, di ba? So the answer would be letter B. Fewer nurses will be needed on days when student nurses are assigned to the unit. This is not true because the question is asking for exception. You do not include nursing students as part of the manpower. 15. All of the following are major responsibilities of the nurse manager except. Now, pag manager ka na, hindi ka na magpe-perform ng bedside care.
Correct.
You design the schedule, you set the standards, you coordinate and delegate patient care, okay? But you do not perform bedside nursing care yourself. So, the answer will be letter D for number 15. Next, let's move on to number 16. In teaching assertiveness, when you say assertiveness, okay? That means you actually highlight your points of view, your ideas, your position without necessarily stepping on somebody else's right to express themselves. So pag sinabing assertive ka, yun ay pinaninindigan mo yung ideya mo, yung position mo, okay? Sa mga bagay-bagay. Pero hindi naman nangangahulugan na nang-aapak ka ng karapatan ng ibang tao. So the answer for number 16 is D. I have a question about this order. Okay? Yung letter A, that is not assertiveness. That is being defensive. Okay? You don't know what you are talking about. This tends to demean what your the person you are conversing with is talking about. And then can't you write so someone can read this? Now, this is not an appropriate response, especially when you have verbal interactions. Okay, let's move on to number 17. Ang favorite ni Ma'am Jem, ethics. Ano ba yung ethics? Yan yung anak ng bibe.
Kala ko ito yung tumitigas pag dinidilaan.
Hindi, ba yun? Okay, let's move on. Ito na naman ang walang kamamatayang beneficence, autonomy, advocacy, justice. Okay. Tiffany, a staff nurse working in a cancer unit, is considered a role model not only by her colleagues but also by her patients. She gets out of her way to help others. Now, that's the key phrase. You get out of your way to help others. Okay? She is very active in their professional organization and she practices what she teaches. What ethical principles is she practicing? Okay? This is actually ideal beneficence because beneficence is just doing good. Okay? Doing good, may pulubi, dumating sa'yo, nagutom, binigyan mo ng pagkain, pero inantay mong dumating siya sa'yo. That's beneficence. But if you are the one going out of your way, then that's what is termed as ideal beneficence by some ethicists. Okay? When you say autonomy, this is freedom, self-determination. You have to decide on what's gonna happen to your body. Like pag ikaw magpapa-opera, sino ba mag-sign ng consent? Dapat ikaw. Kasi nga, okay, you have the sense of autonomy or freedom to decide kung anong gusto mong gawin sa katawan mo. Okay? Advocacy means helping others, okay, to stand for their rights and responsibilities. Justice means fairness. Okay, so in fairness. Okay, number 18, let's move on. The purpose of having a nurse's code of ethics is to help the public understand professional conduct expected of nurses. So that's letter B. Number 19, this principle states that a person has unconditional worth and has the capacity to determine his own destiny. Okay. Capacity to determine his own. So, karapatan mo bilang tao, number 19. Okay, that's self-determination, autonomy. Okay, number 20. The principles that govern right and proper conduct of a person regarding, this is the key phrase, life, biology, and the health professions is referred to as, this is bioethics. Okay? Now, what is morality? The extent to which an action is considered as right or wrong. Kung ito ba ay mali or tama, that's actually morality. Well, ano ibig sabihin, sir, ng religion? Well, religion is man striving to find God and establish a relationship with Him. So pag sinabi natin God, whoever do we consider as a supreme being here on earth. So that's religion. So establishing relationship with whomever we consider as God. Now, what about values? Pag sinabing values, these are the things that we use as our standards. Okay? Our own principles. Pag sinabi mong may prinsipyo ako, the example yun ng pagkakaroon mo ng values. So number 20, the answer is letter C, bioethics. 21, okay, let's talk about your research. Okay? O di ba, Prof. Jem, ang research tapusin na nang matapos na ang masters. Ganon.
Yes.
Okay? So it's very, very important na alam mo kung anong type ng research ang gagawin mo. Pag nakita mo to, quantitative, may N. Think about a research that deals with numbers. Okay? So ang keyword mo dyan, look for the word na number. Diba? So you are measuring things in terms of number. Pag sinabi mo namang qualitative, okay? Pag qualitative, you talk about reactions, feelings, anxiety, mga ganyan. Okay? So, hanapin natin to. At this point in time, huwag ka nagme-memorize ang definition. Pwede ba?
True.
Just code the question and the answer. So pag sinabing quantitative, N, think about numbers. So ang code natin ay number. Therefore, ano ang sagot mo ngayon dito? Ayan, letter A, the effects of regular nurse visits to client's bedside on the number of client calls. You see?
True.
Pag sinabing qualitative, you talk about reactions. Ayan, the effects of white uniform, that's a reaction. Oh, the benefits of pre-op instructions, so feelings. Okay, that's qualitative. The effect of touch on the client's feelings. Again, if you talk about feelings, reactions, anxiety, in a nutshell, okay, it may not be the complete definition of the type of research, but it serves the purpose for your test. Okay, so that's very, very important for you to do. Let's move on to number 22. Okay, which of the following studies is based on, this time, qualitative? Ano yung code natin kanina pag sinabing qualitative? Reactions, emotions, feelings. Okay. So ito, yung letter A mo, pag sinabing blood pressure, it deals with numbers because you're measuring it. Itong letter B, ayun, yung keyword mo, reaction. Yung letter C, okay, weight loss or weight gain deals with numbers. Your letter D, oxygen levels deals with numbers. So itong C, D, and A, lahat yan quantitative. Yung letter B mo, qualitative. So the answer is letter B, as in bubule. Okay? Next, number 23. Marta, oh, Jem, lagyan mo na apelido si Marta.
Martha Rogers, charot.
Huwag kang ganyan, wag mo isama mga theorists. He wants to
Okay.
do a study on this topic, effects of massage and meditation on stress and pain. The type of research that best suits this topic is, now, you are actually, nakita mo kasi yung word na effects. So ang nasa
True.
isip mo kagad, experimental yan, di ba? Okay, wala naman sa option ang experimental. Okay? So, ano ngayon ang gagawin mo? I-analyze mo based on the existing options. Okay?
True.
So, you have basic research, quantitative research, applied research, qualitative research. Once again, pag sinabi natin quantitative, think about numbers. Qualitative, think about reactions, emotions, feelings. So, you're left with A or C. Okay? Pag sinabing basic research, this is pure research. Usually research that deals with improvement of theories, okay, belong to basic research. Okay? But if your research deals with something that solves an existing problem, okay, then it actually is considered as applied research. Okay, now, do we have a problem in the title? Definitely, there will be a reflection of a problem. You're trying to solve stress and pain through interventions like massage and meditation. So if this research is about a solution to a problem, then we call it applied research. So the answer is letter C. 24. The type of research design that does not manipulate independent variable is non-experimental, quantitative design, quasi-experimental design, experimental design. Now, there are three elements that makes a through experiment. Okay? Okay. And what are these? Remember, RCM, randomization, control, and
Control.
manipulation. So that means, okay, the samples are randomized. There's always a control group, and then you manipulate a variable. Okay, now, okay, the question is, what happens when you don't have, okay, one of these elements? Okay, so what about if you do not manipulate? Okay, anong tawag mo doon? E di non-experimental design. Okay, so the answer is letter A. Number 25, data analysis is to be done and the nurse researcher wants to include measures of variability. This includes the following, except, dapat ito standard deviation, wala dapat yung off. Okay? So, alin daw ang hindi measure of variability? Yung range, yung variance, yung standard deviation are measures of variability. Your mean, yan, that's part of your inferential statistics, is the average, di ba? Mean, meaning the average scores. Okay? So, this is not considered as a measure of variability. Okay? 'Di ba yung the score in the middle scored is called your median, okay? And the most frequently occurring score would be your mode. Okay, next, number 26. A supposition or system of ideas that is proposed to explain a given phenomenon best defines, okay, the answer here is theory, okay? Because it is a system of ideas, okay, that is proposed to explain a given phenomenon. Of course, we can disprove a theory. Now, what is a concept? A concept is an abstract idea.
True.
Okay. Now, when you use a concept as the basis for a specific project or study, then you call it a conceptual framework. Okay. A paradigm or paradigm is a model. Okay. So paradigm or paradigm. Next, random sampling ensures that each subject has an equal chance of selection. E pag ni-reverse ito, okay, which of the following types of sampling, okay, facilitates the presence of an equal chance of selection for each subject? Then we term it random sampling. 28. You decided to include 5 barangays in your municipality and chose a sampling method that would get representative samples from each barangay. What should be the appropriate method for you to use in this case? Okay, now, I'll give you an example. Kunwari, isang bansa. Tapos bawat bansa may mga probinsya. Pag ganun ang method na ginamit mo, ang tawag dyan sa sampling na yan, cluster sampling.
True.
Okay? Cluster sampling. Sir, paano yung systematic sampling or systematic random sampling? Okay? So, kunwari, 100 kayo doon sa room. Gusto mong kumuha ng samples mo. Pabilangin mo sila lahat ng 1, 2, 3 hanggang 10. Tapos yung every 10, yun ang kinuha mong sample. Then that's systematic random sampling. Okay? Now what about stratified sampling? Okay. Stratified sampling, you use this when there's a group that is defined by an exclusivity factor. Example, age, di ba? Age 50 to 60. That's an exclusivity factor. Another example would be religion, di ba? Catholic, okay, Christian. So meron kang exclusive criteria. So when you get a sample from each of those subgroups defined by that criteria, then ang tawag doon stratified sampling. Okay? Now what about random sampling? Example niyan, pinaka-common, mag-draw lots ka. Okay? 'Di ba? Everyone has an equal chance. Pero dapat hindi draw lots pagka in-aspire natin tong medal na to, ha? Okay.
Yes.
Next, number 29. You are interested to study the effects of meditation and relaxation on pain experienced by cancer patients. What type of variable is pain? Okay, gawin nating simple ito. Pag sinabi mong dependent variable, it is the result or the effect of an intervention. Pag sinabi mong independent variable, okay, that is the cause or yun yung intervention mo. Okay, in this case, okay, pain is actually, the level of pain is the effect. Okay? So, ang intervention mo dito ay meditation and relaxation. Therefore, meditation and relaxation could be your independent variable. But your dependent variable would be pain. So, pain, the answer is letter A. Okay. Number 30. You would like to compare the support system of patients with chronic illness to those with acute illness. How will you best state your problem? So, you would want here to have a research problem that compares chronic illness with acute illness. Okay, so how is it best studied? Letter A, the effect of the type of support system patients with chronic. Oh, you're not comparing the two. You are actually just identifying if the support system would have an effect on chronic or acute illness. The question is asking you to compare, okay, the support system, not the effect of the support system, okay?
True.
So a descriptive study to compare the support system of patients with chronic illness and those with acute illness in terms of demographic data and knowledge about interventions. Now, this is somewhat correct, but it's just too long, okay? It's not observing the proper principles for having creating titles for a research study. A comparative analysis of the support system of patients with chronic illness and those with acute illness. This one is more encompassing. Actually, if you compare it with letter B, letter C is more encompassing than letter B. So letter B, a study to compare the support system of patients with. Now, we usually don't use the word a study because the fact that you're conducting a research, that is in itself already a study. So that is redundancy. So the best answer is letter C. Okay,
Sure.
31. You would like to compare the support system of patients with chronic illness to those with acute illness. What type of research is this? So that's descriptive correlational. You are describing and you are relating. 32. In any research study where individual persons are involved, it is important that an informed consent for the study is obtained. The following are essential information about the consent that you should disclose to the prospective subjects. You have a keyword there, except. Huwag niyong kakalimutan basahin yung except, kaya lagi babasahin from start to finish. Okay? Except. Okay? Letter C, consent to incomplete disclosure. What makes this wrong? Incomplete. There has to be complete disclosure kung yung research ba na yun, especially if it affects the health of the samples. Okay? The nurses must auscultate Mr. S's blood pressure again. His previous reading was 78/42. After she rubs the deflated cuff. Okay, ano ba yung deflate? Prof. Jem, deflate, ibig sabihin, dyan tayo kumakain. Di ba?
Deflate?
We eat on deflate. Eh, Prof. Jem, ano ang difference ng deflate at saka ng dikulaan?
Ano yan?
Di ba yung deflate, bilog na?
Correct.
Yung dikulangot, bibilugin pala. Another difference, ang deflate tsaka ng dikulangot.
Ano? Sa mesa?
Yung deflate is on top of the table. Dikulangot is underneath the table. Ano ba? So, she palpates the brachial artery and pumps up the cuff until she can no longer palpate the brachial pulse. The underlying rationale for this nursing action is that it. Now take note, bakit ba tayo nag-approximate? Diba? Nagpapalpatory blood pressure. Okay? Oh, hindi ba obvious to? Parang gusto mo i-check agad yung mahaba, pero wag mo namang gawin na lahat na lang ng mahaba, yun ang pinili mo. Tapos 30 minutes after, sabi mo, tapos ka na. Naganap ka na mahaba, maikli. Okay, but it pays to always focus on these kinds of options because, okay, subconsciously or unconsciously, the test item writer might be using more or less words to come up to describe the correct answer. So the answer is letter C. Estimate the maximum pressure required to measure the systolic blood pressure. O technique daw longest. 34. Give Mrs. M breakfast at the scheduled time is a nursing intervention belonging to which of the following categories? Okay, giving breakfast means facilitating appropriate food intake at the scheduled time. This is a part of therapeutic intervention. So the answer is D. Pero if this is about assessment, taking the blood pressure, that is a diagnostic intervention. Okay? 35. Which of the following instructions should the nurse include when teaching Mrs. G the proper technique of instilling oral medication? So pag sinabing oral medication, saan natin ilalagay ang gamot? Sa tenga. Okay? So, you have here an adult. Okay, Mrs. G. Okay? Kasi pag below 3 years old, down and back. Okay? Pag adult, up and back. So, the best answer is letter A. Okay. So, that ends the first session of our rundown. Take note, we started with set A. Now, Prof. Jem will take over and then after ni Prof. Jem uli, kay babalik uli ako. So mag-alternate lang kami para hindi kami hingalin at mapagod pareho. Prof. Jem, kamusta ka dyan sa iyong kinalalagyan?
Hi, sir. I'm doing great here.
Wala pa rin? Wala ka pa rin kasama sa second floor?
I'm still waiting for him. Maybe
Wow
later,
naman.
lunch.
Okay. So, ladies and gentlemen, let's give her a warm round of applause.
Yes!
Take it away, Prof. Jem Karaig for the next set.
Yes, thank you, Sir Ray.
Set A pa lang tayo hanggang set F to, no?
Ay, ganun, set fa.
Oo, mahaba. O, di ba yung favorite mo, Prof. Jem, mahaba? Okay, so take it away, Prof. Jem. Go, go,
Yes,
go.
sir.
I'll join you in a while once again after Prof. Jem.
All right. Okay, thank you, sir, for that very knowledgeable and wonderful set one. So what you have actually learned from that set is actually those topics that are commonly seen on nursing practice one. But of course, we're not trying to say that those can only be seen from nursing practice one, because topics are now integrated from nursing practice one to nursing practice 5. What I just noted from the group, everyone was so into the answers, and most of you are not listening. You know, the time is actually wasted. What you have to do, if you miss the answer, we're just gonna take it later. Okay, because we can actually send you the answer. What is important is to focus first on what we are doing. All right. So again, okay, for those who are asking questions during the discussions, please bear in mind. Okay, bear in mind that you have to focus first, and we can just give you the answers later on. All right. Okay, so if there's someone who would ask, what's the answer for number 1? Dedma, later na lang. We'll just send it. All right. Okay, so from our materials, please take note the rundown B1. Okay, rundown B1. So please remove printed materials for rundown B1, because I'm gonna discussing pointers related to obstetrics. Okay, obstetrics. There you go. So, and also round down B2, B1 and B2. You must at least have the printed one so you can actually have some pointers to take note on it, okay? Okay, so let me, okay. Sir George, are you there? Okay, do we have the copy of B1 here from our? Okay, so if there's none, it's okay. So I hope you have already the copy of it. So let me know. Okay, do you have yours? Please chat. Oh, it's so great that we are 304 in our meeting. Okay, wow. So good morning. Wow, thank you so much. Okay, so this is exactly what we're gonna do now. We'll just give some pointers about this. Okay, can I still write here, Sir George? Okay, where can I write? You know, I really love writing.
Yes,
here.
you can, Prof. Jem, you can.
Yes, sir. Okay, wow. So, there you go, okay? So, please, okay, now bring out your material. So, we have this, okay, pointer set 2. Okay, parang hindi marunong write dito. Saan ba itong mga write chuba? Well, anyway, ito yata. Okay. So anyway, let's discuss. Okay. So number 1. Okay, please take note. Okay, of our highlighted concepts. Ready? Okay. So Miss Cecilia Flores is unmarried and pregnant. She has been receiving prenatal care at clinic and has early signs of pregnancy-induced hypertension. So the first question is, okay, which of the following information is available to the nurse in Mrs. Flores' chart would the nurse determine as being the least likely risk factor for PIH? Okay, so the answer here is basically we highlighted already. Okay, it's a high socioeconomic level. But let me just remind everyone that the letter that you've seen right now, it's not the letter exactly what you will see on the test. Because some of you might think of the answers are always letter A. Of course not. Baka bigla may sumagot, lahat sinade niya, baliw. Okay, well, anyway. So what do we have to remember when we talk about, pregnancy-induced hypertension. Now, we commonly identify hypertension as one of the predisposing or high-risk conditions to pregnant clients. Okay? So, teka nga. Paano ba ako magsusulat dito? Ito ba yun? Okay, here. Something here. Okay. So, I'm so bobo. I don't know where to see. Okay. Ito ba yun? Okay, anyway, so this is one thing that we have to remember. What is the difference of hypertension when you consider the H mole and also the PIH? Always consider the age of gestation. Okay? If the hypertension occurs less than 20 weeks, then you consider that can be related to H mole or gestational trophoblastic disease. Okay? And then if the hypertension is present after 20 weeks, then you consider that is related to PIH. Okay? So, hi! Okay, how to navigate this? Okay, if I can write something, Chuvanes. The annotate. There you go. I love it. Minsan syunga-syunga ka rin, Ma'am Jem.
Jem, hindi mo napansin, sabi doon, annostate. O, di ba? Thank you naman, Prof. Jem. I don't want to disturb you.
Okay, thank you, sir. May anus state. Charot-charot. Okay, well, anyway, okay? So when you consider the PIH again, usually the hypertension is present more than, not 20 weeks of gestations. Okay? Okay, so PIH, usually, more than, 20 weeks. Hindi siya lumalabas, no? Okay, nawawala siya. Okay, more than 20 weeks. There you go. Okay, so the thing is, we are talking about the possible predisposing factor. Okay, so usually, what we consider to look for, is when this PIH usually occurs. No, so usually when we talk about the possible risk factors, risk, nawawala siya. Anong problema mo? Okay. Okay, risk factors. Hindi siya may sulat ng Keme.
Nakakasulat, ayan no, nakikita ko, risk factors. Risk may sulat.
Nawawala siya, sir, pag sinusulat ko.
Sige, go ahead. Sulat ka lang.
Oo, nawawala. Anyway, sir, it's okay. So, the risk factors would include number 1, being premi-gravid. Okay, so if this is a first-time pregnancy and then the patient is teenager, and coming from a low socioeconomic class. Okay. So coming from a low socioeconomic class, teenager, premi-gravid, that would increase one's clients to pregnancy-induced hypertension. So other than that, you consider older premi-gravidas. When you say older premi-gravidas, they had this first pregnancy more than 35 years old. Okay, more than 35 years old. Or we can consider women with a family history of PIH. That can be a risk factor as well. And women with additional complications such as those clients with multiple gestation, or they are suffering from diabetes mellitus, RH incompatibility, and hydatidiform mole. Okay. So with those risk factors, why do we consider that PIH is considered to be a high-risk condition? Because once hypertension occurs during pregnancy, that can increase one's clients to abruptio placenta. Do not forget it. Okay. If abruptio placenta may not be seen on the test, then there could be a possible risk also, possible risk related to DIC, disseminated intravascular coagulation. And we know the fact that once the hypertension during pregnancy is not controlled, this will turn into pre-eclampsia, and patient may also develop seizure, which we know as your eclampsia. So the thing is, when we are caring for patients with a possible PIH.
Jam, yung seizure, di ba yung side of the beach yun?
Seizure, correct. Seizure, yun yung after mag-masturbate ng mga lalaki nagsi-seizure. Charot! Okay. So what is important to take note? Okay, can we still prevent hypertension? Of course, definitely.
Yeah.
Okay, having a good lifestyle. okay, reducing your salt intake, okay, having a good diet, okay, during pregnancy could mean, okay, that you can prevent that, okay, pregnancy-induced hypertension. So again, let me just clarify here, no? Okay, high socio-economic, okay, level. So you consider least likely. It's more common to teenager, okay, from low socio-economic level. Are we clear? Okay, so I hope you take note some of the risk factors. Okay, number 2, okay? The nurse letter means that Miss Flores is experiencing a typical symptom of pre-eclampsia. Okay, so when she complains of, the answer is swelling of fingers. Okay, do we consider that swelling of fingers can be related to edema? Yes, definitely. Okay, so
Yung swelling of fingers kasi naipit sa cervix.
Umabot yung finger hanggang cervix. Ano ba yan? Ang haba.
Ngayon, paano mo nalalaman na may swelling of fingers?
Ano?
When the patient says the wedding ring doesn't fit anymore. Pero make sure that it's the wife that's saying that. Kasi pag yung isang nagsabi the wedding ring doesn't fit, baka kabit.
That's true, that's true.
Okay, di ba?
Okay,
Okay,
correct.
go lang. Wag niyo kakalimutan ha, bakit nag-swell yung fingers?
But definitely, sir, that's actually correct. No, when a patient would usually comment about the tightening of the wedding ring, that can also be a reason for patient developing PIH.
Yes. But make sure it's the wife who is complaining about the tightening. Kasi
Yes.
if it's not the wife, or Ian, nandiyan ka na naman, ano yung sinasabi mo?
Kaka-finger. Okay.
Alam mo ba pag nangyari yan, naalala ko tuloy may isang kwento.
Sir.
Okay? Kasi
sabi dito na sa
ganito, may magjojowa kasi. Di ba, alam mo naman magjojowa ngayon, walang pandemic, walang pambayad ng pera. Ay, pambayad ng pera. Pambayad ng private room. So, dyan na lang mga sa tabi-tabi, nagme-make out, no? Tapos mamaya, edi syempre, since kagagraduate na nga ng nursing, syempre pinagmamalaki yung mga regalong graduation ring. Okay. Edi syempre nga, yan, naghahalikan. Maya-maya, malikot yung kamay ni Jowa, bumaba. Tapos paghugot niya, ay shit, sabi niya ganun, naiwan yung sing-sing ko. Okay? Sabi naman ni girl, teka lang kukunin ko. Pag abot niyang ganyan. Sinuot naman ngayon ni Guy. Pagtingin ni Guy, hindi siya mapakali, sabi ni girl, bakit ka tingin ng tingin dyan sa sing-sing? Sabi niya, kasi itong sing-sing ko, sabi niya gano'n, parang St. Jude . Bakit? Iyak ako graduate. Tapos sabi ni girl, teka lang, tignan ko kung nasaan. Klang lang, paglabas niya, may UP, may UST, may Rizal, may Pamantas. Engineering, may nursing.
Tek pala ng bayan yun.
Tanglaan ng bayan. Tambunting. Sabi ni Aisa, habay daw.
Correct. Ang bunting tek.
Nakikinig ako kay Prof. Jem. Hindi tuloy siya makakonsentrate. Kasi naman, sarili ko na mag-share ng kwento. Di ba? Kaya mabuti kung graduation ring lang ang naiwan. Paano kung relo na?
Ang laki naman nun.
Okay. Bye-bye.
Okay, sir. So just remember, no, okay, that swelling of fingers can be related to the
naman do yung ko?
The excess weight.
Ano ba yun?
Okay. So it is very important.
Yung ko, anak, nakita mo ba yung ko?
Wait. Okay, ano daw?
Maingay, naghahanap ng singseng. Yung daw niya.
Ano yun? May naghahanap ng singsing.
Yung singsing niya. Ngayon lang niya naalala. Ano ba yan? Okay.
Ano ba yun? May naghahanap na ng singsing. Ay, kumamatay.
Ano ko, biglang naalala niya yung singsing niya.
Correct. Ano ba yun?
Hoy, mga tropang maniniyot, pwede ba ano nyo muna, paki-mute nyo muna at napaghahalata na.
May pumasok na singsing.
Okay, sige na, go na.
Okay, so again, okay, for pregnancy-induced hypertension, it is important to always check the blood pressure, reduce the sodium in the diets, and always consider, okay, monitoring the amount of calories. So it is very also important to consider the right patterns of weight gain. Okay, so we can identify some risk conditions that might compromise the conditions of both the baby inside and also the mother. Okay, okay, so for number 3, okay, ready? To monitor fetal status during home therapy, the nurse asked Miss Flores to keep a record of fetal movement patterns. The nurse would determine that teaching learning process has been successful when Miss Flores makes which of the following statements. Okay, so from our pointer, okay, so we have, I will count the number of times the baby moves, okay, in 30 minutes, 3 times a day, right? Yes, okay. So this is actually the usual method. The usual method that we use, okay, to identify the reactions and the conditions of the fetus inside. Okay? Okay, so what is important every time there is a movement of a baby, the mother is also instructed to monitor the strength of movements. Okay? So usually, mom, when do we tell the mother to monitor it? Usually, if it's 3 times a day, so you consider this in the morning, okay, mid-afternoon, and then late evening. Remember, the movements of the baby, okay, also shows the ability of the baby to respond to the stimulus and also to show that he or she is healthy inside the womb. Okay, so therefore it's letter A here in our pointers. Okay, number 4, to help Miss Flores avoid folic acid deficiency, the nurse recommends a diet with adequate folic acid content. Of the following types of foods, the one richest in folic acid is green leafy vegetables. Yes or no? Yes. Okay. So, mom, what if the patient is not fond of eating green leafy? Of course, it will still be complemented by the intake of folic acid supplements. Okay, that might be given by an obstetrician. So what we used to remember, it is very important to increase the folic acid since it is needed, okay, by the baby for faster and good, okay, growth and development.
And
Okay, the thing is,
Prof. Jem,
yes,
to prevent neural tube defects, your
yes,
myelin. So
that's
you
true.
need 400 micrograms of green leafy vegetables per day.
Okay, correct. Okay, so one of the reasons, now just like what Sir Ray has just said a while back, now this will also prevent now some problems related to neural tube defects. So it can prevent some form of spina bifida, meningocele, or myelomeningocele. So that's the importance of having the green leafy vegetables to increase the amount of folic acids, which is very important for the productions of erythrocytes. Okay, so number 5, okay, we have Miss Flores prepares her own meals at home. She says, I love vegetables and cook up lots of them almost every day. So the nurse should teach Miss Flores to avoid overcooking vegetables because the practice readily destroys the vitamin C. So Ma'am Jem, are you telling that too much cooking of vegetables can actually reduce some form of vitamins? Yes. Okay, so always remember, heat destroys certain nutrients in food, but especially water-soluble vitamins. So what are these water-soluble vitamins, such as vitamin C, okay, thiamine, and folacin? Okay, so it is therefore best to cook the vegetable in the shortest time, okay, and with least amounts of water possible. Okay, so ma'am, is it preferred to have or to eat raw fruits? Yes, but as much as possible, you have to wash it. Okay, not just to make sure that it does not contain bacteria, which may also cause an infection for the mother. Okay, so next, number 6. Of the following equipments, the least important to keep in Miss Flores' room readily available is, so what is basically our problem here? This is actually when the client now suffers from eclampsia. And we know that the existence of eclampsia occurs when the patient now is suffering from seizure. Okay? So that seizure, okay, or convulsion as we know it, no? Okay, we must readily have those equipments that can actually sustain the patency of the client's airway. So in the event that the client would have the seizure, we know that restraints are not necessary. Okay, ma'am, can we actually have a padded tongue blade? Actually, yes, but we don't actually insert it during the seizure. We can actually use it before so that we can be prepared to open the airway. Okay, so we could also have this as suction apparatus for aspirating some drooling to prevent aspiration, and definitely oxygen. So the question, Ma'am Jem, what if the patient suffers from eclampsia? Okay, so or what if the patient suffers now from what we call seizure? Okay, so what is our intervention? So definitely number 1, we need to remain with our clients. Okay, which one is a priority, ma'am, after remaining with the client? Is it giving oxygenation first or placing the patients in left lateral position? So initially, you have to increase, okay, perfusions of blood or circulations to the baby. So you do first left lateral recumbent position and then administer oxygen. Okay, so it is very important, no? Remember, okay, so if the patient suffers from seizures, so first you have to remain with our patients, then left lateral position, then oxygen, then check the fetal heart rate. Okay, ma'am, how about the medication? Definitely we administer magnesium sulfate as ordered. Okay, so that magnesium sulfate, it is important to always consider that we need to check the most important parameters. And these are what? BURP. Do you remember the BURP? The blood pressure should be expected to decrease. The urine output should be expected to increase. And the respirations and patellar reflex may be decreased but not depressed. Because once there will be depression of your respirations and your deep tendon reflex or your patellar reflex, you expect the client, suffering now from magnesium sulfate toxicity. That's why we have to make sure that once we are actually administering magnesium sulfate to our patients, we must always have the calcium gluconate at the bedside. So always remember that, okay? So again, restraints are not necessary. Are we clear? Okay. When the patient now would have this seizure. Okay, number 7, based on our knowledge of the pathophysiology of the pregnancy-induced hypertension and the physiologic changes of pregnancy, the nurse determines that the best position for Miss Flores to assume is definitely, a pregnant client should be placed in left lateral position. Okay, because what is important to consider is to enhance the blood circulation or the placental tissue perfusion for the baby will not be compromised. Okay, so as much as possible, we avoid the supine position, but just in case the patient remains to be in supine position, we can still adjust it. Okay, now by placing some by placing some folded towel on the right, back area of a pregnant client. So it will be slightly distending the uterus and causing a slight position to the left side as well. Okay, so that's one thing that we have to remember. Okay, so left lateral position is best positions for a pregnant client to improve circulation for both mother and baby. And we always consider that oxygen is necessary. And if we give oxygen to pregnant, we always consider the highest possible, like 8 to 10 liters per minute, because you are giving both oxygen to mother and the baby. Okay, next, number 8. Okay, for number 8, wait. Okay, gumalaw masyado. Number 8, okay, we have this. If Miss Guido has placenta previa. Okay, placenta previa. Okay, the most likely symptom will present, okay, is, what is the answer? Painless bleeding. Is bleeding a sign of danger signs during pregnancy? Yes, definitely, no? How do we actually differentiate placenta previa from abruptio placenta? Well, placenta previa is related to improper implantation. Okay, improper implantations of what do you call this? Improper implantations of the placenta to the uterus. So what we consider, this patient can have this bright red bleeding. Remember, it's painless, it's bright red, but it may lead to shock if it's not controlled. We usually identify placental problems on the third trimester. Okay, so when we talk about abruptio is premature separation. Okay, so if it's premature separation, that can be related to something, injury or trauma that occurs during pregnancy. So what we take note, the abruptio placenta is painful. And what type of, what characteristic do we observe from the blood? Dark red. So repeats, painless, bright red placenta previa, painful dark red, abruptio placenta. But the thing is, the fact that there is bleeding during pregnancy, the simplest nursing intervention that we can do is to keep the patient on bed rest. Do not forget it. Okay, so bed rests, okay, so oxygen, then intravenous fluids. Okay, so those things that we have to remember first. So bed rest, oxygen, and intravenous fluids. Again, no to internal examinations. If the bleeding cannot be stopped during the third trimester, we don't have a choice but to help the patient to deliver the baby so it won't cause fetal demise. So you expect the client to be in CS delivery, if the bleeding will not be controlled. Are we clear? Okay, so next, number 9. We have this, the nurse prepares Miss Guido for ultrasonography. Part of the preparation should be explaining to Miss Guido that the procedure, what do we have to remember when we say ultrasonography? Abdominal ultrasound is the best diagnostic test for pregnancy when identifying the presence of bleeding. Okay, and the thing is, this is basically painless. Okay, so what we just tell to the client, no consent, to be signed, and we remind the client to void or drink. Okay, we usually tell the client to drink fluids so that it would distend the uterus, and may cause an easier visualization of the baby. So what we consider, it's painless. Okay, no, it's painless. Okay, so ultrasonography. Okay, so Ma'am Jem, the question is, when do we start having ultrasound? Okay, if we think we are pregnant, usually after 8 weeks. Okay, after 8 weeks. Okay, so next, number 10. Miss Hall is discharged after her contractions are effectively suppressed. She returns later in the third trimester for pregnancy in questionable labor and is scheduled for amniocentesis. So the nurse should anticipate the preparations for amniocentesis should most certainly include, definitely the answer, having the patient empty her bladder. Remember, when we consider the term synthesis in a procedure, there is an aspiration. Okay, amnion. So therefore, aspirations of amniotic fluid. Okay, so Ma'am, when can we start having amniocentesis? Okay, it depends on which purpose do you intend to have it. Because if you perform amniocentesis on the second, don't forget, second trimester, the purpose of that is to identify some problems related to chromosomal abnormality. Okay, but if you perform the amniocentesis on the third trimester, then you could probably looking for a possible fetal lung maturity. But the thing is, this is insertions of a needle, which is guided by an ultrasound. So you need to prevent accidental puncture of the bladder. That's why you tell the client to void or empty the bladder before. So it is somewhat opposite to your ultrasonography. In ultrasonography, you have to consider telling the patient to drink before the procedure, while for amniocentesis, you need to tell the clients to void before the procedure. Are we clear with that? Yes or no? Okay, yes, very good. Next, number 11. So Miss Jackson is admitted to the hospital for evaluation. She receives an intravenous solution of 5%. I hope you are taking notes to what I am saying, okay? Because the purpose of rundown is to always make sure that you have the exact knowledge, okay? No, this is the
Yes,
exact
ma'am.
principle that you need to use for the test, okay? Okay, and just tell me if I'm quite faster, okay? So ready?
You're
Okay, so
doing
she received,
perfectly fine, Prof. Jem. Yeah,
uh,
that's very great of you reminding them that the purpose of rundown is to really consolidate the knowledge such that when you go to the test, everything is organized in the mind. So
yes.
that's the purpose of what we're doing today. So more of the content as well as the focus, less of the figuring out what's the answer for number one was, and we focus first and foremost on the discussion. Okay?
Yes.
Okay.
Thank you, sir.
Thank you for the reminder, Prof. Jem.
Pa. Okay, so the nurse is given discretion to decrease insulin dosages as necessary. If 10 a.m., okay, Miss Jackson blood glucose level is 80 mg per 100 ml of blood, and at 11 a.m., it is 90 mg per 100 ml. The best course of action for the nurse to take at this time is, okay, the answer is allow the insulin dosage to remain unchanged for time being. Why? Okay, because if you're gonna look for the blood glucose level of our client, it's still within the normal range. Okay, it is within the normal range. We just consider increasing the amount of insulin. Okay, if we know the fact that there is an increase, okay, increased level of blood glucose. Okay, so at this time you see, okay, that this is still okay normal. Okay, so you don't need to what? Okay, you don't need to increase. Okay, but you just have to okay continue. Okay, the usual okay dosage of the insulin. Okay. Okay, number 12. The hormone that is most probably implicated in playing a role in nausea and vomiting of pregnancy is your human chorionic gonadotropin. Okay, so remember, no, okay, we know the fact that once the client is pregnant, there will be elevations of different hormones, okay, including this human chorionic gonadotropin, the estrogen, the progesterone. No, we always consider that this HCG is a placental hormone that usually peaks at the first trimester. Okay, so it is good. This contributes to the client's nausea and vomiting, or what you know as your motion sickness. So as a nurse caring for a client with nausea and vomiting, we always consider to always maintain a good diet, good rest when they feel this motion sickness. Okay, no. Aside from that, now we always consider that estrogen is also responsible for nasal stuffiness. Now, when a woman would usually complain about having secretions on their nose. So that's basically for the responsible for that is the estrogen. Okay, or some form of cervical mucus that the mother would usually complain. That's also normal due to increased estrogen and progesterone as well. So what we're trying to consider here, okay, HCG, okay, is a common question that we need to remember for okay, experience of nausea and vomiting. Okay, okay. So next, number 30. An ultrasound is performed on Miss Hall before the amniocentesis, and explaining the purpose of the ultrasound. To Miss Hall, the nurse correctly evaluates the least likely the purpose of ultrasound at this time. So the answer here is measure the biparietal diameter. Now, please be reminded that when you see those okay, term, okay, okay, the term that you have to focus on least likely. Okay, least likely. Okay, so it actually tells you that there could be something wrong from the options. Okay, so the answer here is measure the biparietal diameter. But what's the purpose of biparietal diameter? Usually this is used to identify the head circumference. Okay, so the head circumference. So basically it's not part okay, when you use the ultrasound. Okay, so that's what we're gonna okay, consider for this. Okay. Okay. So, okay, again, okay, your amniocentesis is an invasive procedure, okay, that you always have to remind the client to void before, Okay, since it's ultrasound guided naman, okay, so that would actually lessen the puncturing of other parts. Okay, plus you always have to consider that there could be chances of infection after this procedure, so you have to monitor the temperature of our client. Okay, okay, so that's the thing there. Alright, okay. Okay, next, number 14. Okay, for number 14. Okay, the nurse performs nitrogen test to determine whether Mrs. Multo's membrane have ruptured. The nurse is justified in determining that the membranes have most probably ruptured if the color of the nitrogen paper. Remember, we tried to use the nitrogen paper if we suspect for a possible premature rupture of membranes. Okay, because we might think that the secretions or the fluids that the pregnant mother felt may be related to amniotic fluid, or this could just be a urine. Okay, so the thing is, okay, the color that signifies that this is amniotic fluid is blue. But what if I don't see the term blue on the test? Okay, is it possible that I can see in the option the term blue-green, blue-gray, deep blue? Yes. Okay, so the fact that we see the term blue, okay, whichever the combinations blue-green, blue-gray, deep blue, and that could mean that there is a leak of amniotic fluid. Okay, so other than that, you consider if it's olive yellow or just an olive green or yellow in color of the nitrogen paper, then you might consider that this is just a urine. At ayaw niya. Paano na to? Okay, options. Ngayon naman ayaw na mag-adjust. Okay, anyway, number 15. Okay, Mrs. Multo says, the doctor, okay, yung olive green means amniotic fluid tuloy. Urine. Okay, so what is important to take note, Glenna? Okay, blue. Okay, is positive. Okay, blue-green, okay, bluish-gray, okay, or deep blue. Okay, that's it. Okay, so for amniotic fluid. Okay, next, number 15. Mrs. Multo says the doctor, okay, says the baby is at +1. Okay? Okay, ganun hindi ito matanggal. Okay. Sir George, paano to? Bakit hindi na matanggal yung panulat? Okay. Hindi ko na makontrol. Okay. X po yung annotation. Hindi nga siya ma-X, Sir George, kasi nagsusulat siya.
Nagsusulat siya on its own.
Opo.
Okay. I
Okay.
think you just have to go through the annotation.
Taasan muna.
Ayan. Pag pinipilit ko yung X, nagsusulat lang. Okay. Okay. Anyway, number 15. Okay, so +1. Okay, ayun. Okay, tapos pag-adjust ko, hindi na rin makontrol. Anyway, okay, so what does it mean? The nurse correctly explains that the point to which the baby has descended during labor is described as station. Okay, when station is considered +1, the part of the baby to be born first is located at 1 centimeter below the ischial span. Remember, when we are trying to identify the term station, we are looking for the descent of the fetus head. Okay, and we know if this is going to be measured by centimeter, so usually we consider negative or positive. If it's going to be -1, -2 centimeters, we expect that the baby is still floating. Okay, but if it's going to be +1, okay, +2 centimeters, we know that the baby is about to be delivered or the baby is on crowning stage. Okay, so that station will help us to identify, okay, the location or the descent process of the baby's head, okay, to the pelvis of the mother. Okay, so therefore, okay, it's letter B. 1 centimeter below, okay, means, okay, the baby is now, okay, on the crowning stage, okay, and maybe, okay, to be delivered in few hours. Okay, next, number 16. newborn baby multo is assessed by using the Apgar rating system. If his score is 8, the nurse can safely determine that the newborn's physical condition is. We know we consider that when we talk about Apgar scoring, we perform it twice. Okay, after 1 minute, okay, no, postpartum, we check the client's or baby's Apgar score to identify the adaptation of the fetus from the labor and delivery. Then after 5 minutes, we assess again for the Apgar score to identify the adaptation of the baby to the new environment. Okay, so what we used to remember, okay, there must be a good considerations, okay, for the baby's response if they have this 8 to 10 in their scores. Okay, so the higher the scores the baby will get from the Apgar score would mean a better results. Okay, so 8 okay to 10 is actually good, but when we see the term 4, okay, or between 4 to 7, so that might be considered that it's fine, but there should be a complete monitoring for our patient, or the patient might be considered to be stimulated further. But if it's going to be less than 4 or 0 to 3, resuscitation may be considered. So what we used to remember that 0 to 3 okay, would be not a good indication. 4 to 7 okay, would just be fair, but it requires monitoring, okay, and some form of oxygenation if it's necessary. And then 8 to 10 will be the best score for our patients. Okay, Apgar score. Okay, don't forget it. Next number, okay, 17. Which of the following acid-base imbalances is Mrs. Nichols likely to experience when she hyperventilates excessively? Definitely. Hyperventilation leads to what? Respiratory alkalosis. No, wherein the carbon dioxide, okay, insufficiency, okay, leads to respiratory alkalosis. And how do we simply revert the problem related to this? By telling the mother, okay, to breathe through a brown paper bag. Okay? Okay. So next, okay, paper bag. Okay. Okay, next number, okay, 18. If Miss O'Malley's cord prolapses, initial and immediate nursing measures should be directed toward helping relieve pressure on the cord. That's true. Okay, why? Because we don't want to compromise the circulations of blood from the mother to the baby. So if this cord prolapse, okay, occur, okay, we need to consider removing any pressure on the cord. If this is, for example, the head of the baby compressing the cord, then we need to lift the baby's head. Okay, as much as possible, okay, what we consider position the patient correctly. What is the best position if umbilical cord prolapse, okay, occurred? Okay, do you still remember? Okay, what is the best position that we okay consider? Very good. Now we consider Trendelenburg or Nietzsche's position. Okay, so first elevate the part okay causing pressure. Then second, okay, place the mother into Trendelenburg or Nietzsche's position. Then administer oxygen 8 to 10 liters. Mom, okay, the exposed cord should be covered with a sterile saline. Okay, so you need to get a wet sterile dressing to cover the cord so that it will not dry. Because once it dries up, then the problem now would be impeding the circulation to the baby. And expect the baby will not be delivered into normal spontaneous delivery. Expect that this will be CS. Okay, not cesarean delivery.
Do not reinsert the cord. Do not reinsert the cord.
True. Do not reinsert the cord. That's
and
true.
do not attempt to deliver and cut deliver the baby and cut the cord if you don't have sterile equipment. Okay?
Exactly.
So kahit malayo yung ospital, dalhin sa ospital. Ngayon, pag malayo-malayo yung ospital, walang masakyan, maglakad. O ngayon, wala pa rin talagang ospital, di lalaki yung bata, dala niya yung placenta niya.
Okay, naging toddler na yung bata papunta ng ospital.
Gagawin niyang payong yung placenta niya. Okay?
Inabot na kasi ng summer sa init. Okay, next, number 19. Okay, pelvic measurements are obtained on Mrs. Sanchez. A pair of waterproof gloves are required when the measurement to be obtained is diagonal conjugates. Okay? So remember, okay, when we talk about obtaining diagonal conjugate, this requires us to use gloves. But always consider that it involves vaginal penetration. Okay, it involves vaginal penetration. Okay, okay. Next, okay. So let's actually go with another question so we can define the difference of the true conjugate from diagonal conjugate. 20. The pelvic measurement that is most important when determining whether Mrs. Sanchez pelvis is adequate for vaginal delivery. The answer now is the true conjugates. Okay, so when we talk about the true conjugate, okay, so this is basically the most important pelvic measurements. Okay, we commonly know this as your obstetric conjugate. Okay, whether a woman's pelvis will allow for a normal vaginal delivery. So, Ma'am Jen, can we consider that those patients with cephalopelvic disproportion may not have a good true conjugate possible? Okay, so that's the thing that we have to remember. So this will tell us whether you will be allowed for normal spontaneous delivery, or we just consider that you better have that cesarean delivery. Okay, next, number 21. Okay, baby Thomas is breastfed immediately after birth and then falls asleep. Ganun talaga minsan. Pag nagpapadede, nakakaantok. Charot. Miss Thomas asked the nurse when she should next breastfeed her infant. The nurse should base her response on the knowledge concerning a newborn's activity periods and therefore should tell Miss Thomas, definitely. Answer is plan to feed the newborn in about 2 to 4 hours. Okay, so always remember that the newborn is awake and alert for about the first 30 minutes after delivery. Okay, when he may be fed. So then usually falls asleep for about 2 to 4 hours. When he awakens, the newborn awakens, can be fed again. So typically the newborn will not awaken to eat while he is in sleep phase. So what is important, we need to consider the regular breastfeeding pattern, okay, that will help the baby to get the right nutrients. Remember, breast milk is most important for the first 6 months of life. Okay, so that is basically the baby is dependent merely on the breastfeeding. Okay, next, number 22. This one is quite familiar. Baby Thomas is ordered to have an intramuscular injections of phytonadione or aquamephyton. So which of the following muscles is most often recommended as best to use? We know, okay, that this is what? The vastus lateralis muscle. Okay, we commonly use that for newborn as the safest, right? Okay, gluteus is not commonly recommended. Why? There could be some sort of injuring the sciatic nerve, most especially if they are not yet walking. Okay, that might compromise their walking ability later on. Okay? Okay. So vastus lateralis muscles, okay, for baby. Okay? Although in some if we have problems with the muscle of the baby, sometimes we consider trying to help the baby to have a more muscle by giving feedings before we could actually perform some form of injections. Okay, so sometimes it depends also, but definitely it is most likely that vitamin K will be administered through vastus lateralis. Number 23. When the nurse accidentally bumps the basenet, okay, baby Thomas throws out his arms, okay, hands open, and begin to cry. The reflex baby Thomas is demonstrating is called the Moro reflex. Remember, this is also termed as startle. Yung nakakagulat. Ganun ba yun? The gulat reflex.
Prof. Jem, when does it disappear?
Usually, it's about 3 to 4 months.
And what happens if it goes active beyond 6 months?
Usually, it's related to neurological disorder if it's still present after 6 months.
Yes, usually they could be having Tay-Sachs disease.
Tay-Sachs disease.
Which is common among the Jews.
Yes.
and could potentially lead to CNS irritation. That's why
True.
the moro reflex, which is the most sensitive index of CNS integrity in the child, remains hyperactive. So dapat after 3 to 4 months, wala na dapat ang moro reflex. 'Di ba, Prof. Jem?
Yes,
Lagi
sir.
turo sa pedya, the moment the child begins to attempt to turn around, nawawala na ang moro reflex kasi nga
True.
parehong protective reflex ang moro and turning.
True.
Okay.
Thank you, sir. Okay, next,
Okay.
24. In preparing for modifications of Ms. Thomas' plan of care to include continued postpartum psychosocial adaptation, the nurse would anticipate the optimal phase for providing teaching, learning experience for infant care skills and personal hygiene skills will be when Ms. Thomas is when reaching the following postpartum psychological adaptation. No, we are being reminded with the terms taking in, taking hold, letting go. Okay, no?
Di
We
ba
know
kanta
that
yun? Let me go to know the truth. It's not so hard to find. Di ba ganon? But
yung
it's
ba yun? Akala ko yung Letting Go by Frozen. Charot.
ah, let it go, let it go. Yun eh.
Yes! Okay.
Kaninong team song ang Taking Hold?
Kanino yan?
Yung nagmamasturbate, Taking Hold.
Nakakaloka.
Di ba? Parang doon nagbi-Viagra na mahilig kumanta ng You Raise Me Up.
Kasi lagi matigas pag nakabayakra eh.
Okay. Di ba yun ang team song nila? Okay.
Okay. Anyway, okay, so when we talk about taking in, taking in would usually be focusing on the emotions and experience of the mother. So usually the mother would complain about, I am so tired, I want to take a rest, okay, I want to eat, I'm so hungry. So that is usually taking in. But when we talk about taking hold, okay, this psychosocial adaptation where the mother is concerned with the thing that she wants to do something. Okay, so in short, this time, the mother is ready to learn about something related to self-care and also related to infant care skills. So that's the question now. Okay, providing teaching learning experience for infant care skills and personal hygiene skills. So taking hold, is that what we are trying to consider? Okay, learning about self-care, learning about infant care skills. Okay.
Sigad po.
Okay, Yasmin. Okay, very good. Okay. Okay, letting go is basically the preparations of both parents to meet the demands of the baby. Number 25, Miss Thomas wishes to start postpartum exercises. Which of the following exercises should the nurse teach her to use beginning on her first postpartum day? So the answer here is, while in supine positions with knees flexed, inhale deeply while allowing the abdomen to expand, and then exhale while contracting the abdominal muscles. Right? Okay, so the thing here, what exercise do we actually help the client? Performing exercises that could strengthen the abdominal muscles. Okay, and how to do it? It's basically written here. Now, while in supine, knees flex, inhale, exhale. Okay, so the proper way of breathing. Okay, so as much as possible, exercise should not be strenuous right after delivery, but something that could help the client to regain some form of control with their abdominal muscles. Okay, number 26. If Miss Thomas experiences after pains, positions in bed she could assume to help relieve them is prone position. Okay, so but definitely if it's prone, you have to consider placing a pillow under the abdomen to apply additional pressure. Okay, that may increase comfort or relieve the pain of our patient. So even if it's prone, you have to place a pillow on it. Okay. Okay, next, number 27. Miss Underwood says, I'm worried that I won't be able to nurse my baby because my breasts are so small.
Gaano ka small? Gamunggo.
I think size doesn't matter. Charot!
Kapag kakamalang nunal yan sa first night ng honeymoon, di ba?
Bakit? Bakit? Bakit na pagkakamalang nunan?
At pantay na pantay pa. Kawawa naman ang boyfriend niyan sa wing palad, walang makakapa.
Baka naman susi.
Oo, Suso. Suso nasaan? Kaya Susan ang pangalan.
Ano yung Susan? Susan nasaan?
Suset, Suso
pwede
maliit.
ba?
Ay, nako. Pero hindi naman kasi, there's no relationship between breast size. Di ba, Prof. Jem?
Yes, I know.
And the ability to nurse a baby and the father. Correct? What
True.
matters to the father is, meron nasasaktan, harsh daw tayo. Ito siguro yung mga miyembro ng Tabla Incorporated. Mga babaeng puro likod.
Back-to-back organization.
Ayoko na nga. So pag sumasali ako, nadidistract kayo eh. O sige, go.
Okay lang, sir. Nag-enjoy nga kami. Okay, next, number 28. Ayoko na. Tinamaan din ako dun sa back-to-back organization. Okay, next, number 28. Again, breast size does not influence the ability to nurse a baby. What is important, you are producing a good amount of milk. Your prolactin is basically stimulated because that's basically the part of the brain in the pituitary, a pituitary hormone that helps in secreting milk. Number 28, your prolactin. Do not forget it. 28, Miss Van Slicky is using a commercial pre-modified milk for her baby's formula. The nurse teaches correctly that commercial pre-modified milks are diluted to have approximately the same number of calories per ounce as human milk. So we know that this is equally the same as your 20 calories. So again, mother's milk normally contains about 20 calories per ounce. So equal pala dapat. 29. As a general rule, approximately how many calories each day per pound of body weights are required by newborns in order to maintain normal growth and development. So the answer here is 55 or 50 to 55 calories. Mom, what is our general rule? That most newborn requires about 50 to 55 calories each day per pound of body weight. Or we can say in the other way around that it's 117 calories per kilograms of weight. Okay, number 30. Miss Anderson uses the terminal method of sterilizations when preparing formula. She uses clean equipment and formula. Then she then sterilizes filled, loosely capped bottles and places them in a tightly covered boiling water bath. The minimum number of minutes most authorities recommend that bottles of formula be kept in boiling water. But when using terminal sterilization, the answer is 25 minutes. Okay, but after you do that sterilization, you have to keep the bottle also, or the bottles of formula are then stored in the refrigerator, just to make sure it will not be contaminated if it's not in use. Okay, in number 31, okay, Miss Crawford children are all living and include one set of twins and one set of triplets. At this time, what gravida is Miss Crawford? This one is quite confusing, no? Kasi ang nakalagay lang sa kanyang obstetric history, okay, one set of twins and one set of triplets. So in terms of gravida, para i-consider lang natin siya as gravida 2. Tama ba ako rito, Sir Ray? Kasi nakalagay 7. Okay, baka nagkamali lang ng type. Okay, kasi one set of twins, one set of triplets. Okay, so please correct na lang. Okay, so we consider that this is a gravida 2. Okay? Okay, so next, number 32. The routine nursing assessment of Mrs. Moore's episiotomy would be least likely to include assessment for pallor. Okay, Ma'am, when we are considering assessment, we actually consider the term REDA. Have you ever heard the term REEDA? Okay. Now, what is our REDA? Redness, okay, edema, ecchymosis, discharge, and approximations are usually Okay, the signs that we look for a possible infection to episiotomy. Repeat. If you are trying to find out possible infection manifestation to episiotomy, so we have RIDA. What is RIDA? Redness, edema, ecchymosis, okay, then discharge and approximation. Okay, next. So here, okay, it includes okay, pallor. Okay, next number 35. Oh, it's not moving again, Sir George. Okay, ayaw niyo bumaba. Okay, I think I'm out of control. Charot. Number 33. Oh, are you learning? I hope so. Okay,
Yes
30.
po.
As part of the
Yes.
preparation, okay, as part of the preparation, okay, for assessing Miss Moore's perineum and anus, the nurse should decide that the best position for Miss Moore to be placed in the assessment definitely Sim's position. Okay, because you want to see the bottom, okay, no, the top leg, the bottom leg, okay, and usually the nurse lifts the top buttocks, okay, to expose the perineum and anus for assessment. Okay. Next, number 34. This one should be mastered already. Okay, since Miss Newsom is considered at risk for thromboembolic disease, the nurse plans to assess her for signs and symptoms of the disease. The nurse decides that nursing assessment most likely to identify symptom of thromboembolic disease. Okay, so it's related to what? Homan sign. Do you still remember this Homan sign? This is actually used to identify deep leg vein thromboembolic disease. Okay, so this sign may or may not be positive, but usually results in tenderness or pain due to calf pressure. Okay, due to calf pressure. That's why for most postpartum clients, we always consider encouraging them to walk immediately. Okay, why? Because that can prevent thromboembolism. Okay, by means of helping the client to have a good circulations after delivery. Okay, next, number 35. The nurse observes baby debusque, gagging on mucus, and becoming cyanotic during the first feeding. Of the following measures, the first one the nurse should take is to remember when we consider the term mucus becoming cyanotic, it means there is an obstruction of airway, right? Yes or no? Yes. Okay. So what we used to remember for here, okay, clear the neonat's airway with gravity or suction, right? Okay, because that means there's obstruction, and the best thing that we can do is to clear it out. Okay, so the answer: clear the neonat's airway with gravity or suction. Next, number 36, Sir George, pakiano naman, adjust. Okay, thank you. That's it. The nurse measures the circumference of the head and chest. If baby Jones is normal, it will be typical to find that when two measurements are compared, the head will be, answer, 2 centimeters larger than the chest. The question that would possibly arise on the test could be, what is the purpose of measuring the head and chest circumference? Okay, the purpose of that is to identify the presence of congenital hydrocephalus. Congenital hydrocephalus. Or in the other way around, we can say that it can help us identify the Arnold Chiari malformation. Do you still remember that from our neurological subject? No, it can be an indications of Arnold Chiari malformation. The thing is, how do we consider the right or normal range of the head circumference? Usually, it's 33 to 35 centimeters if it's head circumference. Okay, head circumference 33 to 35 centimeters. While the chest, okay, circumference can be from 31 to 35 centimeters. 31 to 35. So again, the head is usually larger than the chest by 2 centimeters. Okay, so that's normal. So next 37, baby Jones anterior fontanelle is normal if it's shaped like anterior fontanelle is here. Okay, then posterior fontanelle is here. So it's basically what? Diamond. Okay, for anterior fontanelle, okay, it's basically what? Diamond. What is the shape of the posterior? Triangle. Okay, triangle. Are we clear? Yes or no? Okay, yes. Okay, next. number. Okay, when do we expect that the posterior fontanelle will be closed? At what age of the baby would be expected that posterior fontanelle will be closed?
2 to 3.
Sorry? Okay, 2 to 3 months. Very good. 2 to 3 months.
Posterior,
How about the
ma'am?
anterior fontanelle? Anterior fontanelle.
12 to
12 to
18.
18 months. Very good. Okay, very good. Okay, 12 to 18. Good. Okay, next number 38. Which of the following observations in relation to baby's Jones cord should be reported to the physician promptly? So the answer is the base of the cord stalk is moist and pink. Remember, if the umbilical cord would usually have this type of manifestations, then you expect that there could be an infection. And you need to call the doctor immediately. Yes or no? Yes. Normally, the umbilical cord should be dry and fall off within 5 to 7 days. Okay? If it's normal. Okay, but signs of infections may be present when there is moist observations and pink in color. Okay? So that's the thing. Next, number 39. The nurse should expect to find that of the following senses, the one that is probably most highly developed in baby's Jones, definitely touch. That is basically true. Why? It is believed that the sense of touch is most highly developed at birth. No, it is probably the reason that newborns respond well to being touched. That's true. Okay, a baby would have this different reactions if we try to touch them, right? Okay, so next, number 40. The most likely reason for Miss Fullingham's sensitizations of the RH factor is that she, the question is, what about hearing po? Hearing is also there, but you need to stimulate it. But just focus on the question first. Focus on the question, okay? So the most likely reason for Miss Fullingham's sensitizations to RH factor is that had an RH positive infant for the first time she was pregnant. That's true. Okay, when do we expect that RH incompatibility will result? Okay, if the mother is RH negative and the baby is RH positive. Okay, so to prevent that problem on the next pregnancies that the parents or the mother would be considered in the future, the mother should have received the ROGAM. Okay, so the ROGAM can be given at 28 weeks of pregnancy and within 72 hours after delivery. So usually if the mother would develop this RH sensitization that without ROGAM, later on it will be a problem for the next babies. Okay, so therefore next, number 41. Which of the following effects of hemolysis due to RH sensitization is least likely, do not forget the term, least likely to be present in baby. In baby Fullingham at the time of delivery. Jaundice. Okay, why, Ma'am Jem? Jaundice is not present at birth because the mother's liver breaks down the bilirubin and excrete it. So therefore, when we talk about hemolysis, we commonly see the term anemia. Okay, anemia if it's hemolysis, because anemia is due to the destructions of RBCs by antibodies when the patient is suffering from hemolytic disease. Okay? Okay, so that's the thing that we have to remember. Clear? Okay, so that's the first part of our round. Now let's B1. Okay, B1. Okay, but I think I need to discuss as well the B2. B2 for this sets. Okay, so please, Sir George, help me to bring out the B2, and for our nurses, colleagues, bring out your B2. Wow. Okay. Okay, B2. O, si di nga, hindi mo siya makakontrol. Okay. Yeah. Okay. So please prepare the B2 while we are trying to look for the system here. Okay. Why are you learning? So let's do first some chatting while Sir George is fixing our computer. Okay. So let's have some chat over there. Okay. Oh, are you still learning? Because okay, maybe your anxieties are okay
Yes, ma'am.
well controlled, but for now, I hope you control your anxieties. Okay, because no, it would definitely affect the way you think during the actual test. Okay. So the thing is, your anxiety should not cause you to have some sort of a problem when you take your examinations. Are we clear? Pwede na. Thank you. Okay, are we clear with this? Okay, so I hope. Okay, so yes, I hope everyone is learning. So this time, okay, what we do is conditioning of the topics that you need to focus on the test. All right. Okay, so please, let me know if you have already your rundown set D2. Tan 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 tan. Ma'am Jem, may COVID po kaya nalalabas on exam? I don't. I think when there's a with possibility of COVID, I don't think you are not aware to what is really happening. Do you need to study about COVID? Well, in fact, every day it's part of our living. Okay. Do you still have to worry about it since you experienced it now? Okay. Miss Aslam po, pwede po bang magpa-breast milk ang may breast cancer patient? Okay. Normally, okay, if the formations of the prolactin is affected, of course, not anymore. Okay, so there might be some sort of a problem with the chemotherapy drugs. So basically, we don't advise, most especially if they have these treatments. Okay, Ma'am Jem, are these possible actual board questions? Fatima, definitely yes. Okay. Okay, what if HIV positive mother po? An HIV positive mother cannot do breastfeeding. Okay, as much as possible because the antibodies can be possibly be given to the mother. So no to breastfeeding. Yung tawa niyo po parang si SpongeBob. Talaga ba? Ewan ko sa'yo. Okay, well anyway, I'd like to thank everyone. We are 293. At least for some who may not know me, I'm Prof. Jem. I'm the sweetest angel here on earth. Okay. Can we follow you on SOCMED? Definitely you can follow me. You can call me Liza Soberano. Just kidding. Okay, you can look for my name. Please give my Facebook account. So I think I'm gonna place it here. Okay, so my name is Jem Karaig. Yan. Third account. So you look for that account, or you can just look at my where's this? Instagram account. Parang Mariel Padilla yung voice and tawa. I know, right? Okay, anyway. Okay, again, we're praying for everyone's success. But now, to be serious, no, I want you to focus on the things that you need to. Okay? So, I hope you have your rundown set B2. Okay, ready? Let's discuss. Number 1. Okay, so which of the following observations would indicate that Teresa, a patient with Guillain-Barré syndrome, is ready for oral feedings? Ma'am, when we talk about Guillain-Barré, do we consider this chronic or acute? Let me know your knowledge. Come on. Chronic or acute? It's going to be acute. Okay, so therefore, can the patient have complete recovery from Guillain-Barré syndrome? Yes. Okay, the question is, if we talk about Guillain-Barré syndrome for children, does it actually last for a 1 to 2 years of recovery? Yes. Okay, no? So usually it would take 1 to 2 years for complete recovery to occur for Guillain-Barré syndrome for children. Okay, so the thing is, the answer here is the patient gags when the nasogastric tube is repositioned. Yes or no? Yes. So one thing that we have to remember here, impaired gag and swallowing reflex associated with cranial nerve involvement requires nasogastric tube feeding in a child with Guillain-Barré syndrome. Therefore, the presence of gag reflex indicates the return functions of normal swallowing. That's correct. Okay? Okay, number 2. Okay, after several weeks, Okay, Teresa is transferred from the intensive care units. Okay, the general pediatric units. The nurse develops a discharge plans for Teresa with her parents. So which of the following interventions would be appropriate for the nurse to include in discharge plan? So the fact that we consider that the client is recovering, rehabilitation plan is necessary. Yes or no? Yes. And it should always include the family. That's why the answer here is you need to develop a rehabilitation plan that includes orthopedic care, because you expect that there are some muscles that are not used because they have to lie down in bed for several days, sometimes weeks or months. So that compromises their ability to move, to do an actions. So what we do, the family should be involved in developing rehabilitation plan as much as possible, the earliest possible that we could actually ask the family to be with. The convalescent period for a child with Guillain-Barré is lengthy, and I did tell you the full recovery may require 1 to 2 years from this Guillain-Barré, and most children recover completely. Okay, only 10 to 15%, only 10 to 15% have neurologic sequelae. So it means there could be chances that there will be a neurological problem, but it's about 10 to 15%. So maintaining peer relationship during convalescence is important for psychosocial development. Okay, so mom, can they still attend to a regular schooling? Definitely yes. You can still allow them to attend a regular school. Remember, this is a form of psychological adaptation. So it should not compromise their way of learning. Okay, next, number 3. Teresa refuses to do her arm exercise. Which of the following nursing actions would be most appropriate? Definitely, you have to increase the interest of wait, what's that? Okay, you have to increase the interest of the child. And to increase the interest of a child in an activity, you have to consider play. Okay, so the answer here is what? Play a game of catch with a patient with a large ball. Okay, so definitely we have to consider the term therapeutic play. So when we say therapeutic play, you have to consider the age of the child, which type of play will be necessary and appropriate to their growth and development. So therefore, the answer is letter A. Next, number. Okay, the nurse is aware that Nikki's fear of darkness can be explained by Piaget's theory of intellectual or cognitive development. What
Ano mo
concept?
ulam niyo? Wala akong baon.
Ako, anong gusto mong baon? Kaya kita ngayon. Charot.
Fried chicken na lang.
Charot lang. Okay, yung mga baon-baon nyo, huwag nyo munang ano yan dito. Gigigil ako sa inyo, ha?
Ano ba yan?
Iba kaya kita. Charot.
Usapan ko, Jem. Sige, go na tayo. Mamaya na yung ulam. Oo, mamaya na yan. Go na tayo. Ayan,
Number 4.
tuloy, yung walang ulam.
Okay, walang ulam, bili na yung nakarinderya.
Tumama yung sing-sing sa kanin.
Okay, gora na tayo, di ba? Enjoy kaya may mga ganong keme. Okay, food is life.
Baon daw, sabi ni Connie. Sabi ni Annalie, baon na lang po for our mind. Tama naman yan. Okay. Go, Prof.
Malapit na naman. Nagutom ka pa ba? Ganon. Suserot si Madam. Okay, the nurse is aware that Nika's fear of darkness can be explained by Piaget's theory of intellectual or cognitive development. What concept in the pre-conceptual phase, cognitive development explained Nika's fear of darkness? So we call this term as animism. So the concept of animism, in which the child attributes life-like qualities to inanimate object. Okay, it's basically one of the most peculiar and unique characteristics under pre-conceptual phase. So usually when we talk about the pre-conceptual, the child learns to associate something into another existence. No? So therefore the answer is animism. Okay? Okay, next, number 5. Okay, Mrs. Zeeb, says that she will be glad when Charles can brush his teeth without her help. She asked the nurse at what age Charles will be able to do this. the nurse should respond? The answer is 6 years. Ah, okay. Why do we consider that 6 years? Okay, so from here, okay, children under age of 6 do not have the manual dexterity needed for toothbrushing. In short, okay, below 6 years old, we don't have yet the good holdings for a toothbrush to clean or brush our teeth. Okay, but parents should supplement toothbrushing efforts of preschool age. So even if you are not yet good in performing brushing the teeth, still the parents should consider helping the child to clean the teeth so to prevent the dental caries later on. Okay, number 6. Okay, during the asthmatic episode rather, Jordan has difficulty of breathing and attempts to take in more air by breathing deeply. The nurse recognizes that this compensatory mechanism frequently results in the acid-base imbalance of respiratory alkalosis. You know, that is basically noted that once as asthma is occurring, you expect for hyperventilation. Am I right, Sir Ray?
Yes, Prof. Jem. Meron ako niyan eh. Meron akong asthma. So,
Yeah.
linawin lang natin. Itong tanong kasi ang tinatanong ay compensatory mechanism.
True.
Okay, so pag compensatory mechanism, tama si Prof. Jem, mag-hyperventilate ka, you lose carbon dioxide, so alkalosis.
True.
Pero, during the asthmatic episode, pag ang tanong hindi compensatory mechanism, usually, because of restriction in the exchange of oxygen and carbon dioxide at the alveolo-capillary membrane. Masyado yatang malalim yon, abot hanggang cervix. Okay? So pagka during the asthmatic attack, ang wag mong kakalimutan, usually nag-acidosis. Pero pag nag-compensate na yung katawan dahil may acidosis ka na, hyperventilation, sabi ni Prof. Jem, tama. Hyperventilation ng compensation, kaya you lose more carbon dioxide, so there's less carbon dioxide that binds with oxygen, diminishing now the formation of your carbonic acid, so leading to respiratory alkalosis. So wag kakalimutan, ang keyword dito, yung word na compensatory.
True.
Kung yung word na compensatory, kung ang tinatanong, effect ng asthma, ay acidosis yon. Pero effect ng compensatory mechanism, which is, sabi ni Prof. Jem, hyperventilation, tama, respiratory alkalosis yon. And don't forget, the drug that you have to have pag may asthmatic episode, epinephrine, because it promotes dilatation of the bronchioles.
True.
Don't forget to differentiate your cromolyn and theophylline. For prevention of asthmatic attack, then use cromolyn. For treatment, meaning inaatake na ng asthma, okay, then use theophylline. Now, the procedure that will predict an asthmatic attack, that's your peak flow meter. Okay. Tama, Prof. Jem.
Okay, thank you, Sir
ko
Ray.
lang yung experience ko kasi asthmatic ako.
Okay, we learned from that experience very well. Okay, 7. Babies to have postural drainage. It is best for the nurse to plan carry out postural drainage. So definitely when the term sees like postural drainage, you remove the secretions from the pulmonary area. So the thing is, we have to prevent the regurgitations of food. We have to prevent aspirations. So you plan to perform it before meals. Okay? So the purpose of that is definitely to prevent vomiting and cause aspiration problem to our patients. Okay? So next, number 8. Debbie is placed in a mist tent. The primary reason for using this tent for Debbie is that it helps. In Bisaya, you call it suob eh. Diba? Okay, but the thing is, the purpose of this is to reduce the viscosity of child's respiratory secretions. And always remember that if a child with respiratory secretions coughs frequently, you must avoid giving cough suppressant. Why? Because cough is a reflex that could help us to remove the secretions. Okay? So do not suppress the cough because it's necessary to remove the secretions. Okay?
Prof. Jem, yung suob, hindi sa Bisaya yon, sa Ilocano yon, sa amin yon. Pag inangkin eh, no? Pag sinabi sa amin na suob, yun yung smoke na meron sa plants na pinapausok, hindi papausukan mo yung tao. So that's the original concept ng suob. Now, with the concept of COVID, pinasosyal naman nila ang suob. Ginagawa naman nila sa rice cooker, tas lalagyan ng Vicks. O sa Bisaya daw tuob. You see? O, kaya, tuob sa Bisaya. So sa Ilocano, Oh, di ba? Oh, sabi ni Roy, may kakampi ako. One, sir. Come on. May mga kakampi. Asan na yung mga tropang dugyot ko?
Tuog pala.
Suob sa Bisaya. Then
Suog
suob.
pala is from Ilocano.
Oo. Ngayon naging social na yon, ginagawa nila sa rice cooker. Pero sa Ilocano talaga, para kang may palayok tapos may mga dahon-dahon doon, susunugin mo pag umusok na yun yung i-inhale mo, kaya tinawag na suob.
Steaming siya na, sir.
Hoy Winnie, iba yung sukob. It's a yung suob, sukob, Winnie, yun yung pareho kayo ng ikinasal sa isang taon. Yan.
Ay. Kailangan pala iwasan ko yan.
Correct. So pag magpapakasal ka, dapat hindi kasabay yung kapatid mo. Sa isang taon. Okay? Okay.
Thank you, sir.
Take it away. Suob daw sa Bisaya. Hoy, Glofel, iba naman yung kutob.
Yung kutob na yan, pag laging magkasama ang parehong...
Patawa talaga kayo kung ano-ano mas sinasabi nyo. Okay, go.
Okay, next number. Okay, continuing the cardiopulmonary resuscitation assessment, the nurse palpates for a pulse. So which of the following sites is best to check for pulse during the CPR in a 5-year-old child? We commonly identify pulses now when performing CPR according to age. If this is infant less than 1-year-old, we commonly use the brachial. But after 1-year-old, like children and adults, we commonly use the carotid pulse.
Prof. Jem, so commonly use yung carotid. Bakit kaya, nag-isip lang ako, ba't kaya hindi femoral?
Sa adult, okay yung femoral. Sa bata, hindi pa pwede. Charot.
Doon ka mag-a-assess, pulseless, nakaganong ka.
Nakabuka. Tsaka pag gwapo, dapat femoral talaga. Charot. Hoy, baka isulat niyo yan, ha?
Protocol, ang pag-a-assess ng pulse ay sa femoral. O, di ba?
Pag gwapo, sir, femoral agad.
Sila. O, sabi, pag gwapo daw pwede femoral. Ay, nako, kahit gwapo pa yan, kung maghapong nagtrabaho, nagiging salty.
Parang, hindi naman siya salty, medyo konting alat na. Charot. Ano ba yung asim? Baliw kayo.
Imagine mo, Prof. Jem, kung magsi-CPR ka, amoy ang hit daw. Hayat, kadiri na. Prof. Jem, imagine mo pa magsi-CPR ka na femoral pulse ang kukunin mo. Sige nga. Paano? Sasabihin mo, breathless. Tapos, di ba, ipapasok mo yung fingers mo dun sa may area. Pulseless.
Aray, naloka ako. Ay, nako.
Ay, nako, ewan ko sa inyo. Okay, go.
Okay, so going back, okay, so when you palpate the pulses, it should be not more than 10 seconds. As much as possible, okay? Not more than 10 seconds. Then, when providing chest compressions, the nurse should compress the chests to a depth of, since this is child, now when we talk about 1 to 8 years old, 1 to 8 years old is considered to be child in CPR. So we commonly use 1 to 1.5 inches. If it's infant, the depth should be maximized up to 1 inch. And if it's adult, it can be maximized up to 2.4 inches. Remember, the depth of compression should be considered good enough to cause a vacuum or chest recoil. Okay? To promote a better...
May tanong ako. Pag sumobra sa 1.5, anong organ ang nadadamage?
Usually, it's the liver.
The liver, di ba? Ngayon may tanong pa rin ako. Bakit bawal yung mga nasa ER, di ba? Usually doon sila laging na-expose na mag-CPR. Okay? Bakit bawal sa ER yung mga nurse ay may bangs?
May
bangs. Bakit sila bawal na may bangs? Kasi hindi nila magagawa ang pagsi-CPR. Imagine mo pag may bangs sila, 1, 2. Eh di sila ang unang-unang nahilo, di ba?
Correct.
Oo.
Okay.
So hindi pwede. At saka
may bangs.
bawal din yung masyadong malaki ang hinaharap.
Bakit?
Eh baka mamaya hindi sa CPR maging awake yung pasyente, baka sa nipple awake.
Okay. buhay na yung pasyente pag dumidede na siya sa nurse.
Sabihin, na-revive na yung pasyente pag dumedi na siya. Ayoko na nga. Ano ba yun? Nakikigulo ako. Go, Prof. Jem.
Return of circulation pag dumidede na yung pasyente. Okay. Okay, next number 11. So don't forget that for adult, we can maximize up to 2.4 inches. And when we do the chest compression, okay, the faster as we could, as like more than 100 chest compressions per minute. Now, so we usually have this type of guidelines that if we compress, we can actually use the guidelines of music, like Staying Alive, when performing the chest compression. Yung, staying alive, ganun! Bakit gano'n kabagal yung kanta ko para mamamatay yung pasyente?
Bakit parang bakit may halong pagnanasa yung mo?
Pagwapo!
Staying alive, gano'n, gano'n?
Moaning na pala yan. Nakakaloka. Okay. And always follow the sequence, no? Remember the sequence for CPR: compressions, okay, airway, okay, and breathing. Okay, so we do compressions, no? 30:2. But definitely, if the client's airway, okay, should be open, always consider the possibility of neck injury. Okay, the thing is, if you have not seen a patient, okay, if you have not seen a patient who collapsed and it requires CPR, consider that there could be some sort of a neck injury. But if you have observed, okay, na talaga namang nalaglag at nakita mo wala naman talagang neck injury, then you can perform chin lift maneuver.
Pag
may cervical injury, jaw thrust. Okay? Okay. So for 11, okay, before surgery, an infant is to receive an intramuscular injections of antibiotics. So which of the following needles should the nurse select? So usually when we talk about for infant, no, we use 25 to 27 gauge, okay, or 5 to 8 inches of needle to be safe, no, okay, in performing intramuscular injection. Okay, number 12. So which of the following serum electrolyte values would most likely occur with Chiari's persistent vomiting? Remember, frequent vomiting can reduce some electrolyte levels, such as your potassium. So normally the potassium, we know, is your 3.5 to 5.0. Looking at this laboratory value is 3.2, so it's quite lower. The chloride level, usually it's 97 to 110, so it's also lower. And normally when we talk about the sodium, it's 135 to 145. So these are all degrees and may be expected that this can be related now to persistent vomiting. Okay? Okay. So next number, 13. Based on the knowledge of the preferred intramuscular injection, so this one has been repeated a while back, so we know that this is vastus lateralis for infants. Okay, the most or the safest site for infant injections of IM. 14. Okay, which term describes the basic problem associated with intussusception? Remember when we discussed the intussusception before, okay, or what you know as your telescoping? The small intestine goes inside the large intestine, causing obstruction. Okay, causing obstruction, and that obstruction, okay, would make the patient feel the pain. And the pain may recur every 15 to 20 minutes.
Prof,
so usually,
ano
yes,
yung
sir.
mass niyan? Anong mass? Anong shape ng mass ang intussusception?
Usually it's sausage shape,
'di ba? Oo, tapos yung tae niya, the stool,
currant jelly.
Okay, which means mucoid na may blood.
True.
Due to over distended blood vessels that ruptured. Okay,
True.
so mucus na may blood, so currant jelly stool. Okay, so diagnostic test that is also a therapeutic intervention would be your barium enema. Okay.
Yes. Okay, so don't forget that yung in-emphasize is the barium enema has double purpose. Okay, one, it can be used for diagnostic tests to identify the intussusception, and two, it can also be the reason for the intussusception to be relieved. So it's a form of treatment because once you introduce a water through enema, so it can cause lubrications of the intestines, causing falling. Okay, falling off the small intestines from the large intestines. So usually, we have to consider comfort for this patient because that obstruction causes severe pain. Where a child would usually have this knee chest position just to reduce the amount of pain that they are experiencing. Number 15. The appropriate pediatric dosage of neomycin sulfate is 10.3 milligram per kilogram every 4 hours. So Ken weighs 5 kilograms, which the following dosage most closely approximates a safe daily dose for him. So definitely you need to have a good formula for this. Okay, so to compute for the calories per day, you have to consider getting first the client's milligram per kilogram of weight. So that is basically 10.3 milligram, right? Then to be multiplied by the weights of the client. So by 5 kilogram. Okay, so 10.3 times 5 kilogram will give you 51.5. 51.5 since it is given every 4 hours. Okay, so you usually take note of the frequency. So if it's gonna be every 4 hours, what you need to do is it is given like 6 times in 1 day. Because the question is, which of the following dosage must closely approximate a safe daily dose? So if it's gonna be daily dose and divided by 4, you consider it 6.
Prof. Jem, parang
Yes.
24 hours divided by 4 will be 6.
6.
So that 51.5 times 6. That's
Yes.
the frequency. Okay.
Okay, so you'll get now the 300. 8 milligrams per day. Okay, so sort of we consider now 300 milligrams per day. Okay, so just follow how we actually compute it. So milligram multiplied by weights and then multiplied the frequency of the time it is given from 1 day. So 24 divided by 4 to get this 6.
The purpose of neomycin is usually to decrease abdominal bacterial flora.
Okay. Thank you for that, Ray. So again, the neomycin sulfate is usually used to decrease the amount of bacteria in the colon. Okay, next number 16. Okay, for number 16, we have Ken is now 15 months old and has been readmitted to the hospital for colostomy closure. The surgery is over and Ken is returned to the units with IV line in place. The infusion set delivers at 1 ml per 60 drops and a total of 250 ml over the next 3 hours has been ordered. So how many drops per minute should the infusion deliver? So this one is kind of basic for us because we know the formula in computing the infusion rate. So first thing that you have to consider is to get the ml per hour. Okay, so how do we get the ml per hour? Okay, so what we do first is you get the volume. So let me place here the volume. Okay, volume. Okay, so volume is usually in ml. Okay, then to get the time, you divide it by hour. So initially, you get first the ml per hour. So the volume is basically, let's substitute. The volume is 250 ml. 250 ml. Okay, then by hours, it is what? 3 hours. Okay, so 3 hours. So normally, you can get here initially an 83. 83 ml per hour. Okay, but you're trying to identify the drops per minute. Okay, so what you need to do, with this, you get that 83 ml per hour. 83 ml per hour as our answer. From the initial computations. Then you multiply it by the drops. Drops, which is in every ml we have 60 drops. So you multiply it by 60. Okay, you multiply it by 60, and then you divide it with an hour. Okay, so with that an hour to make that 1 hour, we have that 60 minutes, right? Okay, so we have that 60 minutes. Okay, so now you can compute. Okay, so what you need to do, 83. Okay, so this one is much better. Okay, we'll do this. Okay, so 83. Okay, then 60 minutes. Okay, so with this, okay, we can compute now. Okay, for 83 times 60. Okay, we'll have this 4980. Okay, 4980, sorry. Okay, so we have 980. Okay, then we have 60. Okay, to be divided into 60. Okay, so with that, we'll get your 83 drops per minute.
Okay, or Prof. Jem,
Yes, sir.
they just think of the functional concept. Usually the ml per hour is equivalent to the infusion in drops per minute because you just need to cancel yung 60 mo na dalawa. So if you
True.
cancel 60 and 60, you just get 83. So it's the same.
Yes, the
Para hindi
same.
na sila mag-multiply.
Yeah. Okay, that's the easiest way also, no, sir?
Yes, agree.
Okay, so, okay, good. Next, okay, we have this one. Okay, the minimum number of inches the heat lamp should be placed away from Brad's skin is, okay, the answer here is 18 inches. Okay, so basically the purpose of heat lamp is to warm, to warm a child. Okay, and the treatment should last no more than about 20 minutes. Okay, so don't forget, okay, this is for rewarming. Okay, and this should be not more than 20 minutes plus a 25 watts bulb is recommended. 25-watt bulb is recommended. Okay, so the bulb should be protected to help prevent burns from handling the equipment. And an active infant or child may require restraining during the treatment, or the nurse may choose to hold the infant or child while administering the treatment. So what are other ways that we could prevent too much burning? So again, you can cover the bulb, or you can just hold the baby during heat lamp treatment. Again, no more than 20 minutes, 25-watt bulb. Okay? Okay. So distance, 18 inches. Okay, next. Because Blake is to receive 500 ml of fluid every 8 hours, how many ml of IV fluid will Blake receive in 24 hours? What you do here, you get first the time. Okay, so you'll get 24 hours. Okay, 24. Okay, to be divided by 8 hours. Okay, by 8. So you'll get 3. Okay, and since you have 500 ml, you just multiply it by the volume, okay, to get that 1,500 ml. Okay, so that's how you actually consider for the fluids, in every 24 hours, or to be received every 24 hours. So divide the time, okay, then multiply it by the volume. Okay. Okay, next number, 90. After assessing Clark's abdomen, the nurse documents the findings, which notation represents a deviations from normal that could indicate appendicitis. Okay, appendicitis. So the answer that we have in our material is a bowel sounds are heard twice, okay, in 2 minutes. Is that a problem? Definitely yes, no? Okay, remember that an appendicitis could have this decreased or absent bowel sounds. Normally, bowel sounds are heard every 10 to 30 seconds. So if this client would have this twice in 2 minutes, so you know that there could be signs of inflammations. Okay? Okay, so that's the thing that we have to remember for this. Next, and when we talk about appendicitis, we as much as possible do not apply warm compress to cause rupture. Okay, or in the event that the patient complains a sudden relief of pain from appendicitis, we suspect that there's already a rupture that occurs. So we need to notify the doctor while we keep the patient in semi-Fowler's position to prevent ascending infection. So again, the sudden absence of pain from a patient with appendicitis means that there is a worsening conditions or the rupture occurs. So we always consider that not all absence of pain would mean a positive indicator.
And then, Prof. Jem, the laboratory data, they have to check there's usually moderately elevated
WBC.
Yes.
Okay, and we have those positive signs like positive rebound tenderness or Blumberg sign, positive psoas, Robsing signs that are commonly related to your appendicitis. So initially, if it's appendicitis, we don't immediately give medications for pain, as we have to secure the assessments to be right when we are dealing with peritoneal inflammations. Okay, for number 20, we have after Lois is cared for Mrs. Penny, asked the nurse, what is the best way for me to protect my infant son when he is with me in the car? So, which of the following diagram? See the diagram illustrates how best to apply a car seatbelt to protect an infant while traveling. So what we know, if the infant is already 20 pounds, it is safer now. It is safer now for them to use a car seat with restraints. So the answer is infant seat facing backwards with face of the infant towards the back of a car with seat belt in place. So usually if it's 20 pounds, the baby is still facing the rear portion of the car while they are in a car seats. Okay? So that would be the safest. Okay? So therefore it is necessary to get the weight of the infant to make sure that they are safer to be placed in an infant car seat. Okay? Okay, so that's what we consider. Okay, for this, now the purpose of that type of position is to protect from any possibility of trauma that could occur during the trip. Okay, next number 21, Matt's nurse should expect that because Matt has celiac, his stool are most likely to be, answer, particularly offensive and odor. Okay, so what we expect for patients with celiac, there's a problem with metabolic process. Okay, and what we expect to note when we consider the celiac is their diets. We have to maintain that gluten-free diets for the child. Okay, so we don't have that definite the drug that we use for this, but more specifically maintain the diet for this client, and it should be gluten-free. Okay, gluten-free as much as possible. Avoid barley, rye, and wheat. Yes, sir.
Okay. We have to update to highlight the update. It's just barley, rye, and wheat, as you said.
Yes.
Let us just highlight that. Oats can already be given.
True.
Oats can already be given. So, BRW, barley, rye, and wheat. Pag sinabi nating wheat, yun yung basa, no?
Kaya pala I feel wheat na. Charot!
Ba yung pandesal, pag sinausaw sa kape, nabasa. So, wheat na siya. Okay?
Correct. Wheat pandesal. Charot! Okay. So next, thank you, sir. Again, oats can now be given.
Wow, malapit na success si Prof. Jem. Kakain na siya. Susunod na ako.
Hindi, sir, pwede mag-break. Okay, 22.
Hindi, tapusin mo muna kasi susunod naman ako after you So go.
Okay. During assessment, the physical finding the nurse is most likely to observe is that Matt has a protuberant abdomen, right? Okay, why? We expect the client with problem related to metabolism could have this could have manifestations of slow digestive process. So that would be expected. Now, if you have a slow digestion, you expect for a protuberant abdomen. Okay, pwede po malt sa celiac. Usually malts are barley. Okay, so it's not. Okay, so next number 23. Mr. and Miss Erica bring their 12-month-old son Andre to the clinic for evaluations of hypospadias with associated congenital cord D. Okay, which of the following statements best describe hypospadias? When we talk about hypospadias, the urethral opening is not located on the normal location, which is at the tip of the glans penis. In
I-demo mo, Prof. Jen,
hypospadias,
i-demo mo sa fingers mo paano yung hypospadias. Kunwari,
actually, pwede ko naman siya i-drawing. Ganito siya. Di ba dapat si Junjun ganito? Yan. Tapos
ano yan,
yung friends
mushroom?
Tapos yung friends nandito. Kaya ang pangalan niyan, Junjun and Friends. So normally, okay, nandito yung
Urethral opening.
Yan. Okay.
So, sa hypospadia, nasaan siya?
Ang hypospadia, andito sa ilalim.
Okay. Pag epispadia,
andito sa ibabaw.
dorsal side, di ba? So pag may epispadia, may libreng hilamos pag umihi sa umaga.
Kasi paangat yung kanyang ihe.
Hindi, Prof. Jem, may tanong ako. Di ba pag epispadia at hypospadia, hindi naman yan nakakaapekto sa pag-aanak. Di ba?
Yes,
Kasi normal naman yung sperm cell nila. Yun lang pathway na babago. But make sure na usually naman nakukorek yan at hindi muna sila sinicircumcise until makorek. Di ba?
Exactly.
Yes. Okay.
Okay. Tsaka when we say cordy, no, ito yung medyo baluktot kaya nahihirapan siyang dumiretso.
May tanong si Glenna, doon daw ba lalabas sa butas? Oo, doon. Pag epispadia, sa dorsal side ng penis. Pag hypospadia, sa ventral side ng penis. So,
True.
pag epispadia, okay, sa umaga pag ihi, may libreng hilamos ka. Pag hypospadia, pag ihi mo sa umaga, mahugasan ng paa mo. Ganon.
Correct. Okay. So always remember, no? Okay, we don't
Mas
perform.
madaling tandaan yung pag may kabastusan ng konti.
That's true. Okay, we don't perform circumcision for this type of problem unless it has been repaired. Okay, then circumcision may be performed. Kasi pwede pang gamitin yung balat. Okay,
For corrective surgery.
Yeah, pang-correct nung ating.
Akala ko pwedeng gamitin yung balat pang prito sa chicharon.
Isama, crispy kaya yun? Charet! Parang hindi naman siya crispy. Charot! Okay, next. Number 24. Another characteristic of urine in the presence of bacteria. Usually it's related to infection, no? Okay, proteinuria and bacteria are commonly present. Okay? So that's what we consider for that.
Ibig sabihin, meron siyang UTI.
True.
Nalala ko sabi ng isang estudyante, urinary throat infection. Ano yun? Inihian ka? Urinary throat? Okay. Di ba? Ang common cause niyan is your E. coli, Escherichia coli, which are usually found in fecal matter. So, ibig sabihin, pagka nagka-UTI ka, you don't know how to clean yourself sa female. It has to be from front to back, not back to front. Kasi pag back to front, prone ka sa UTI. Eventually, pwede ka maging prone sa sepsis. Di ba?
Exactly.
Ngayon, pagka malinis ka naman, may asawa ka, nagka-UTI ka pa rin, naku, kasalanan na ni Junjun ni Jowa. Ibig sabihin, yung Junjun galing sa puwet. Ganon!
Bakit masarap naman yun Charot!
Okay, game na tayo. Ayan, huwag yung kakalimutan yung conversion ng degrees centigrade to degrees Fahrenheit. Take it away, Prof. Jem. Pasok!
Okay, thank you, sir. Okay, so again, we have different ways to compute for centigrade to Fahrenheit and Fahrenheit to Celsius. No, but
Prof. Jem, naalala ko na naman yung yung item about dun sa igat.
Ay, we can show that, sir, later.
Hindi, nakita na nila yon nung first day ng reinforcement.
Ay, nakita na nila.
Oo, yung igat.
Oh, kaya.
Pasok si Junjun, pasok.
Okay.
Tapos sasagot si Gas Abelgas, kapag tama ang pagpasok ni Junjun.
Uy, wala na yata siya, sir.
Huwag ka ganyan. Itsusera ka, na-print daw niya yung igat.
Print na namin.
Ano ba
Ayoko na nga.
yun?
Ma'am Jem, punong-puno na ng hangin yung chan ko. Bilis na ikaw na para makakain ka na. Tapos ako na.
Okay. So, okay, the usual thing, before kasi, ang ginagamit natin yung ating 9/5, no? 9/5 to get the Fahrenheit, and the other one is 5/9. So, yung ginagamit ngayon na current way to compute for Celsius to Fahrenheit is this. No, so we commonly use Celsius to Fahrenheit, so which is Celsius times 1.8 plus 32 to get the Fahrenheit. So you'll get 39 times 1.8 plus 32. Okay? Okay, that's what we consider. Or the other way around, yung ating old method to compute for Celsius to Fahrenheit, which is usually Celsius times 9 to be divided by 5, and then you add 32. Okay, so this type of methods can actually help us to identify, centigrade to Fahrenheit. So to whichever you are comfortable with, to use this, then it's okay. Okay, kung saan ka comfortable, I know naman kasi alam ko yung recent lecture nila ngayon, sir, is related to the 1.8 plus 32. Okay? Okay. So next, number 26, the nurse is to administer an IV infusion to Laura. Approximately how many drops per minute of solution should Laura receive if 500 ml of IV solution is to be infused over 12-hour period? So this one, what we commonly use as our formula, the volume in ml, remember this? The volume in ml, to be multiplied by the draft factor. What is our draft factor here? 60. 60 drops. And then to be divided by hours or minutes. 60 minutes. Okay, so you just convert it, no? So the 500, the 500 in the one that we did a while back. So let me repeat. 500 ml to be divided by 12 hours. Okay, so with this, you'll get 42 ml. 42 ml per hour. And the one that we actually did a while back, no? You can just consider that 42 ml per hour could be your 42 drops per minute as well. Okay, even without computing it by 60-60, because you can just cancel the 60-60, just like a while back. Okay? Okay. So next, number 27. We have Jessica's mother tells the nurse that all of the following facts. Which facts is associated with Reye syndrome? The answer here for Reye syndrome is Jessica had an upper respiratory tract infection 1 week ago. Okay, so usually the etiology of Reye syndrome is unknown, but symptoms of Reye syndrome usually develops few days to several weeks after the onset of mild viral illness, such as respiratory tract infections or chickenpox. So the other data provided not associated, what we consider here, for Reye's, this can be related or associated with the use of aspirin. So for patients with viral infection, that can be related to influenza, can be related to chickenpox. Avoid the administrations of aspirin, as this can link to develop your Reye syndrome. Your Reye syndrome can actually lead to central nervous system problem. Why? Because it can lead to acute encephalopathy.
So, Prof. Jem, dalawa yon din, no, dagdagan natin. Encephalopathy tsaka hepatopathy. In
Yes.
simple terms, inflammation sa central nervous system tsaka inflammation sa biliary or liver. Biliary
Yes.
system or liver. So, dahil doon, merong Reye syndrome na tinatawag. Okay.
Thank you, sir. Okay, so one thing for sure, never give aspirin to a patient with viral infection. Okay? So the results of laboratory studies confirm a diagnosis of Rey syndrome. Given diagnosis and Jessica's signs and symptoms, interventions are aimed at primarily preventing, definitely that's encephalopathy, so central nervous system damage. Okay, so next, another one. A child who limps and found to have pain is referred by the nurse for medical care. It is determined that child has leg calves first disease, also known as your coxaplana or osteochondrosis. So ma'am, ano po ba yung sakit na yon? Nabubulok yung head of femur. Okay? So the right femur is involved. Okay? The most important aspect of this child's care is when he is undergoing therapy. Okay? Since the answer here is prevent weight bearing on the head of the right femur. Okay? So ma'am, what is the usual treatment we consider if there is leg calf spurs disease? Usually, dahil nabubulok yung head of femur, tinatanggal yung necrosis part and then tinatraction. Then the traction can actually last for 2 to 5 years. So therefore, it's a long-term treatment. Okay? So avoiding that weight bearing could actually help the bone to have match recovery. Okay, and that could actually help in faster development or improvement of the muscles and the bones as well. Okay, so next, we have the physician told Mrs. Moreno that X-linked inheritance pattern is identified in 50% of cases of Duchenne's muscular dystrophy. Mrs. Moreno asked what an X-linked inheritance pattern. The nurse would correctly explain that it means usually in X-link, the boys or males are commonly showing the signs and symptoms, and the carrier would usually be girls, or the mother. But in considering that males are affected almost exclusively in X-linked conditions or inheritance, we also consider that the mother who is a carrier will transmit the disease to what? Son. So what we expect, ang nagbibigay ng sakit para matransfer sa anak na lalaki ay yung nanay na carrier. So kung ang nanay na carrier, ako ang nanay ay hindi carrier, okay, so therefore there's no chance of transmitting the problem. Okay, related to this X-link. Okay, so usually when we talk about Duchenne's muscular also, we expect that the main problem initially starts from muscle weakness to paralysis that usually starts from the lower extremities. Kaya initially, ang problema natin with Duchenne's is muscle weakness, okay, sa paa. So they are prone to fall, so safety is a priority. Kaya lang ang problema natin, this is progressive. So when we say progressive, it will come to a point that the weakness and paralysis will ascend to the upper part of the body. So in the late manifestations of this condition, patients may develop respiratory paralysis. So initially, the problem is safety, the priority is safety rather, and an advanced case, the priority is now airway. Okay? Are we clear with this? So again, in X-link, yung lalaki ang may sintomas, pero yung babae ang carrier to transmit the disease. So if the father, for example, is having Duchenne's and the mother is not a carrier, then there could be no chance of transmitting the disease. Okay? Okay, so para yung hemophilia, X-link inheritance din. Okay? So number 31, when Kenneth is placed in Brian's traction, he should be positioned on his back and his legs should be. Remember when we discussed this from masculine, no? Yung itsura ng bata pag Brian's, ito siya, itim kanyang ulo, yung paa niya nakaangat. Okay, remember? Okay, and then kung ito yung bed niya, okay, dapat yung kanyang puwet is slightly off the bed, like 1 inch above the bed. No? Okay, so flex at 90-degree angle at his hips, and his hips should be slightly off the bed. So usually, we use this to correct some problems related to leg fracture. Okay, or we need to realign properly the leg of a child. Okay. Next number, 32. Before preparing to remove insulin from its vial, what steps should the nurse teach Andy and his parents to take first? This is actually a principle related to mixing of insulin. And if we talk about mixing of insulin, we try to consider mixing the regular okay, or a short-acting insulin, and also an intermediate, okay, NPH insulin, no? So inject about the same amount of air into the vial as the amount of insulin to be withdrawn. Why? You know, it's easier to ask. Actually, you don't really ask for it. When you inject an air, okay, no, and then you need to get the insulin from the vial. It actually helps you to have a normal release of your syringe when getting an insulin from the vial. Okay, and we follow the principle of IRRI, okay, when mixing insulin. Remember yung intermediate, regular, regular, intermediate. Okay, so we do first injecting air, okay, into the intermediate vial insulin, then injecting air to the regular insulin. But we aspirate first from the regular, okay, then aspirate from intermediate acting insulin. So remember that IRRI. Okay, I know you could still remember that because we have discussed that from your endocrine. Remember when we discussed the diabetes, okay, medications. 33, at what temperature should the Thomsons be taught to store Andes insulin between uses? We usually consider room temperature. And when we say room temperature, it's between 60 to 75 degree Fahrenheit or 25 to 24 degrees Celsius to maintain the integrity of the insulin. Ta-da!
The newly produced insulin now in the market are already manufactured such that you don't have to place it inside the refrigerator anymore. But
Oh,
brands that require it, like if you're taking Lantus, the long-acting insulin, you have to have it refrigerated. But there are insulins now that can survive room temperature even for 1 year.
okay.
Yay! Tapos na si Prof. Jem.
Yes, sir.
Take your lunch, much deserved lunch, Prof. Jem, and I will take over the class. Here we go. Let's say bye-bye for now to Prof. Jem Karaig. Thank you so much. Kala mo naman, magkalayo tayo. Nandito lang ako sa studio, sa ground floor ng Gapus Building at UN Avenue. Prof. Jem is in the second floor. Okay. So, let's begin. Kindly bring out your PDF files on set C2, okay, for our rundown. Set C2. Okay. Set C2. Okay. Are we ready? Let's begin with the first situation. So, a lamp, may lampara. Ano ba yan? A lamp is discovered in Mrs. Tairutai Murapekpek's right breast. Ano ba naman pangalan yan? During a routine physical examination, she's admitted for breast biopsy and possible surgery. Number 1, during her admission workup, Mrs. Murapekpek ano ba naman pangalan yan? Mrs. Murapekpek is extremely anxious and has questions. Which of the following statements offers the best guide for the nurse when she answers questions raised by this apprehensive preoperative patient? Okay? So ang pangalan po sino daw gumawa ng mga pangalan sa questions? Tanungin niyo si Prof. Jem para malaman niyo sinong gumawa. Si Mrs. Murapekpek, okay? Now, always remember that anxious patients would need information. As much information as they can to clarify misconceptions that would help them get over their fear of the unknown. So the best intervention for this patient is to tell the patient as much as she wants to know and make sure that you make use terminologies that they are able to understand. Okay, let's move on. All of the following would be considered risk factors for the development of cancer of the breast except breastfeeding. Ay na, no Ilocano, apay, agpasusuka, cancer ka, haan, ah? Yung mga hindi nakakaintindi ng Ilocano, maghanap kayo ng interpreter. Di ba? Remember yung theory ng cancer, overuse, underuse, misuse, and abuse. Di ba? Tignan mo yung mga laging nagpapajokad, nagpapakaktus. Nga, cancer ka. Kaya pag yung asawa mo mahilig, sabi na yan, kang agyot ngayot, ag-cancer ka, ganon. Okay? But breastfeeding is not a risk factor. Sabi ni Ian, may hiring bang taga-suso? Wala, ano ka ba? Okay. Di ba, Gilbert? Kang agkwatane, ag-cancer ka. The most common, come on, let's be a little more serious now. Risk factor to cancer of the breast is nulliparity. Ano ibig sabihin ng nulliparity? Those who have yet to get pregnant or conceive and they have reached the age of 30. So yung mga magti-30 na dyan at hindi pa kayo nabubuntis, at risk kayo sa breast cancer. So kung magti-30 ka na, kung ako ikaw, naku, i-offer mo na yan, no? Kailangan ilako mo na yan sa Facebook. Sabihin mo, pwede mo bang i-decrease ang risk ko? I-offer mo ng ganyan, di ba? Otherwise, magiging at risk ka na sa breast cancer. Now, colleagues, bentahan na daw ng breast. Sabi ni Ian, apply ako. Ayun, wala na naman tayo matatapos. Magtatatawa na naman tayo na magtatatawa. Okay, game na muna. Wait lang. We're talking about risk for breast cancer. Okay? So, hindi nakaka-increase ng risk ng breast cancer ang traumatic injury caused by a ball that's hitting the breast. No. Okay? Sa black market daw, sabi ni PJ. What is important for you to remember is, okay, when you have a family history of cancer and when you reach the age of above 50 to 55, then your risk for cancer doubles. Okay? One of the common risk factors would be early menarche and late menopause. Maagang niregla at late nagmenopause. Kailan ba yung maagang pagre-regla? Okay? Niregla before 12 years old. Niregla before 10 years old, maaga yon. Kasi ang average menarche sa Filipinos, you talk about 12 to 13 years of age. Okay? Menopause naman usually from age 45 to 52. Okay? So, pag nagmenopause at age 55, that's late menopause, that increases the risk for breast cancer. Ano ito mga sinasabi nyo dito? Isanla nyo na ang breast. Si Raulo ka, Alex. Okay, huwag kang ganyan. Oh, 'di ba? At least yung magsasanla, may isasanla siya. Eh, ang mahirap niyan kung magsasanla, gamunggo lang. O di magkano lang ang sanla nun? Sir, paano kung masobrahan sa lamas? E di magre-release ka ng oxytocin, magkakaroon ka ng orgasmic feeling, di ba? Ganun yon. Because oxytocin is the hormone that's called the happy hormone. If you want to feel elated, release your oxytocin. What needs to be done? Aba, di ba? Lalamasin daw, ang pangit ng term, pero that's a regular term. Lalamasin daw yung nipples, okay? You play with the nipples, okay? Lalabas ang oxytocin. Sabay kanta ka ng la 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 la. Ano ba yan? Number 3, Mrs. Murapekpek. Hindi na ako mapigil sa katatawa sa mga comment nyo. Game na. Mrs. Murapekpek asked the nurse, where is cancer usually found in the breast? Now take note, class. Between the left and the right breast, cancer most frequently occurs in the left breast. And it's the left upper outer quadrant of the breast where you have around 50 to 55% of your breast cancer. So 50 to 55%. What's the reason? Well, the exact reason for that specific statistic is not completely known. However, please know that most tumors in the breast are found in the left upper outer quadrant of the breast. Ayan. So dito, quadrant B. Okay. Next, let's move on. Mrs. Murapekpek's biopsy is positive and her physician provides her with information about various treatment options. He recommends a modified radical mastectomy. Nyo ko isali, kayo lang. Okay? And she agrees. Atropine sulfate is included in her preoperative meds. Now, when you talk of atropine sulfate, please pay particular attention to the fact that it's given for 2 purposes. Number 1, It's given to decrease secretion to prevent aspiration. Number 2, your atropine also acts as a vagolytic agent. Okay? As a vagolytic agent, it increases the heart rate. So it prevents bradycardia. That could be secondary to the administration of sedatives. Now, the primary reason for this drug preoperatively is that it helps, the answer, inhibit secretions in the mouth and respiratory tract. So it prevents aspiration. Number 5, which of the following observations should the recovery room nurse plan to make first upon receiving Mrs. Murapekpek from the operating room? Okay. Make sure that when you admit the patient from the operating room, the highest priority is to assess the client's airway. The airway should be patent. It has to be clear. Now, pay particular attention to the fact that if there is a chest drainage, make sure that the chest drainage system is functioning properly. Okay? Sir Ray, may pa-diagram or illustration sa boards? They could be, pero usually more often than not, meron lang sila mga enumeration for the SATA. Okay? Next. Okay, which of the following positions is best for Mrs. Murapekpek right's arm when he returns to the room from the recovery room? The answer, on pillows with her hand higher than her elbow and her elbow higher than her shoulder. What is the primary reason for this? To prevent lymph edema. Because in modified radical mastectomy, lymph nodes could also be removed. And as such, there could be lymph edema. So to facilitate the drainage from the arm on the affected side, so the arm should be elevated on pillows with the patient's hand higher than her elbow and the elbow higher than the shoulder. Okay, so don't forget that the hand should be higher than the elbow and the elbow should be higher than the shoulder. 7, okay, Mrs. Murapekpek has a drainage tube in her incision that is attached to suction. The primary purpose of this tube is to help remove accumulations of serum in blood in the operative area. Now, usually, they have your Jackson Pratt, okay, drainage system or drainage tube. Now, the purpose of this is to ensure that serum and blood do not accumulate in the injured part, in which case it could potentially lead to more pain. Okay? So draining the secretions would eventually facilitate healing on the surgical site. Number 8, on the third post-operative day, the drainage tube is removed and the drainage changed. Mrs. Murapekpek appears shocked when she sees the operative area and exclaims, "I look horrible. Will it ever look better?" Which of the following responses would be best for the nurse to make? You're shocked by the sudden change in your appearance as a result of the surgery, aren't you? So this is actually focusing on the patient's feelings, okay? This is trying to mirror the patient's reaction to enable them to develop awareness of how they are reacting to the change in body image. So your priority nursing diagnosis when you get to hear comments like this would be, okay, body image disturbance. Okay, and you would know that the patient is recovering from the disturbance if they are able to take a look at the surgical site without feeling ashamed. Okay, now what is important is assure the patient that there are ways in which they can have breast reconstruction surgery that would increase their confidence. Remember for a fact na kasi 'di ba, ang breast talaga namang symbol yan of femininity. Kaya nga 'di ba, pag dalaga pa yan, tayong-tayo ang breast, tayong-tayo yung nipple, okay? Para yang ano kumbaga sa equipment or tool, 'di ba? Parang yan yung nagbibigay ng sense of direction. Talagang tayong-tayo, okay? So, tignan mo rin, as a lady eventually grows old, eventually the breasts will sag. And when the breast will sag, eventually the nipples would point downward. Di ba? Ano ibig sabihin nun? Hihigupin ka na ng lupa. Di ba? Kasi yung pinupoint ng nipple, doon ka papunta. Okay? So as much as possible, okay, focus on, once again, the body image of the patient. Number 9, the nurse is doing a discharge stitching with Mrs. Murapekpek. As a result of the surgery, which of the following activities may Mrs. Murapekpek need to modify or avoid? First and foremost, pwede siyang maging plantita basta walang tinik ang mga halaman. Roses usually have thorns and there is always a potential that when they work in the garden with a lot of plants with thorns, they could cut themselves, or they could bruise themselves, or they could hurt themselves. And eventually, since natanggal na yung lymph nodes mo, wala kang filter, so infection could set in. So the patient could suffer from systemic infection or sepsis. So to prevent that from happening, bawal muna siyang garden kapag may mga tinik ang kanyang tanim. Okay? Now, anong pwede niyang gawin? Well, the person could walk around with pets, could swim with pets, but, okay, specifically, yung tending to the rose garden is not an appropriate activity for the patient, for the simple reason that your roses have thorns and may potentially hurt the patient. Okay, number 10, the nurse finds that Mrs. Murapekpek does not practice breast self-examination and unsure of the technique. The nurse should teach Mrs. Murapekpek that the best time of the menstrual cycle to examine her breast is during the first week, the key word, after menstruation, in which case the hormones are decreased, therefore the breasts are less tender. Okay, and the patient can perform the self-breast exam either while lying down, okay, while standing in front of the mirror with the hands on both hips, or not necessarily. It's least preferred that the patient will do it when they are seated. So the most preferred position would be while lying down or while standing in front of the mirror. Number 11, which of the following positions is the one of choice for palpating tissues during exam of the breast? Flat on the back with a pillow under the shoulder, on the side being examined. 12, Mrs. Murapekpek asks the nurse what the firm ridge is that she feels under the lower part of her breast. The nurse should base a response on knowledge that this ridge is a connective tissue, which is a normal part of the lower breast. 13, Mrs. Murapekpek says she has always noticed that her brassiere fits more snugly at certain times of the month. Now, this is due to hormonal changes. So the answer is A. It is normal for the breast to increase in size prior to menstruation. Okay? That's because of the surge in the hormones. Number 14, Mrs. Murapekpek is to have a radiation therapy. Now, take note. If a patient is to have radiation therapy, it's very important to tell the patient the do's and don'ts, okay, after the procedure. Usually, the bed of the patient is positioned in the middle of the room so that the radiation may not thread through the walls. Okay, so it's also very important that nurses who are being assigned to take care of the patient are not pregnant. Okay, and they limit their exposure to the patient for 30 minutes per shift. Okay, now at the bedside, you have to have your lead container, okay, and your forceps, just in case there's a part of the treatment that gets dislodged. You have to pick it up with a forceps and place it inside the lead container. You always also have to check if the patient knows that during the treatment, they need to flush the toilet at least twice. Okay, now the question is about this. When caring for the skin at the site of therapy, Mrs. Murapekpek should avoid all of the following practices except, so you're talking about the exception. Okay, the patients receiving radiation therapy should not use lotion, they should not use ointment, okay, or anything that may potentially harm their skin. They should not be exposed directly to sunlight, even to tanning booth. Okay, they should not be using talcum powder. Okay, so the area could be washed with water. Okay, so because it says here, should avoid except. So which one can the patient do? So they can wash the area with water. 15, the nurse correctly teaches Mrs. Murapekpek that a normal local tissue response to radiation most often appears as redness at the surface tissue. Okay, now sometimes the patient may experience dryness or desquamation or discoloration like tanning. Okay, but the most common would be redness, and the question is about the most common that appears. 16, Mrs. Murapekpek asked the nurse why a friend of hers had to have her ovaries removed after having a mastectomy. Now remember, the ovaries are responsible for secreting estrogen. Estrogen increases growth of tumor cells. Okay? Pag sinabing tumor, dalawa pa. Tumor. Ayan na naman, gulo-gulong kausap. Now, in order to prevent the growth of tumor cells in the breast, so a patient who had mastectomy would also undergo oophorectomy, okay, to eliminate estrogen. And that's the reason why patients who are undergoing treatment for breast cancer are being given estrogen blockers. Okay? Next, 17. The nurse arranges for a member of the Reach to Recovery program to visit Murapekpek. The primary purpose of this American Cancer Society program is to help rehabilitate patients who have had mastectomy. Now, you also have organizations like Mastectomy Anonymous. Number 18. Mr. Ricker is to be catheterized. Okay? The primary reason for lubricating the catheter generously before inserting it is that this technique helps reduce friction along the urethra when the catheter is being inserted. And when urine begins to come out after inserting the catheter, you need to insert it approximately, okay, 1 inch more, okay, to ensure that it is really inside the urinary bladder. 19. A Foley catheter was inserted into Mr. Ricker's bladder. After inserting the catheter, the nurse tapes it to the patient's thigh as illustrated below. O yan, tignan nyo lang. Okay, it should be tape on the patient's thigh. So laterally. What is the purpose? So you prevent pressure at the penoscrotal junction. This is the penoscrotal junction. So you don't tape it downwards, you tape it laterally. Okay? To prevent friction at the penoscrotal junction. Okay? Now, pay particular attention to the fact that the position of the penis should be lateral. Okay? Because if pressure occurs and that persists for a long period of time, it could potentially cause uterocutaneous fistula. So magbubutas yung tissues. Okay? Ayan. Para hindi magbutas ang tissues, dapat lateral. Okay. Ang ganda, may drawing pa. In fairness, naka-shave. Okay. Now, which of the following is considered to be a risk factor for cervical cancer? Adolescent pregnancy or teenage pregnancy. Yung mga nabubuntis habang 15 years old, 16 years old, that is a risk for cervical cancer. So, multiparity is a risk for cervical cancer. Nulliparity is a common risk for breast cancer. 21. Correct preparation of a patient for a pap smear would include which of the following? The patient should not douche prior to the exam. Always remember, tell the patient not to douche. They don't wash themselves 24 to 48 hours before the pap smear because that will wash away cells and secretions needed for an accurate test. Okay? Number 22, the American Cancer Society recommends that the average adult woman follow which is scheduled for pap smear screening. Answer: every 3 years after 3 initial negative tests taken annually. So this every 3-year test is done by women who are from age 21 to 65. Okay. Now, if they have 3 consecutive negative tests, they can do it once they reach the age of 30 every 5 years. So they can shift to the every 5 years screening schedule. Okay. If they had 3 initial negative tests, but initially they have to do it every 3 years. Okay. 23. Once the inflammation has subsided, the nurse teaches Mr. Kravitz to perform testicular self-exam. Now, take note. It is very, very important that you know the characteristics of the normal testes. Okay. Now, are the normal testes equal or unequal? Go. O, ilagay nyo nga dyan sa chat box natin. Equal or unequal?
Unequal.
O, nauna pang sumasagot ang babae. Unequal. Which is lower, the left or the right? Sige. Which one is lower, the left or the right?
The right.
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 Nagpapasok ng kamay sa bulsa. Mali ka, Earl. Usually, the left is lower than the right. Okay. Now, are the testes, okay, normally spongy? Yes or no? Are they normally spongy? Yes
No.
or no? So the testes should be smooth. There should be no bumps. It should be firm but not hard. Are the testes normally salty? Or the scrotal sac, are they normally salty? Say yes or no. Sabi ni Bibo
Yes.
sometimes, after jogging, sabi ni Stephanie, patikim daw. Sabi
Yes.
ni hindi. Ay nako, kayo talaga. O yung mga kumakain dyan, ha? Okay. Tabi-tabi po. When is the best time to perform the self-breast exam? The testicular self-exam. Okay,
During
usually
shower.
pwedeng after a warm bath, so that the testicles will sag. In Ilocano we say, tapno aguyao iti butilog, di ba? Asa na yung mga katropang dugyot ko sa Ilocanja, di ba? Okay, pag sinabi mo so that the testicles will sag in Ilocano, tapno aguyao iti butilog. Tanagoy, oh yes, Gilbert. Sabi ni, nabuga daw niya yung kinakain niya. Huwag ka muna kasing kumain. Unfair. Ako nga, hindi pa ako kumakain eh. Okay. Now, colleagues, listen up. Who should be your target? If you're going to give information dissemination about testicular self-exam, who should be your target? The answer, target teenagers. So, the high schoolers up to age 35. Okay? Okay, so you have to do it during or after a warm bath so that the testicles will sag. It facilitates the palpation. In Ilocano, aramidam malpas ka agdi gusto napudot, tapno aguyaw iti butilog. Sayang daw yung kinakain. Ay naku, wag ka muna kasing kumain. Okay, let's move on. The normal testis can be described by all of the following except. What did I tell you a while back, class? The normal testis should be smooth. A spongy testis indicates cancer. And what will you see in the history of a patient with cancer of the testis? They usually had undescended testes at birth, okay? They had undescended testes at birth. Now, what happens when the scrotal sac eventually, okay, shows enlarged veins? So what condition? Agur-urat. Okay, tibutilog. When you say agur-urat, tibutilog in Ilocano, that indicates varicocele, di ba? May enlargement of the veins in the scrotum. What about pag naipon ng tubig sa scrotum, there's swelling in the scrotum, so it's called hydrocele. Okay, those are common abnormalities. Okay? Natatawa ako. Baka po magkanda utot-utot na kayo sa katatawa dyan. Kasi naman maganda yung merong interpretation sa Ilocano yung lesson. Ano kaya mag-lecture ako ng puro Ilocano? 25. Which of the following respiratory signs would be an indication of increased intracranial pressure? Now, take note, class, that the common manifestations of increased intracranial pressure would be your Cushing's triad. So the respirations become irregular and it slows down. So decrease RR, decrease pulse rate. So you have bradycardia and you have widened pulse pressure. So which simply means the systolic blood pressure is going up. Okay. Now the appropriate priority when you have a patient with increased intracranial pressure is to position the client on high Fowler position. Okay, position the client on high Fowler position to prevent further increase, okay, in ICP. Sabi, nosebleed po yon, doc, sabi ni Michael. Okay, pag nag-Ilocano ako ng lecture, nosebleed daw. Okay, next. The nurse checks Mr. Marlin's gag reflex. Now, how do you assess the gag reflex? Can you use the penis to assess the...
Pwede.
Go, go, go daw, sabi ng team maniniyot sa Cebu. Pag ginawa mo yun, anong sasabihin nito? Anong sasabihin ni Alex? Ay, nagdulok ka. Okay, now remember. Si Jana naihina daw siya. Okay. Game tayo. So when you talk of the gag reflex, there are two things I'd like to highlight, class. Ay, sa Baguio pa lang mga team maniniyot. Okay, colleagues. Okay, remember cranial nerve 9 and cranial nerve 10. So your glossopharyngeal nerve and your vagus nerve responsible for the gag reflex. Specifically, when the vagus nerve is also affected, the patient will have hoarseness. So pag nagsalita yung pasyente mong may hoarseness, paano magsalita yung ganun? Kasi hoarseness. Ano ba yan? Sabi ni Roy, ay nabatilog to top the board exam. Use the testes daw to assess the gag reflex. Sabi ni Ian din. Okay, let's move on. Mamatay ako sa grupo. Recommended technique to test the reflex is for the nurse to touch the back of the patient's throat. Using the what? Anong gagamitin mo? To touch the back of the patient's throat. The glans penis ba? Hindi. Use a tongue depressor. Okay? Wag naman yung pang swab sa RT-PCR ang gagamitin mo to test the gag reflex. Okay, so let's move on to number 27. Rico. Yung deep throat technique na sinasabi mo, Dieter, that one leads to ectopic pregnancy of the larynx. kasi diyan na nagkaroon ng fertilization. Ano ba yan? Okay, game na tayo. 27. An electroencephalogram is ordered for Mr. Nikis. What action? Sabi ni Ian, pag may lumabas daw sa penis depressor, risk for aspiration ang nursing diagnosis. Ay naku, ewan ko sa inyo mga bata kayo. Has been served a breakfast consisting of a soft-boiled egg. O yan, may soft-boiled egg. Toast with butter and marmalade. Okay. Ang social naman, marmalade. So ano ibig sabihin ng marmalade? Minatamis. Ginawa pang marmalade, minatamis lang yan. Orange juice and coffee on the morning of the EEG. Okay. Okay. What will the nurse do? Remove the coffee, because before electroencephalogram, you have to avoid giving the patient any substance that may potentially alter brain activity. And this includes caffeine-containing foods. Okay. Ayaw tumigil ang Team Maniniyot sa katatawa sa chat box. Sabi ni Stephanie, minatamis na katas. Ano yung kaong na, nagsago-sago na kaya tumagal? Okay, 28. Mr. Bacon has experienced a left cerebral stroke. Everybody come on. Okay? Huwag niyong kakalimutan itong functions of the brain. Okay, raise your right hand, everybody. Let's do this para hindi mo lang makalimutan. Raise your right hand. Okay, right hand. Okay. Since the frontal lobe, specifically the left frontal lobe, is responsible. Come on. Is responsible for speaking. Okay? So if this is healthy, you say, I can talk. Come on, touch it here. I can talk. Okay? I can talk. And then the Wernicke's language area, which is just above the auditory area, is located on the temporal side. So if you have here, I can talk, here, I can hear, and I can understand. Everybody, let's do this. I can talk, I can hear, and I can understand. Okay? And then, take note, I can read. Dito ka sa vision. I can read. Okay, once again, I can talk, I can hear, I can read, and touch the rainbow in the sky. I can be your good friend. I can love you. Everybody, let's do it. I can talk, I can hear. Tumatawa na naman kasi kayo eh. Ano ba? Pinapadali ko nga para hindi nyo makalimutan. Therefore, okay, let's understand the functions in the context of having expressive and receptive aphasia. Okay, go. If it is the left frontal lobe that is affected, listen, colleagues. Okay, listen, colleagues. If the left frontal lobe is affected, the patient will have expressive aphasia, inability to find the right words to say. Therefore, take note, okay? Use a board, okay? A picture board when you're communicating with the patient. So you can use a board with a picture of glass so that the patient will pick the board to tell you they need glass. Because when they have left, okay, affectation, left frontal lobe affectation, they will have expressive aphasia. Now, what about if the patient will have the Wernicke's area that is affected? Okay? So pag dito sa Wernicke's language area ang affected, then they will have receptive aphasia, inability to comprehend. In Ilocano, hanga makauawat, di ba? Inability to comprehend. Therefore, if the patient is unable to comprehend, what would be your priority intervention? Talk to the patient slowly and provide time for the patient to digest what you are talking about. Okay, now, always remember that rehabilitating these patients begin the moment they are admitted to the hospital. Okay, so the answer for number 28 is when the patient is admitted to the hospital. Next, regular oral hygiene is an essential intervention for Mr. Bacon. Which of the following oral hygiene techniques would be inappropriate for the nurse to use when providing Bacon's oral hygiene? What is being asked is inappropriate. The nurse places the patient on his back with a small pillow under his head. If you put the patient on his back, that increases the risk for aspiration. The best position for the patient to prevent backward falling of the tongue is to put the patient on a side-lying position, okay? And have your suction equipment ready. Okay, here we go. Number 30. This is what I'm trying to highlight a while back. Because the cerebrovascular accident affected the left side, okay, ito na, of Mr. Bacon's brain, what do we have here? Broca's motor speech area, okay? Left frontal lobe. So what will the patient have? Expressive aphasia, inability to find the right words to say. So you communicate with the patient using a picture board. Next. Number 31, Mr. Bacon has an irritated cornea for which the nurse instills sterile eye drops. To which of the following causes is the patient's corneal irritation most likely due to? The temporary loss of the blink reflex in the eye on his affected side. And that is just temporary. Next, if Mr. Bacon is experiencing expressive aphasia, so what is affected here? The Broca's motor speech area. Okay, that is usually the affected part in expressive aphasia. Which of the following techniques would help the nurse successfully communicate with him? Speak in a clear, normal voice and speak slowly. Okay? So tatandaan, ano ang problema pag expressive aphasia? Yung pasyente hindi siya makapagsalita na tama ang kanyang mga sinasabi. Kaya kailangan mo may drawing ka, picture board. Ipakita sa kanya kung yun ba yung kailangan niya. Pag receptive aphasia naman, hindi nakakaintindi yung pasyente. So you have to provide adequate time for the patient to digest what you're saying. So communicate to the patient slowly. Sir, ano naman po yung dyslexia? Pag dyslexia, that is an abnormality in interpreting written language. Kaya lagi silang namamali ang spelling. Yung P nila, nakikita nila Q. Yung B, nagiging D. So yung poor in spelling, may dyslexia. Sir, how is it different from apraxia? Ang apraxia is inability to perform purposeful movement. Parang hahawakan mo yung baso, ganyan. Tapos hindi mo naman iinumin, hindi mo na alam kung anong gagawin mo. Apraxia yon. Hahawakan mo yung doorknob, tapos hindi mo naman alam na bubuksan mo yon. Okay? Apraxia yon. So you just get hold of certain things and then you don't complete, okay, the movement. So inability to perform purposeful movement, that's apraxia. Sir, ano yung agnosia? Agnosia yung hindi siya normal. Pag sinabing agnosia, loss of comprehension. Whether that is auditory, that's visual. Sometimes yung pasyente, they fail to recognize objects pag may agnosia. Okay? Kukuha yan ng toothbrush gagamiting hairbrush. That's an indication of agnosia. Okay? So let's move on. 33. The cerebrovascular accident has caused Mr. Bacon to experience homonymous hemianopsia blindness. Okay, so ang homonymous hemianopsia, kalahati ng mata hindi nakakakita. So how would you know na yung kalahati ng mata hindi nakakakita? Hindi niya nakikita yung kalahati ng pagkain sa plato niya. Parang April Boy Regino lang, di ba? So, yung pagkain niya, isang part lang ng plato ang nakakain niya, yung isa hindi kasi hindi niya yun nakikita. Okay? So therefore, it's very, very important that in a patient with homonymous hemianopsia, you have to supervise their eating. Okay? Otherwise, your nursing diagnosis could be altered nutrition, less than body requirements. 34. Although all of the following measures okay. Sir, anong difference sa retinal detachment? Okay. Sa homonymous hemianopsia, the main problem here is on the interpretation of the visual impulses, okay, from the sensory nerve endings in the eyes into the central nervous system, specifically the occipital lobe. Sa retinal detachment, ang problema doon ay structural. Ano ibig sabihin? Yung retina ay humiwalay. Okay? At saka yung portion ng retina, yung layers niya, may nakapasok na fluids, kaya nagkakaroon siya ng floating spots. That's the primary difference. Okay? Okay. So let's move on now. Although all of the following measures might be useful in reducing Mr. Bacon's visual disability, which measure should the nurse teach him primarily as a safety precaution? Turn his head from side to side when ambulating, lalo na pagtatawid. Kasi yung kalahati ng mata niya hindi nakakakita. So kailangan nag-full turn siya from side to side para makita niya kung may sasakyan. Mahihirapang tumawid ang may homonymous hemianopsia. 35. The nurse who admits Mr. Kingley to the hospital documents that the patient has shuffling and propulsive gait. So shuffling and propulsive gait means walking with increasing and quicker number of steps moving forward. So para siyang matutumba forward. This is typical of patients with Parkinson's disease. Now we know for a fact that a patient with Parkinson's disease have a deficiency of dopamine. Okay, the main problem is in the substantia nigra in the brain. Pero dapat mabigyan mo yan ng tsokolate na may content na phenylethylamine para mag-increase ang production niya ng dopamine. Okay? So, let's move on. Saan na tayo? She has observed that Mr. Kingley's walk is characterized by his moving with increasingly quicker steps. Okay. So, let's move on. When the nurse asked Mr. Kingley to undress, he observes that his upper arm tremors disappear as he unbuttons his shirt. So, yung tremor na yan, pag may ginagawa siya, nawawala. Pero pag wala siyang ginagawa, present. Ang tawag dyan ay resting tremors. Now, in Parkinson's disease, the tremors could affect either the fingers of one hand or the fingers of both hands. So, it could either be unilateral or bilateral. Now, pag sinabi nating tremors, what should be the intervention? So, for these types of patients, the tremors may increase pag wala silang ginagawa. But hindi naman pwedeng may gawin na lang sila may gawin. That's why they are given medications like levodopa or L-dopa. In which case, if they are receiving levodopa, pay particular attention to their diet. Okay? Instruct them to be on low-protein diet because high-protein diet contains great amounts of vitamin B6 and that will decrease the absorption of levodopa. So what is important now is you have to understand that the tremors sometimes disappear with purposeful and voluntary movement. Okay, so 37. The nurse should understand that Mr. Kingley's signs and symptoms result because the body suffers from a depletion of the neurotransmitter. And what specific neurotransmitter? Your dopamine. Okay, 38. The many and varied symptoms of multiple sclerosis. Okay, let's talk about multiple sclerosis. Your multiple sclerosis involves demyelination or destruction of the myelin sheath in the central nervous system. In essence, it affects the brain, the spinal cord, and the optic nerve. Kaya nga, early on in the disease, in multiple sclerosis, the patient would usually have diplopia, naduduling, which is corrected by glasses. Kaya saan mo nga siya i-refer pag meron siyang sakit na multiple sclerosis at may diplopia siya? Sa ophthalmologist. Okay? Because meron siyang pathology. Kung kailangan lang niya ng glasses, edi sa optometrist. Pero kung may sakit siya talaga sa mata, edi sa ophthalmologist. Okay, now, because of the demyelination of the neurons in the brain and the spinal cord, the patient will exhibit manifestations like muscle weakness, intentional tremors. This time naman kung kailan siya may ginagawa at saka nagtitremors. So intentional tremors. And then the patient would also have impaired sensation, kaya bawal siyang mag-hot bath kasi hindi niya maramdaman yung mainit, prone sila sa burns, okay? And then they have impaired sexual function. Nawawalan kasi ng innervation yung kanilang sexual organs kasi nga affected ang spinal cord. Therefore, okay, what is the diagnostic test of choice pag mayroong multiple sclerosis? Magnetic resonance imaging. It identifies the areas where the demyelinized neurons are. Okay, so let's move on to number 39. Patients with multiple sclerosis experience many different symptoms. Which of the following symptoms is atypical? Ibig sabihin ng atypical, hindi common. Okay, sa may multiple sclerosis, sudden burst of energy. I told you a while back, in patients with multiple sclerosis, they usually have muscle weakness. Okay, so a common manifestation of multiple sclerosis, pag ang tinanong common would be visual disturbances, diplopia. Meron din silang speech impairment. Meron din silang problems with walking or ataxia or ataxic gait. Meron din silang muscle weakness. Meron din. Meron din silang dizziness. Yes. Okay? Pero wala silang problema sa bleeding. Okay? Wala din silang problema sa impairment of cognition. Okay? So let's move on. 40. Mrs. Carter tells the nurse, my husband also has arthritis, but our symptoms are completely different. Now, the type of arthritis na common in males would be your gouty arthritis, which is affecting the great big toe. Okay, it commonly affects the lower extremities. It's a metabolic problem. Okay, it's due to the accumulation of uric acid. Okay, which could be treated with allopurinol to promote excretion, to decrease formation of uric acid, your colchicine to decrease inflammation, and your probenecid, okay, to promote excretion of the uric acid. A common type of arthritis in female is your rheumatoid arthritis that usually affects the fingers or the upper extremities, leading to ulnar drift. Okay, lahat ng fingers, okay, would drift towards the ulnar bone, ulnar drift, and swan neck deformity. Eventually, the patient at the end stage 4 of the disease will have incapacitation. Nakaganyan na yung fingers niya. Okay? Now, the treatment definitely for arthritis would be early morning warm bath or warm soaks plus aspirin. Okay? Which is entirely different from the treatment of your gouty arthritis. Okay? So, the question number 40, which of the following symptoms of arthritis is unique to rheumatoid arthritis? Joint swelling. Okay? Because, okay, in patients, for example, with osteoarthritis, you have degeneration of the bones, but you don't have joint swelling. In both conditions, osteoarthritis and rheumatoid arthritis, you have pain, but you don't have swelling in osteoarthritis. You have degeneration of the bones, okay? Number 41, if Mr. Carter has osteoarthritis, it would be reasonable to expect that the joints least likely to be affected by the disease would be those of the shoulder. Now remember, osteoarthritis is a degenerative joint disease. So it would usually affect weight-bearing joints. And when you say weight-bearing joints, kasama dyan ang tuhod, okay? Knees, hips, fingers are weight-bearing. So your shoulders are usually not weight-bearing. So they are least likely to be affected. Okay. 42. Which of the following factors would be most likely to increase Mr. Carter's osteoarthritis symptoms? That is an additional weight, and that comes with obesity. So one of the interventions or management for patients with osteoarthritis would be to maintain normal body weight. Okay, 43. Mrs. Kwan, okay, Mrs. Kwan's home contains all of the following items, which poses the greatest risk of her safe use of crutches at home. Scatter rags. This increases the risk for falls. Okay. Next, 44. When Mrs. Sloan complains of pain, the nurse chooses to use the deltoid muscle for a prescribed analgesic medication. Make sure that you use the deltoid muscle when you're administering a maximum of 1 ml or 1 cc of medication. Which area in the diagram illustrates the best site for injecting the drug into the deltoid? That's site D. Okay. The nurse is responsible for maintaining effective traction. Which of the following conditions is necessary for effective traction? The ropes are in the wheel grooves of the pulleys, and make sure that there are no ties along the ropes and that they are hanging, the weights are hanging freely. Okay. 46. When a patient is placed in a balanced skeletal traction, which of the following actions should the would be appropriate for the nurse? Ensuring that the traction weights hang freely from the bed at all times. Otherwise, it defeats the very purpose. Mawawala yung effect. What is the purpose of the person attachment on Mr. De Silva's traction setup? To support the thigh and the upper leg. If autonomic dysreflexia occurs, now take note, autonomic dysreflexia is manifested by signs of increased intracranial pressure, and this is usually triggered by your BOBO. What is BOBO? Okay, bladder obstruction and bowel obstruction. This usually occurs after a spinal cord injury at the level of T6. Okay, so when the patient experiences autonomic dysreflexia, the primary problem will be increase ICP. So what's your priority? Put the patient on high Fowler position. Question, sir, paano yun? May spinal cord injury. Kailangan ba namin i-high Fowler? Yes. Kahit may spinal cord injury, kailangan mo i-high Fowler to prevent the increased intracranial pressure. And then you have to drain either the bowel or the bladder. So kailangan mo i-catheterize yung patient because a full bladder triggers autonomic dysreflexia. So the answer, place the patient in high Fowler position. The most common stimulus for an episode of autonomic dysreflexia, bladder distension. Kung walang bladder distension, bowel obstruction. Preoperatively, the nurse is to instill, okay, several types of eye drops into Mrs. Trevor's eyes. The accepted abbreviation of the right eye, that's oculodexter. Okay, oculodexter is OD. Okay, pag left eye, OS, oculosinister. Okay, pag both eye, OU, oculo-oterke. Okay, anong OQ amin? OA yun, ano ba? Mga tropang Ilocano. 51. After instilling eye drops in Mrs. Trevor's eye, the nurse should apply slight pressure against the nose at the inner canthus of the patient's closed eye. What is the rationale for this action? It prevents the medication from entering the tear duct, or it prevents systemic, okay, absorption of the drug. 52. Mr. Cummings' workup includes tonometry. Now, tonometry is a diagnostic test that is used to measure intraocular pressure, especially if patients have glaucoma. Okay. Now, when the patient's intraocular pressure reading goes up to 25 and above, it could potentially indicate chronic glaucoma. If it goes up to as high as 50, then that indicates acute glaucoma. Okay. Now, glaucoma is treatable. What is given would be your miotics, drugs that constricts the pupil, so that it facilitates the drainage of excess fluids in the eyes, okay, into the lacrimal duct. Okay, now, what happens if you give the patient mydriatic, the drugs that dilates the pupil? The more that it will increase intraocular pressure. So your miotics are given to decrease intraocular pressure. Which drugs are to be avoided? Mydriatics. Okay. So take note that tonometry is a painless procedure with no side effects. 53. Which of the following clinical manifestation commonly accompanies a retinal detachment? Flashing lights and visual loss. So the patient would say, I see a veil-like structure in front of my eye. I see floating spots in front of my eyes. All of these are indicative of your retinal detachment. As part of the discharge stitching, the nurse should instruct Mr. Cody to avoid abrupt or jarring motions of his head. So avoid bending, avoid lifting more than 15 pounds, avoid sudden head movement because this will increase intraocular pressure. Now, listen up, colleagues. Itong mga defects na to, listen, sa eyes at saka sa ears, these are good concepts for test 5. Okay? Now, listen up to the next one. Number 55. Meniere's disease. Okay, what causes Meniere's? Sabi nila dahil daw yan sa aging. Maraming taon. Meniere's. No, Meniere's disease is a disturbance of the inner ear. Very balance in the endolymphatic fluids in the ears, giving rise to vertigo, tinnitus, and hearing loss. That's the reason why the patient would usually say na nahihilo siya, may vertigo. So may subjective vertigo. So the best position for the patient, your priority is to put the patient in a supine position. And the nursing diagnosis would be risk for injury. Now, what type of hearing loss develops? Is it conductive or sensory neural? Since you have a disturbance in the inner ear, it's sensory neural hearing loss that develops. Now, let's compare that to a patient with otosclerosis. Now, in otosclerosis, there's an overgrowth of the bones in the middle ear, the incus, the malleus, and the stapes. Now, what happens is that the patient's bone no longer vibrate. So that sound interpretation may no longer occur. So what happens is that they will undergo a procedure known as stapedectomy or mobilization of the stapes. Okay? What differentiates autosclerosis from Meniere's disease is, remember, in Meniere's disease, it's sensory neural hearing loss. In autosclerosis, it is conductive hearing loss. Now, vertigo is more is occurring in patients with Meniere's disease, and it's not usually observed in patients with autosclerosis. But hearing loss is observed in both Meniere's disease and autosclerosis. The difference, in Meniere's disease, you have sensory neural hearing loss. In autosclerosis, you have conductive hearing loss. 56. While taking Mr. Gordon's nursing history, the nurse identifies risk factors that contribute to the incidence of laryngeal cancer. Now take note, which has the highest probability of causing laryngeal cancer? Is it alcoholism or smoking? Okay, usually it's heavy use of alcohol. But, okay, mas mataas ang risk kung alcoholic na, smoker pa. Now take note, singing in church choir regularly does not necessarily lead to laryngeal cancer. Okay, so number 56, the answer, heavy use of alcohol. Okay, 57, while suctioning, okay, pay particular attention to this fact. You have to remember your concepts of suctioning, especially for test 1 and test 3. Mr. Gordon's laryngectomy tube, the nurse should insert the catheter approximately 10 to 15 inches or 25 to 30 centimeters. The longest period of time the nurse should suction, this is for adults, is going to be 10 to 15 seconds. For infants, should be 5 seconds. Okay, the longest should be not more than 15 seconds. When Mr. Fong complains of pain at the site of his surgical incision, where in the brain is he perceiving the pain? A pain perception occurs in the cerebral cortex. Okay, next, Mrs. Lori is given radioactive vitamin B12 for Schilling's test. Now, what is the purpose of Schilling's test? It is used as a diagnostic procedure for pernicious anemia. What is the main problem in pernicious anemia? You have a deficiency in vitamin B12. Where is vitamin B12 usually absorbed? In the stomach due to the presence of the intrinsic factor. So what happens? Bakit nagkakaroon ng pernicious anemia? Two common things. One, the patient could be aging, matanda na. So nag-atrophy na yung stomach lining. Second would be the patient had surgery. Okay? Tinanggal yung kalahati ng stomach. Okay? Nag-gastrectomy. So nawala yung intrinsic factor. Now, how would you know na wala na siyang intrinsic factor? Then you have to administer vitamin B12. How do you administer it pag diagnostic test? Orally, para ma-check mo kung na-absorb ng stomach. Ngayon, kung umihi yung pasyente and more than 40% of the ingested amount of vitamin B12 is excreted in the urine, ibig sabihin, wala na siyang intrinsic factor. So, kung 100 milligrams yon, tapos ang iniihi niya dun sa kanyang 24-hour urine ay 45 milligrams nung 100 milligrams. So, ano ibig sabihin nun? So, minimal absorption. So chances are meron siyang pernicious anemia. Okay? Ngayon, ang may pernicious anemia, they would need lifetime administration of vitamin B12. Pag treatment na ang tinatanong, it should be administered intramuscular. Bakit naka-IM na tayo ng vitamin B12 supplement? Kasi nga, wala siyang mag-absorb na intrinsic factor sa stomach. How would you know na meron siyang pernicious anemia? You have beefy red tongue or glossitis. Okay? In patients with pernicious anemia, okay, they have a very red, okay, tongue. Okay, so the primary purpose of this test is to measure the patient's ability to absorb vitamin B12. 61. Okay, so let's move on. Mrs. Lori is likely to suffer from the symptoms of vitamin B12 deficiency, even though frequency ng vitamin B12 administration once a month. Okay, she consumes normal amount of food containing this vitamin. What is the reason for vitamin deficiency? The inability to absorb the vitamin because the stomach is not producing enough intrinsic factor. Bakit nga hindi nagpuproduce ng intrinsic factor ang stomach? Kasi nga yung pasyente either matanda na or nag-gastrectomy. Okay, next, let's move on. Mrs. Lori asks why she cannot take vitamin B12 orally. The nurse should explain that oral administration is unsatisfactory because a lack of intrinsic factor prevents the absorption of vitamin B12. So you need your intrinsic factor in your stomach to promote absorption of vitamin B12. Okay, let's move on. Next. If Mrs. Lori did not have pernicious anemia, from which of the following foods would her body normally obtain its best supply of vitamin B12? Now, ang best supply ng vitamin B12 ay meats and dairy products. Hindi nyo ba alam na ang beef, mataas ang vitamin B12? At pag mataas ang vitamin B12 mo pag mag-exam ka, aba maganda ang thought process. Increase ang nerve impulse transmission, mas mabilis kang mag-isip. Kaya kung ako ikaw, sabihin mo sa nanay mo ha, okay, pwede bang beef muna ang kainin mo habang ikaw ay magbo-board exam? Siguraduhin mo lang napapasa ha, dahil pag hindi, ipapaluwa ng nanay mo yung tipak-tipak na beef na pinakain sa'yo. Okay? So kailangan pumasa. Nagpabili-bili ka ng karne. Yung mga kapatid mo, naghati-hati sa tuyo. Ikaw nagkarni-karni ka. Ang kakainin daw ni Stephanie, beefy muscles ni Pogi. E paano sir pag walang beef? Ano pa ba yung mga sources ng vitamin B12? Dairy products, 'di ba? Milk. Okay, your creams. Okay? Pwede rin nuts. Okay? Marami rin namang vitamin B12 ang nuts. Although ang green leafy vegetable, vitamin B9 yan. Folic acid, hindi siya B12. Okay? Yung cereals naman, vitamin B1 yan. Okay? It's not necessarily vitamin B12. So ang cereals, vitamin B1. Sabi naman ni Rama, gatas daw sa kanya. Kaninong gatas kaya ang hihigupin niya? Okay? 64. Mr. Ketter is placed in reverse protective isolation. Okay? Which of the following statements best describes the primary purpose of reverse isolation? Reverse isolation helps prevent the spread of organisms to the patient from sources outside the environment. Okay, 65. Mr. Chavez is lying in an upholstered reclining chair when the nurse arrives. Where should the victim be positioned for CPR? Hindi mo pwedeng i-CPR to sa reclining chair. So put the patient on the floor before you perform your CPR. Okay? So pay particular attention to the fact that your mattress or upholstered furniture is not a good surface for exerting the pressure to compress the heart. Okay? The pressure will become ineffective if the patient is on a sofa. 66. The xiphoid process at the lower end of Mr. Chavez's sternum should not be decompressed when performing external cardiac compression because of the danger of lacerating the victim's liver. This is what I'm trying to tell you a while back nung nag-interact kami ni Prof. Jem. So when performing external chest compression sa adult, o kanina sa bata yung 1 to 1.5. Sa adult, 1.5 to 2 inches. Okay? With a vertical downward push. Okay? So, next, number 68. During CPR, Mr. Chavez's pulse should be checked at regular intervals. Ito na, carotid artery. Hindi pwedeng femoral artery ang i-check mo. Which of the following would have provided the best emergency care for Mr. Paul at the site of accident? Now, we have here, ano yung accident na yan, sir? Burns. So, you have to pour cold water over the areas where there's burns. Sir, paano pag dumikit yung shirt ng pasyente, wag mong tanggalin. Hayaan mo lang siya doon because you're causing more harm pag tinanggal mo yung nakadikit na damit niya. Another precaution the nurse should take when bandaging Mr. Paul's hand is to make sure that the patient's hand and finger surfaces do not touch each other. Dapat i-bandage mo sila separately. Otherwise, magdidikit-dikit yan. Okay, next. 71. Miss Bilbil mo itak-in. Ang cute ng pangalan. May nagtanong ano daw ang functional concept sa CPR. Always remember in CPR, quick breaths dapat. You don't prolong the breaths because if you prolong the breaths, you will limit the number of compression that you can perform. So you always have to remember quick breaths are done. Miss Bill mo itak in. Is presumed to be in the early stages of hypovolemic shock. Now, what defines shock? Always remember this class. Hypotension defines shock. So in a patient with shock, the priority is to check the blood pressure. Remember chance, whether the client is having cardiogenic shock, hypovolemic shock, anaphylactic shock, or neurogenic shock, as well as septic shock. In all those conditions, you have low BP. Which type of shock will the patient have bradycardia? Di ba kasi pag shock, hypo, taki-taki, hypotension, tachycardia, tachypnea. But you have a type of shock na merong bradycardia. Ano yon? Neurogenic shock. Associated with head trauma. Now, in which type of shock naman will the patient would usually have elevated temperature? That's going to be your septic shock, secondary to infection. Okay? So let's move on. Number 71. Miss Bilbil mo itak-in is presumed to be in the early stages of hypovolemic shock. Which of the following assessment data indicate early shock except? Okay. Walang bradycardia sa shock. Meron tayong tachycardia. Okay. So that ends my presentation for this set. Okay. Now bring out your set C1. Okay. C1. Okay. Set C1 na tayo. Okay. And for set C1, Prof. Jem.
Yes, I'm here.
Are you in, Prof. Jem? Spirit of
Yes.
where are you? Andiyan ka pa rin sa second floor?
Yes, I'm here.
Kasi nagugutom na ako, kakain ako. And then after our session, I'll come over again. Class, are you learning? Say yes dun sa mga magtatap sa board at papasa sa board. Go!
Yes. Wow.
Yes po. Yes.
Sabi ha?
Yes.
Ano ba to? Naglilitsyon ano na ako, nagmamantika na ako, Prof. Jim.
Yes.
Yan, sir. Okay, you did a great job naman po.
Oo nga. Diyos ko, nagugutom na ako. Okay. Itong mga nandito
Kain ka na, sir.
natin magtatap yan. O wag
Yeah,
na
for
nakalimutan
sure.
yung highlight natin ng CHN bukas ha.
Top the exam, guys.
Okay. Oh, meron pa, hindi pa tayo tapos. Set C pa lang tayo. Di ba, Prof. James?
Yes.
Ka?
Yes, I still have set C and set E.
Okay. And then after mo, pasok ako for set F. O, di ba?
Yes, set fact.
Class! Are you enjoying?
Ah,
Okay. Are you enjoying? Type
Yes.
response. Andito daw. Hi, Sir Ronsal. Okay. Nakita kita. Ako nag
Hello po, sir.
Okay. Okay.
Hello.
Class, are you enjoying?
Yes.
Sir, nag-enjoy kami.
Yes.
Ang mga team Dogyot ng
Yes.
Ilocos. Dog.
Yes po, sir.
Team Dog yun.
Okay. Okay. Present silang lahat. Lalo na yung mga Team Cebu natin. Present sila dyan. Oy, Team Cebu. Okay. Maayong ano
Team
na.
Cebu.
Maayong,
Maayong hapon.
May hapon.
maayong hapon man.
Maayong hapon sa dakong utin. O glukod.
Yung lubot. Uy, alam mo, nung nandyan ako sa Cebu, diyan ko na-experience yung kasi ang dami kong galing magmasahe dyan. Bago ka masahe, tatanungin ka pa. Sir, anong gusto mo? Soup o mudirit? Ganon.
Ano sinagot mo?
Sabi ko, ano bang difference ang soup at mudirit? Sabi ng isa. Sir, anong gusto mo? Soup-supin ko pa o mudiritso na?
I love it. I love it. Sup-sup, pero diretso na din.
Inistrakan ko na kanina ang PR team ng Gapos Review System, Team Maninimot. Okay? Magdi-distribute kami ng RN medals the moment
Yes, of
the
course.
result, ha? So make sure you have your home address. Lilinawin ko na. Give me your address, sabi ko dun sa isa. Ang binigay, email. Paano ko mapapadala to na email?
Picturean mo na lang, scan natin.
Home address, hindi. Maganda rin kasi yung meron silang ganito. Medal yun.
Yeah,
Sabihin
it's
na naman, basta ngayon
personalized.
lang ako nagka-medal. Okay? Yes, class, this is for free. Yeah, you're not going to pay anything. Okay? Okay,
Yes.
nawawala daw ng anxiety. Salamat, Jay.
Isa kang anti-anxiety.
Pamain daw ng medal, oo, kailangan maging RN muna. Nasasanla ba ito? Oo, dito sa RA Gapos Pound Shop mo isanla. Punta ka dito sa RA Gapos building dito sa UN Avenue. Go, go, go. Take it
True.
up, Jem. I'm taking so much of your time. Kakain muna ako. O,
Yeah,
hala-
sir, enjoy mo lang po. Mga 10 oras po ako dito. Charot.
Okay. Okay, akyat na ako dyan sa second floor ng Gapos building.
Okay po,
See
sige
you,
po.
see you. O, maayong buntag ba, Gapos baby sa Cebu? Okay.
Jay, thank you, Sir Ray, for that wonderful topics. Wow, wow, wow. Okay, para naman ako namang YouTube vlogger nito. Okay, hello mga kababbles. And also mga ka-BTS and butter natin dyan. Okay? So, for our next session, we have now your set C. So, set C is usually some topics that we can actually find from the nursing practice part. But again, it's more important that we have to take note of the integrations of different questions, different answers, so that we are very much prepared. Again, let me just inform everyone. Okay, that when you take your test, it may not be as exactly as we said today, the board exam, but at least the concept, the principles are being mastered. Are we clear, mga kababols? Ano na yung mga kabubbles? Okay, we have NCR plus bubbles here, right? Yes, I hope you are now holding the rundown set C1. Okay, am I correct? Yes, mga kabubbles. O, di ba? Saya. Mga RN bubbles, are you ready? Okay, of course. Okay. Sunod, mga ka-COVID na kayo. Kasi mag-aalaga ka ng COVID patients. But anyway, that is actually a positive one. Because if you are caring for a COVID, definitely you're now a registered nurse. Okay. So let's go now, mga kabubbles, sa ating rundown set C1. Okay, so number 1, Miss Lintek. Bakit ganun pag Miss Lintek talaga? Pag lalaki, maganda yung pangalan. Okay, medyo ano din to, no? Bias. Okay. So anyway, so Miss Lintek appears slightly cyanotic on admission. So the cyanosis that accompanies bacterial pneumonia is primarily due to, the answer is poor oxygenations of blood. Always remember, once there's a presence of cyanosis, we always consider that there is decreased circulation with the blood and also the oxygenated blood. And always consider, once we try to identify the difference between a viral pneumonia to a bacterial pneumonia, we commonly identify the secretions. If the secretions are commonly whitish, then we presume that this can be just a viral pneumonia. And again, a viral pneumonia is not treated with antibiotic. Do not forget it. Okay, plus a bacterial pneumonia, okay, we commonly identify them with the presence of colors, no? It could be rusty, it could be greenish or dark green. Okay, so some cases, no, we try to identify that bacterial pneumonia is commonly occurring in community. Okay, that's why we have those terms like community-acquired pneumonia. As the most common type of pneumonia, right? Although there are some cases also that once you are hospitalized, you can also develop pneumonia. We call that as your hospital-acquired pneumonia. If you're receiving care in a long-term facility, you can develop the HCAP or healthcare-associated pneumonia. Or if you are having ventilator, then you can develop that through ventilator-associated pneumonia. So one thing for sure, if you're suffering from pneumonia, our priority will always be what? Airway. And the fact that the client is suffering from bacterial pneumonia, the priority is the complete treatment for antibiotic regimen. Are we clear? The antibiotic will always be based on the type of bacteria present, okay, or causing infection to the patient. Are you learning? Yes or no? Yes. Okay. So don't forget now, when we are trying to care for patients with bacterial pneumonia, what type of precaution do we implement? It's definitely a droplet precautions. As much as possible, we have to protect ourselves when we are caring for patients by using surgical mask. Okay. And if the patient would be considering getting outside of the room, then allow the client or ask the client to use surgical mask as well. Are we clear? Yes or no? Yes, okay? So let me just also inform that for patients with pneumonia, for elderly, they usually suffer from confusion. So confusion is another sign of infection to an elderly patient. Do not forget it. Again, bacterial pneumonia should be treated completely with antibiotic. Bacterial pneumonia, okay? Okay, next number 2. So since this is still related to pneumonia, what is this? Is this a question? Okay. As being A, is this a question or fill in the blanks? Okay, but definitely, okay, when do we actually consider that pain may occur in a patient with pneumonia? Okay, so pag ganito yata yung tanong, ang talino mo pag nasagot mo pa to ng bonggang-bongga. Okay, yung tipong ang binigay lang sa'yo as being a blank. Ikaw nang bahala. Mabuhay ka hanggat gusto mo sa sagot na yan. Okay, so the answer here is definitely, okay, the pain that is moderate, okay, and that worsens on inspirations. Mom Jem, why? Why there is a pain when the patient is actually inspiring? Generally because of the inflammation. Okay, the inflammation causes now friction between the pleural layers. So that pain is related to pleural friction. Every time they watch, okay, every time they inspire. Okay? So for how many days po mag-take ng antibiotics? It depends on the microorganism present, no? Okay, usually naman if it's gonna be for adult, okay, that would require like, okay, 7 days, okay, to 2 weeks. But again, it will still, okay, be prescribed according to the antibiotics and microorganism, okay, that infects the client. Okay? Okay. So next number, okay, 3. An anti-tuberculosis drug that may damage 8th cranial nerve is prescribed for Valkis. Okay, 8th cranial nerve damage is common side effect of which drug? Are we trying to refer about ototoxicity? Yes. Okay, and we know the fact that if you're caring for patients with tuberculosis, it requires multi-drug therapy. Why? Okay, because we are trying to prevent the resistance of the medications to the patient's bacteria. Okay, so the thing there would be, if the patient has been on a medication therapy, most especially antibiotic, it is necessary for the client to complete it. Whether the patient feels well or good enough, okay, from taking it from the start, and then midway, the patient already feels nothing is bothering anymore, still, the patient should be emphasized with completing the treatment until the end, okay, to prevent that resistance, okay, of bacteria to the antibiotics. So therefore, when we talk about the medications that causes ototoxicity, it's what we call your streptomycin. Streptomycin is one of the medications we use for TB patients. We commonly identify this rights, if you could still remember, the rifampicin, isoniazid, okay, pyrazinamide, ethambutol, and streptomycin. Okay, that should be taken for about 6 to 12 months. Okay, and the patient should be compliant with this medication. Well, we know the fact, okay, that rifampicin can cause secretions, okay, change in color, such as red, orange, okay, that the patient might feel bothered about it. We have to say that red-orange secretions, including the tears, the saliva, the sweats, are just expected when taking rifampicin. Okay, isoniazid can cause peripheral neuropathy because it decreases the amount of vitamin B6. Okay, while your pyrazinamide can cause diarrhea because it causes GI abscess. Okay, while ethambutol can cause blurring of visions. Okay, but one thing for sure, no? Okay, rifampicin, isoniazid, pyrazinamide can be hepatotoxic. So when we say hepatotoxic, we have to consider reporting any form of liver impairment. And the most common one is basically the presence of jaundice. Okay, jaundice. Well, for patients with ethambutol treatment, we know that this can lead to optic neuritis. So if that optic neuritis occurs, we have to notify the doctor. Plus, the streptomycin can cause ototoxicity, yes or no? Yes. Nephrotoxicity as well, yes or no? Yes, and neurotoxicity as well. So it is very important while taking antibiotics to always increase the amount of fluid intake. Okay, and safety is a priority. If this causes now damage to the 8th cranial nerve, which is our acoustic or the auditory nerve. Okay, do not forget it. Okay, next, number 4. Which member of Mr. Valkis' family is the highest risk for contracting tuberculosis? Before, we used to remember that most at risk is the very young. Since very young at this age or the primary tuberculosis are being protected okay, by the vaccinations. The most at risk now is basically the older one. Okay, elderly clients are more prone to suffer from tuberculosis. Okay, aside from that, if the patient is immunocompromised, then you expect the client to suffer from these infections. Okay? Okay. So number 5. Okay, so look at the age, 76-year-old mother. Okay, so it's considered to be an elderly because it's more than 65. Okay? Okay, next number 5. Which of the following physical assessment findings is typical in a patient with advanced, advanced obstructive pulmonary disease? You know, every time we see those terms like advanced obstructive pulmonary disease, we commonly associate it with COPD. And you are not wrong with that. That is basically correct. So what we used to remember there is what? Increase anterior posterior chest diameter. Yes or no? Yes, okay? So that is commonly present because we know the fact that once you are suffering from COPD, the alveoli is basically damaged. So what happens when there's a damaged alveoli? The air is trapped and the lungs compensates, no? Okay, for you to still breathe, okay, by expanding the surrounding area. So, okay. Wait. Okay, there's someone who might be having sex at this afternoon. Let me just mute you so we cannot hear your moans. Okay. Oh. Okay, please be careful when you are opening your microphone. We might hear your Okay, so please be careful. Okay, no? Okay, next, ready. Okay, so increase anterior posterior chest diameter is what we commonly known as your barrel chest. Okay, are we clear? Yes or no? Yes. Okay. Next, number 6, oxygen. Okay, oxygen at the rate of 1.5 liters per minute via nasal bronchs is prescribed for Mr. Whitney. Okay, which of the following statements best describe why Mr. Whitney's oxygen therapy is maintained at relatively low level of concentrations? Okay? Ma'am Jem, sorry to interrupt. May I ask lang po, may recording po ba this lecture? Pwede po ba na ma-access after something came up po? Definitely, you can access it whenever you want it. Okay, there's a recording for this. Okay, so you can actually watch this every time you'll have some form of activity. So that's fine as long as you are comfortable. Okay, so maybe your internet is acting up, then that's fine. I understand it. Okay, anyway, so what is the rationale why we need to keep a low flow of oxygen to our patients with COPD? So the answer is basically what? It's in here, no? The patient's respiratory center is so accustomed to high carbon dioxide. Okay, and the low blood oxygen concentration, that's changing this concentrations with oxygen therapy may eliminate the patient's stimulus per breathing. You know that is true. And yet you know the fact that the patients with COPD comes with emphysema and also the term that we identify as chronic bronchitis. If the alveoli is already damaged, therefore it cannot actually get the right amount of oxygen to be equalized with the amount of carbon dioxide. So maintaining that low flow oxygen will maintain the client's ability to breathe. What is the best position if the client will suffer from shortness of breath? Okay, it's basically orthopneic position. Orthopneic position. Okay, and as much as possible, we teach our clients on how to perform pursed lip breathing. Okay, pursed lip breathing. So when we say pursed lip breathing, we teach our client to inhale through the nose. Okay, it could be for 2 seconds, but the pursed lip exhalation should double the amount of inhalation. So if you do the 2-second inhalation from the nose, you do the pursed lip exhalations for 4 seconds. Okay, and knowing the fact that since patients may have some form of asthma, which is a common finding of patients with COPD, you expect patients will also be treated with asthma. Okay, so it can be the use of bronchodilator, the use of steroids. Yeah, okay. So those things are important things to consider for COPD. Again, we are talking about respiratory. No matter what respiratory problems we encounter in the test, we always consider that the priority will always be airway. Are we clear with that? Yes or no? Okay, yes, very good. Okay, next, number 7. Okay, Mr. Whitney, you know what the students would usually tell? Okay, you always hear, no, okay, our voice on the test. No, if you listen very carefully, as if we are actually whispering the answers on the test. Okay, so if you memorize the voice that we have right now, okay, not just the laughters, it can be an advantage to you later on. Okay, but if you remember the sounds of having sexual activity during this test, then that could be a problem. Okay, so number 7, Mr. Whitney receives theophylline. Okay, we have theophylline, ethylnediamine, or aminophylline intravenously. Okay, every 6 hours. Which of the following changes in Mr. Whitney's conditions would indicate to the nurse that the drug is exerting its primary again? Okay, so let me just mute you. Yeah, so the drug exerting its primary desired effect. Definitely, this is a bronchodilator. Okay, and a bronchodilator would cause our breathing, okay, no, more effective, and it's easier, okay, to breathe. Okay, hoy, anong boses SpongeBob? Tumigil ka dyan, I feel like I'm Ariel, a mermaid. Okay, anyway, number 8. The major intervention nurse can carry out as a means of preventing lung cancer. Lung cancer is basically preventable. Okay, and one of the most common risk factors for developing it is smoking. So if we can just emphasize, okay, the effect of smoking, okay, in relation to lung cancer, then, okay, this can be prevented. That's why the answer here, okay, is emphasize the positive relationship of cigarette smoking to lung cancer. Okay. So the fact that we know, okay, that lung cancer is related to smoking, why people they would still be on verge of taking or using smoke? Is it really a knowledge deficit, or they're just ignoring the fact that they will not have it? Now, we always have the saying that regrets will always be in the end. That's true. Okay, because people are actually waiting for the time that they are diagnosed with cancer before they realize that smoking is not bad, that is not good for our health. Bakit kaya ganun ang tao, no? Kung kailan nagka-cancer, gusto daw na magbago. Therefore, maybe the best strategy, yung nag-umpisa pa lang siya mag-smoke, sabihin mo na may cancer ka, baka sakaling tumigil agad. Okay, if that can only be possible. But you know, the purpose of our health teaching is to always encourage our client to have a positive change. Okay, positive change. Okay, so emphasize the positive relationship of cigarette smoking to lung cancer. Okay, next, number 9. So the goal of the nursing diagnosis, impaired gas exchange, is to promote optimal ventilation. So all of the following criteria indicate attainment of this goal, except, you know, when you are developing tachypnea, is that something that we consider abnormal? Yes, because the facts, don't forget, the facts that a patient is suffering from tachypnea, there's also an indication of hypoxia. Okay, do not forget it, hypoxia. Okay, so the thing is, okay, this identifies, no, okay, an indications of a worse condition, not a good. Okay, so next, number 10. While caring for Miss Rand, the nurse remembers the basic rule to follow when caring for a patient with chest tube and water seal drainage system. Which statement contains one of these rules? Okay, when stripping the chest tube, and drainage system, strip only small segments. Why? Okay, Ma, what is the difference between stripping and also milking? Remember, no, when we see fast possibility of obstructions to the water seal, okay, no, we don't find the fluctuations on the water seal. So possibility there is an obstruction or the lungs or the lung has re-expanded. Okay, when the moment that it's not related to lung re-expansion, okay, we do stripping or milking. Milking is basically pressing the tube, pressing the tube continuously from the chest wall to the bottle. But when we talk about stripping, you just compress. Iniipit mo lang. Okay? Why do we have to be very careful when stripping and doing the milking? Because that can also induce pneumothorax. Okay. And we have to prevent that. Okay. We have to prevent that while the client is on chest tube. Are we clear? Yes or no? Yes. Okay. So when stripping the chest tube and drainage system, okay, so strip only the small segment. So you don't induce problem related to pneumothorax as well. Okay, number 11. Mr. Taylor's respiratory rate is 40 beats per minute, and breaths per minute, and his blood pressure has fallen 100/60, with a weak rapid pulse at 96 beats per minute. Okay, with a diagnosis of right rib fracture. Okay, so what we used to remember for this, the client with right rib fracture and closed pneumothorax should be placed in position. Now, for any form of fracture on the ribs, we consider to help the patient to breathe much easier. Okay, so position is keeping the patient's head of bed elevated. So the answer here is semi to high Fowler's position. Okay, or they could be tilted toward his right side. Why, Ma'am Jem? Because if the patient develops rib fracture on the right, we usually splint it to reduce the pain. But Ma'am, is splinting necessary at all the time? No. Okay, we just consider temporarily splint the rib just to reduce the pain. But frequent splinting can also cause problem later on, since splinting reduces the lung expansion, making now a problem related to breathing. So splinting will just be a temporary treatment. Okay, since it also reduces the amount of expansion of the lungs. Okay, so that's what we consider for this. Now, okay, so again, pneumothorax will cause a patient to feel about shortness of breath. So the fact that there's pneumothorax, the fact that there's refracture, keep the patient's head of bed elevated to facilitate ventilation, most especially on the unaffected lung. Okay, you don't compress the unaffected because that's the only lung that helps you to breathe much or more related to the problem. Okay, so therefore the answer here is semi to high Fowler's position towards to the affected. Okay, number 12. On admission, Mr. Taylor's blood gases were pH 7.20, that's acidosis. PaO2 64, that's hypoxia. PaCO2 of 60, that's quite higher. So patients can have now respiratory acidosis, no? And bicarbs of 22, so that's normal. So chest tube is inserted. 30 minutes later, his repeat blood gases are pH 7.30, so it has improved. PaO2 of 76 improved. PaCO2 50 improved. Okay, and the bicarb remains 22. So this change indicates improving respiratory status. Very good. Okay, so with that basic analysis, okay, you know that there's improvement with the client's pattern of breathing. Okay, Ma'am Jem, in cases of respiratory acidosis, what is the initial intervention that we can perform independently as a nurse? Teaching the patient to deep breathe and cough. Okay, if the oxygen is not yet available, teaching the patient to deep breathe and cough to revert that respiratory acidosis. Okay, so remember that respiratory acidosis occurs when the breathing becomes much slower than usual. Okay. Okay, so again, the answer here is improving respiratory status. Next, number 13, the nurse administered oxygen to Mr. Taylor by nasal cannula, but 3 liters per minute. approximately at what percentage of oxygen is Mr. Taylor receiving through the nasal cannula? We usually consider the rates at 1 liter to be 20 to 25%. So you just add 5% to be to have an approximations. So 1 liter, 20 to 25%, 2 liters, we have that 25 to 30%, then 3 liters, 30 to 35%. We always consider also that nasal cannula can carry a lowest amount of oxygen concentration. So if we need to have a highest amount of concentrations related to oxygen administration, we might better use a non-rebreather mask. Okay, so usually non-rebreather mask can actually administer a concentrations, no? Okay, higher than your nasal cannula. But if you need a precise oxygen concentration, it's better to use the Venturi mask, okay? Okay, so that's one thing that we have to remember. Are we clear with the topics? Yes or no? Yes. Okay, so this is what you need now. Oxygen. If you think you cannot find the right answer on the test, please take a deep breath. Okay, take a deep breath. Now, the exam for 100 item is basically quite longer. So you learn how to answer. You learn how to relax yourselves during the test. All right? Okay, next, number 14. On Mr. Taylor's 5th operative day, the water level in the long glass tube in the chest drainage bottle stops fluctuating. What did I tell you a while back? So that can only be meaning for two. Okay, one, you are suffering from a blockage, or number two, the lungs were expanded. So the nurse is justified in judging that most probable cause for this occurrence is that the lungs are expanded. And this is commonly confirmed by chest x-ray. That's why when the water seal in the chest tube stops, you call the doctor will order for a chest x-ray. Okay? So the answer is letter A. Emma, what's the purpose if the lungs are expanded? It means that you can now remove the what? Chest tube. Okay? You can now remove the chest tube. But every time you remove the chest tube, you ask the patient to what? Okay, do the Valsalva. Why? To prevent pneumothorax. Okay, by holding their breath while closing the glottis when removing the chest tube to prevent pneumothorax. Are we clear? Yes or no? Yes. There are some questions that usually came out on some nursing questions, like what if the test tube dislodged inside the ward? You can actually cover it with vaselinized gauze. Okay, but when the test tube has been removed accidentally outside the room, then you can actually use any material that is clean enough to cover the opening on the chest. The purpose of that is definitely to prevent pneumothorax. Okay, and the bottle should always be below the waist because it's for drainage. Okay, so next number. Mrs. Myra Hall, age 60, is admitted to the emergency department with crushing substernal chest pain that radiates her shoulder, jaw, left arm, and the diagnosis is acute myocardial infarction. The patient is extremely restless and frightened. What do we remember when we see the term MI? Is this life-threatening? Definitely yes. It's a heart attack. It's a heart attack, okay? So what causes the heart attack of new generations nowadays? When they are blackmailed that they have sexual scandal. Okay, so it's very important not to record your sexual activity, right? Okay, but then anyway, when we talk about myocardial infarction, we know the fact that there is obstructions of the coronary arteries. Before, okay, we used to remember that if you're having MI, oxygen is given first, but not with the current evidence, because oxygen in an obstruction cannot totally relieve the problem of patients with acute MI. Remember when we discussed the cardiovascular, if the type of MI is partial obstruction, we call this NSTEMI. NSTEMI, partial obstruction. And the medications we use would be aspirin or heparin, but no thrombolytics yet. We use the thrombolytics aside from aspirin if there is complete obstruction, and that is what we call STEMI. So when we see the term partial obstruction, we call it NSTEMI. Complete obstruction, we call it STEMI. Again, the thrombolytic is not yet effective for partial, Okay, but it's more of a complete obstruction when we use the thrombolytic. But both partial and your complete, okay, can be managed with aspirin or heparin. Okay. Okay. Another thing that I have to emphasize, what are the 4 ECG tracings that we find in a patients with MI? Number 1, there's a presence of ST depression. Number 2, ST elevation. So ST depression, ST elevation are both present. Number 3, we have your T wave inversion, as in tatay wave, T wave. Okay, so T wave inversion, and the last one is pathologic Q wave. So the pathologic Q wave seems to be the permanent ECG tracing even after recovery of our patient. So it means even after recovery from complete treatment, patients with ST depression, ST elevations, and T wave inversion will be removed when they recover. But pathologic Q wave usually signifies that there's a presence of injury. Okay, so the thing is, the question, immediate admission orders for Mrs. Hall include oxygen by nasal cannula at 4 liters per minute, blood work and chest x-ray at 12 lead EKG, and 2 milligrams of morphine sulfate. So which intervention is the priority and should be accomplished first? From the problem that we see on the test, there's substernal chest pain. So this time comfort is a priority right now. Okay, since you have given the oxygen already. And there's an ECG already. Okay, so you need to administer the intravenous, morphine sulfate. Are you learning? Yes or no? Yes. So one of the tips that I have to emphasize is to always look at the basis for your answer. If you don't see your answer to be correct, go back to the question again. Okay, 2 hours is too long for 100 items. Mom, I am not prepared. Of course, you're a Gapos baby. You are prepared enough. We've been there. Okay, you have accomplished several questions on the test that we have given. Okay, so number 16. The pain associated with Mrs. Hall's myocardial infarction is due to insufficient oxygen reaching to the heart muscle. And that can also be related to the obstruction that affects the coronary arteries. Okay, so number 17. Cardiac monitoring is done on a continuous basis. For Mrs. Hall, if nurse notes that the patient has 8 premature ventricular contraction, having PVC in a non-constant situation is just fine. But look at here, 8 premature ventricular contraction, it's no longer normal. What is worse when there's a premature ventricular contractions, this can lead to what? Severe arrhythmia. So the thing is, if there's consistent prematurity of PVCs, you always have to consider notifying the doctor immediately to be given with the right medication and treatment. Because the thing is, when this PVC patient constantly experiencing this problem, and then they suffer the chest pain, that becomes an emergency now. Why? A PVC with chest pain is considered emergency because it means the patient develops ventricular tachycardia. Okay, so therefore, Mom Chem, what is the drug of choice that we expect for ventricular irritability, just in case it will be asked on the test? Lidocaine. Okay, lidocaine. Are we clear with that? Yes or no? Yes. Are you learning? Are you still with me? Okay, I might be talking here and no one is listening. Okay. Are you still there?
Yes.
Okay, yes po. Ayan. Okay, ramdam ko ang iyong presensya. Correct. I love that voice. Yes, ma'am. Yes, ma'am. No.
Yes, ma'am.
Okay, so I hope you are eating while we are discussing, no? Okay, at least you could have some foods, to eat with you. Okay? Okay, got tayo. Nakakahawa po yung tawa nyo. Okay, anyway, good vibes lang. Okay, next, because I want you to feel that you are prepared enough for the test. Although we always have the saying that no one is prepared for the test, but you have to lift it up to God. Okay, the fact that you have done everything for it, and even if you are not sure about your answer, pray. Okay, because even if we know that we are right about the answer, what if it's not being prayed for? Okay, so look for grace. Okay, so ready? Okay, so tapos tatanungin niya, Ma'am, sino po si Grace? Okay, next. Oral furosemide LASIK is prescribed for Mrs. Hall. Which of the following signs and symptoms documents the need for this medication? Remember, no, we use diuretic if we know that there are accumulations of fluids. And usually, patients with MI can turn into what we call heart failure, where water retains, or it could be related to what? Pulmonary edema. Okay, so what we used to remember for this, the patient has rales in the lower lobes of the lungs. So when we see that rales, we know that there's existence of what? Okay, water. Oh, let me just mute again because I think there is a rat. Daga, ano ba yun? Shame. Okay, Miss Shame, I just muted you. Kung hindi, makikill ka nila. Kill, slain, ganun. Okay, again, the presence of rails, okay, could mean that there's a presence of what? Okay, fluids. Ma'am, question, when do we expect that LASIK as a diuretic will take effect? Because some of us would take note, it would take 1 hour to have a diuretic effect. You know, you have to consider that LASIK can actually have its effect in like, 10 to 20 minutes. Okay, so the answer here, is the patient has rales in the lower lobes of the lungs, so that could be pulmonary rales. By giving furosemide LASIK, it will be reduced. Okay, so it's okay, Shane. We understand you. Okay, so just be careful with your microphone. Okay, because you might be doing some private thing over there. Okay, and we don't want to disturb you. Okay, so next number. Okay, in which of the following position in bed is that congestive heart failure likely to be most comfortable? Definitely. Okay, when the head of bed is elevated. So we consider sitting nearly upright or high Fowler's position. Yes or no? Yes. So the comfortable position is for the client to breathe. Okay, Mom, what do we actually see when there's left-sided? No, because some of you might not be common until now. Again, if it's left-sided heart failure, you know that the affected part of the body or organ is what? The lungs. So whatever manifestation that affects the lungs, it's more of a left-sided. But when there's a water accumulations now in the body, you know that there is now a right-sided heart failure. Okay, can a heart failure patient develop pulmonary edema? Yes. The fact that a patient will have a sudden dyspnea or shortness of breath while having congestive heart failure, then suspect for pulmonary edema, the best intervention is to increase the head of bed, position into what? High Fowler's position. Are we clear with that? Yes or no? Yes, because that type of position will increase the lung expansion. Get it? Yes or no? Yes. Number 20. Okay, Mrs. Beaumar receives oxygen therapy. So the nurse can best evaluate the effectiveness of oxygen therapy by observing changes in Beaumar's arterial blood gases. Why? Okay, because when you administer the oxygen, no, okay, it will definitely overcome the hypoxia and also the dyspnea. Definitely. Dapat hindi ka na mahihirapang huminga. Okay, kasi may oxygen eh. Okay, so the thing there is, okay, the best way to evaluate the effectiveness of oxygen therapy is to observe the changes in arterial blood gas levels. Do not forget it. Okay, this is most often done by determining the pressure of oxygen in the blood, PaO2. While when the PaO2, the normal is 80 to 100, no, is high hemoglobin carrying large amounts of oxygen. So ibig sabihin, pag tumataas ang PaO2, you are reaching 80 to 100, effective ang oxygen administration mo. Are we clear? Yes or no? Okay, yes. So furosemide LASIK is administered to Mrs. Beaumar intravenously. How soon after? Okay lang yan, di ba ma'am? Isabay din yung aldactone, okay, sa furosemide and digoxin. There are some cases that it can be, okay, depending. Kasi pag, for example, no, you are CHF patient and you are taking digoxin, Okay, and then you are also taking furosemide Lasix or aldactone. You are just preventing the potassium imbalances. So that's fine. Okay, so that's fine. Because if you are having heart failure and you develop potassium imbalance, okay, that could trigger arrhythmia. So it's fine. Okay, so next number, okay, 21. Let me go back to this. Okay, so how soon after intravenous administrations of drugs should the nurse begin to see the results of drugs' desired effect? 5 to 10 minutes, correct. Okay, and usually that's the initial. But you know, the peak actions of the diuretic usually occurs about 30 minutes or half hour. Okay, so next number 22. Mrs. Alden has been taking digoxin, lanoxin, and furosemide Lasix. See, and has been maintained on quinidine sulfate to control atrial dysrhythmias. A problem that Alden may experience because of quinidine. That's true. Okay, no, that quinidine may enhance digoxin toxicity. Ma'am, same lang po ba yung digoxin o aspirin? No, that's different. Alexander. Okay, that's different. Digoxin is for a cardiac contractility of heart muscles. Aspirin is a drug that can be used to reduce clots. Okay, those are different. Alexander, why did you forget that? Okay? Parang ano yun, no? Kaibigan mo lang nakakalaro. Alexander, why? Okay? Don't forget that. Okay, anyway. Okay? So that's how you manage it. Okay? So kala mo jowa, Alexander, why you forget it? Okay, anyway. So quinidine sulfate may cause elevated serum digoxin levels. Yun pala. Okay? So furosemide Lasix may induce hypokalemia. True. And the fact that you induce hypokalemia, no, that also increases digoxin toxicity. Parang i-X lang naman. Hindi naman. Alexander, are you good? Okay, next.
Ma'am.
Again, with quinidine sulfate, may cause elevations of serum digoxin level. Lasix as a potassium wasting can also increase digoxin toxicity. So we have to be very careful with that. Okay, now what are the common manifestations of digoxin toxicity? We commonly associate it the same as your lithium toxicity. You have to remember the what? Naphtha. So what is naphtha? Nausea, anorexia, vomiting, diarrhea, and abdominal cramps. Okay, and some cases you would hear the patient complaining about the TV images don't look good to me. We call it xanthopsia. Xanthopsia is a greenish or yellowish visual discolorations related to digoxin toxicity. Okay, and yet digoxin toxicity can also decrease heart rate. Okay, so you have to always check the heart rate before giving digoxin. Okay, no, because bradycardia. Okay, it's also a sign of digoxin toxicity. Okay, so Mr. George, is that you? Small. A 54-year-old sales executive is admitted to the emergency department with a bleeding duodenal ulcer. So he has been treated for peptic ulcer disease over the last 3 years and has recently noticed an increase in the frequency and severity of his pain. He was brought to the hospital when he vomited bright red blood. Remember, the purpose why we need to treat the ulcer is to prevent bleeding, because the bleeding can later on lead to shock. Okay, what is the difference of gastric to duodenal? Usually the location. When we feel the pain after eating on the left side of our stomach, that's gastric. When we feel the pain after 2 hours of eating at the right side of our stomach, that's duodenal. So usually if pain relieves the ulcer, or if food relieves the pain, we commonly identify as duodenal ulcer. But if the food increases the pain, that's gastric ulcer. Okay, so we have to vomit it to reduce the pain. So usually vomiting reduces pain, that's gastric. Food reduces pain, okay, that's duodenal ulcer. So the question now is, the physician orders a nasogastric chute to be inserted for irrigations of the stomach. Which of the following insertion techniques would most likely make it more difficult to nurse to insert the tube? So definitely it's letter A, having the patient tilt his head toward the chest while inserting the tube. So how do you position yourself when inserting the NG tube? Okay, we usually tell the patient to hyperextend the neck, and as much as possible, if he or she could what, swallow, okay, for easier insertion. Okay. Okay, do not forget it. No? We know before, no, that when we are locating the possibility of approximations of the insertion of the tube, we commonly use the nose, the ears, and the xiphoid process. Okay, so 24, if a gallstone becomes lodged into the common bowel duct, then we should anticipate that color of Miss Met gallstone would most likely be gray. Okay, mom. Okay, why do we consider that gray in a patients with cholelithiasis? Okay, so we expect, okay, because when bile is not reaching the intestine, do not forget it. When bile is not reaching the intestine, the feces will not contain bile pigments. So the stool then becomes gray. Okay, or if you don't see the term gray, clay-like or putty-like color. Okay, but what if it's black, Milena? Okay, black Terry, that's an indication of upper GI bleeding. Okay, so next, number 25. So Mrs. Metcalf undergoes a cholecystectomy, and choledochotomy, and returns to her room with an intravenous infusion and a penrow drain and a T-tube in place. In order to evaluate the effectiveness of T-tube, okay, so the nurse should understand the primary reason for using a T-tube. So this is the ready, given here. Prevent bile from entering the peritoneal cavity. So the question is, until when does the patient would have this T-tube? Until it recovers. Okay, so therefore, okay, how much bile would the nurse expect the T-tube to drain during the first 24 hours? 300 to 500 ml. And usually it decreases after 24 hours. Usually after 24 hours, like 2 to 3 days, it would just be approximately 200 ml. Okay, 200 ml. And one thing that you have to remember, since T-tube is actually what? Okay, has a hole, okay, that serves as drain, you have to consider monitoring the consistency of the drainage, the consistency and color of the skin, because there could be chances of infections while having the T-tube. Okay, clear? Okay, so do not clamp the T-tube without doctor's order. Okay, so next, number 27. Pancreatitis, is this pancreatitis or pancreatitis? Pancreatitis is most accurately described as an acute inflammation of the pancreas that produces obstructions and edema. Although we know that there are several factors that can cause pancreatitis, but we expect that there could be some sort of autodigestion, where the enzymes may not be released because of the damage to the pancreatic ducts, or this could be related due to chronic alcoholism or those with hypercalcemia. Okay, so that could inflame the pancreas, and the hormone tuloy, the secretions of the amylase, the enzymes, for fat digestion are staying on the area, which further cause obstruction. Okay. Okay. So the thing is, when there's a problem with GI, as long as there's what we call inflammation, okay, pancreatitis, cholecystitis, okay, with these two type of problem, the priority should always be comfort initially. Okay, comfort. Okay, and usually GI problems would be comforted by just performing or allowing the patient to be on NPO. Okay, NPO, so that metabolism will not be forced, okay, to be triggered, and it will just reduce the amount of too much inflammatory problem. So therefore, the answer here is acute inflammation of the pancreas, okay, that produces obstructions and edema. Number 28, the initial diagnosis of pancreatitis will be confirmed if Mrs. Ottinger's blood work is significant. Definitely, you look for the elevated enzyme produced by your pancreas, and that is amylase. If not, you can see the lipase as well. So that amylase and lipase are commonly elevated when there is acute pancreatitis. Okay, next, number 29. A colostomy irrigation is ordered for Mrs. Long on her 5th operative. This is 5th post-operative day. So the primary purpose of this irrigation, do not forget this, is to stimulate the peristalsis. Do not forget it, okay, no? So in short, you are just doing this to flush the colon. Okay, so remember, why do we have to perform it? Because we expect that on the colon, okay, there is no what we call, okay, normal, okay, sphincter. Okay, there's no sphincter, okay, that could cause elimination control. So we do it manually, okay, by performing colostomy irrigations. Ano ba ibig sabihin ng colostomy irrigations? You need to infuse water to the stomach. Okay, so next, number 22, 30, okay, but 22 some. I've missed long complaints of abdominal cramping after receiving approximately 150 ml, okay, solutions during the colostomy. The nurse should temporarily, you know that normally happens, okay, you need to stop the flow of, okay, solution. So just to remind everyone that abdominal cramping that may occur, okay, during colostomy irrigation is due to stimulations of the colon, okay, by the irrigating solutions. Okay, mom, stop and wait, then continue. Yes, okay, that could be possible. And let me finish, okay, my statement. Okay, so the first course of action is to stop the flow solution temporarily. Okay, Geraldine, ready? Until cramping subsides. Oh, see? Okay, so you can continue it if there's a need to continue. Okay, so as long as, okay, you, okay, consider to use the amount of solutions for irrigation. So usually naman pag irrigations, how many ml of water do we actually administer? 500 ml. Okay, 500 ml for irrigating colostomy. Okay, so number 31. Appropriate skincare will be an important aspect of patient teaching for Mrs. Long. Which of the following preparations would best apply around their colostomy? Caraya paste. I don't know if you are familiar with Caraya. If you don't see the term Caraya paste, you can actually use the Stomahesive. Stomahesive, Caraya are both effective agents for protecting the skin around the colostomy. Okay, why? Okay, this keeps the skin healthy and prevents enzymatic action in skin by drainage from the stomach. Okay, ma'am, how about the use of cornstarch? Because there are some misinterpretations. Cornstarch, petrolatum, antiseptic creams. Do we consider those things are protective? No. So you can just consider Caraya, okay, and also, okay, Stomahesive. Okay, okay. Next, number 32. Which position would be ideal for Mrs. OD? Okay, in the early post-operative period. Prone. Why? Okay, this time, I think the question now is related to post-hemorrhoidectomy. Please correct this number 32. Okay, please write it there, post-hemorrhoidectomy for number 32. Okay, positioning early post-hemorrhoidectomy should avoid stress, pressure on the operative site. So prone is best. Okay. Okay, number 33. The basic component of Mr. Goldstein total parental nutrition is most likely to be the hypertonic glucose solution. And the thing is, when we talk about total parental nutrition, what's the best way to assess its effectiveness? Improvement with the weight of our patient. Remember when we use the hypertonic glucose solutions through TPN, it normally causes diarrhea to the patient. Okay, because of high concentrated sugar. So aside from the diarrhea to be expected, you also have to check the client's blood sugar level because it may cause hyperglycemia. Tada! Yes or no? Yes. And we always expect now if it's TPN, it should not be stopped abruptly because it kinda may lead to rebound hypoglycemia. Okay, so when withdrawing or stopping this, it should be gradual, okay, to prevent that rebound hypoglycemia. Okay, okay. So don't forget it. Number 34. Mr. Carlos' weight has not changed over the last 6 months, but he has noticed, okay, his noticed that his abdominal girth has increased. The nurse recognizes that the pathological basis for the development of ascites is the presence of portal hypertension. And it's there, decreased serum albumin and decreased colloid osmotic pressure. Yes or no? Yes. You know, albumin is very important in keeping that osmotic pressure. Okay, so if you have less albumin, we retain the water. Okay, so the development of ascite is the result of increased pressure in the venous system, low levels of serum albumin, which can contribute to the decreased colloid osmotic pressure. Okay, ascites can also be related to sodium retention. Okay, the fact that there's already ascites, we have to limit the water intake. The thing is, ma'am, can these patients with ascites have paracentesis? Yes. If this is necessary to be performed, then that can be considered. Paracentesis means aspirations of excess fluid from the peritoneal cavity. But the thing is, before paracentesis, you just ask the client to void so to prevent accidental puncture again. Okay, next, number 35. Mr. Carlos' condition stabilizes and the Sengstaken-Blakemore tube is removed. Ma'am, when do we use that Sengstaken-Blakemore tube? Okay. Ma'am Jem, anong veins commonly used for TPN? If we talk about veins for TPN, we use the central, subclavian, and also the brachial. Common veins we use for TPN insertion, subclavian and brachial. But every time we use the subclavian vein, we have to make sure that the patient is placed in Trendelenburg when inserting the catheter to prevent air embolism. Okay. Okay. So again, let me go back here. Okay. So, Ma'am Jem, pa-clarify po. Okay, fluid volume excess or fluid volume deficit, main problem for liver cirrhosis with ascites. The fact that you have the ascites, you have fluid volume, excess. Okay, you have enough fluids in your more than enough fluids in your body. Okay, definitely. Okay, so next, ready? Okay, we have Sengstaken-Blakemore tube is used to compress esophageal bleeding. Okay, the doctor's orders oral liomycin enema. The purpose of this therapy is to remove intestinal contents and block ammonia formation. Remember, the fact that you are using antibiotic, so definitely, it will reduce the amount of what? Bacteria. Okay, yes or no? Yes, okay? Okay, so don't forget it. So with your neomycin, so that's basically a what? Antibiotic. Very good. Next, number 36. Mr. Carlos' serum ammonia levels begins to rise and his physician orders 30 ml of lactulose. Okay, orders 30 ml of lactulose cephalon. Which of the following effects would be expected? Diarrhea. You know, lactulose can acidify the colon. Why? This is laxative. So it is expected that the patient will have this one. Okay, diarrhea. Yes or no? Yes. Okay. So next, number 37. Mrs. Torres' hyperthyroidism cannot be controlled by medication, and she elects to have surgery. She is admitted to hospital and scheduled for a subtotal thyroidectomy. Okay. So if the following hospital rooms are available, which would be best nurse to select for Mrs. Torre? Okay, so a private room located in an area where the patient has privacy and quiet. Remember, no? Okay, a hyperthyroid patient is hyperstimulated. So the thing is, we need to consider the patient placed in a private room so the patient will not be triggered. So maintaining a quiet environment is necessary for patients to have a good rest. Okay? Okay. So another thing is when there's hyperthyroidism, we commonly see that the metabolism is quite faster. So you expect the client to have vital signs increase, weight loss because of faster metabolism, diarrhea, and they usually suffer from this heat intolerance. So the thing is, when the patient is suffering from hyperthyroidism, it really requires the client to have medications. And commonly we administer methimazole, tapazole, or propylthiouracil or PTU. In cases that it might turn into what we call Graves, where we see the exophthalmos or protruding eyeballs, then medications may be added, okay, with the use of Lugol solutions, no? Okay, or propanolol if the heart rate cannot be controlled, because of too much increase in the thyroid, okay, problem. Okay, so 38. Which of the following symptoms might indicate that Mrs. Story was developing tetany postoperatively? You know, tetany is an indication of low calcium level after removal of the thyroid. So there could be chances that there's an injury that occurs on the parathyroid gland after surgery. So the tingling of the fingers is commonly an initial manifestations of tetany. But aside from this, tetany can be related to bronchospasm, laryngospasm. That's why we need to prioritize the airway. Okay, so it also causes seizure into the patient. So the thing is, when tetany develops, this is life-threatening. We have to prioritize the airway of our patient. Calcium gluconate is very important, okay, to support or revert the problem related to tetany. Okay, oxygen, tracheostomy must always be there, okay, post-operatively. So which of the following techniques would best enable the nurse to assess Mrs. Story's wound for bleeding? So we usually find, the bleeding at the back. Okay, so we have to gently slip her hand behind the patient's neck and check for blood on the back of the neck in bed linens. Okay, so we expect for those patients who had their hyperthyroid surgery or thyroidectomy, we expect the client to have this tracheostomy to support a patent airway. Okay. Okay, and bleeding is one of the common complications that might occur after this thyroidectomy. Number 40, the nurse learns that through her assessment that Mrs. Lanza ordinarily wears articles clothing described below. Okay, the nurse should recommend that Mrs. Lanza continues wearing. I think this number 40 is asking about, asking about protecting the leg of a diabetic patient. Okay, so Mom, is it good to use knee-high stockings for a diabetic patient? No. That's why it's written here. Okay, the nurse should recommend that Mrs. Lonzo discontinue wearing knee-high stockings. Why? Because what we know with the knee-high stockings, it has a circular elastic tops that constrict the blood circulations from upper to the lower part of the leg. So that is not good. Okay, remember, the fact that the patient is suffering from diabetes, there could be chances that the patient is having poor circulations of blood. Okay, and we need to prevent that poor circulation that goes into the lower extremity of our patient. Okay, okay. So better yet to wear pantyhose. Okay, number 41. Mrs. Lanza tells the nurse that her feet often feel cold and her skin is very dry. So which of the following factors is least likely to be contributing to patients having cold feet? Definitely wearing low-heeled shoes. Okay, least likely. But what are the common contributing factors? Anything that could cause constrictions of our blood vessels, such as smoking, wearing round garters, crossing the legs, so that would cause poor circulations of blood. Number 42, and may cause the patient to experience cold feet. Number 42, after 5 years of treatment, Miss Lonzo, now age 60, needs to switch to insulin therapy. The oral hypoglycemic agent is discontinued and isophane insulin suspension is prescribed for her. Miss Lonza is taught to take her insulin at 8 a.m. each day, at which time Miss Lonza greatest risk for hypoglycemia. Remember, if insulin is used, the greatest risk of hypoglycemia would usually on the peak action of insulin. So if this is NPH, you expect that it will be 8 to 12 hours from 8 a.m. So you just have to what? Count. The time. So if it's going to be 8 to 12 hours after that 8 a.m., so you expect the client to have that about 5 p.m. shortly before dinner. So mom, is it necessary that once the patient is using insulin, they have to have this simple glucose? Yes. Okay, just in case that they experience this hypoglycemia, at least okay, the patient will not develop that hypoglycemia, right? Okay, so they must always have this simple glucose okay, for them to prevent okay, the effect of hypoglycemia when they feel the peak actions of the insulin. So is it important for us to remember the onset, the peak, and the duration? Definitely yes. Okay, although not all types of insulin will be asked, but at least you have okay, to know something about it. Are we clear? Okay. So next, number 43. Mr. Chang. Okay. Si Chang ba ang may-ari ng Ching Chang So? Charot. Okay. Okay, go tayo. So Mr. Chang should anticipate a need for increased glucocorticoid supplementation in which situation? Okay, ma'am, why do we need to increase glucocorticoid? Usually, the increase of glucocorticoid is in response of preventing stress, okay, and usage of what do you call this? Too much insulin. Okay, most especially if the patient is diabetic. So the thing is, okay, here having dental work performed. Why? Because it will take most of our insulin, causing okay, patient to have ay sorry. Nakamute po ba? Nakamute? Hindi ako nakamute. Okay, daw nakamute. Okay naman. Okay, so repeat. Okay, so increasing glucocorticoid is necessary once we experience stress or illness. Okay, stress or illness. Okay, so that could actually prevent some form of crisis in our body once we experience okay, short okay, amount of okay, insulin. Kailangan natin kaya minsan parang sa ano lang yan, parang sa diabetic. Pag diabetic ka, pag nagkasakit ka, pag magsa-surgery ka, pag something that will cause stress in your body, you need to supplement with an insulin. Okay, so that's also the same. Okay, the episodes of illness or surgery that can put stress on our body would require us to increase or adjust the dosage of glucocorticoid. Okay, to prevent some form of complications. Okay, next, number 44, Mrs. Sprikitik. Kamag-anak ba ito ng Sputnik? It tells the nurse that the physician said her morning serum cortisol level within normal limit. She asked, how can that be? I'm not imagining all the symptoms. The nurses respond to be based on the knowledge. This one is related to Cushing's disease. And we know the fact in Cushing's that there is increased cortisol level. Increase in what? Sugar, glucocorticoid, increase in sodium. We have that mineralocorticoid. Okay, so you expect in Cushing's everything will be up except for potassium. No? And sometimes it also it decreases the calcium. So usually we have that hyperglycemia, hypernatremia, hypertension, but hypokalemia. Okay, for Cushing's disease. Okay, so the thing is, you want to click something? So the answer here is exists
Hindi po,
or
ma'am. Kasi po, parang nagsasalita po ata si Sir Gapus po. Hindi lang po ata sila naririnig.
Okay.
Hindi mo
Sorry.
naririnig?
Ay, hindi po, sir.
Hindi ka nag-auditory.
Ayun na, sir.
Hindi, doon sa insulin, I just would like to highlight para dumali sa students.
Sure, sir. Balik ko. Ito, sir.
They just have to remember that hypoglycemia occurs before meals. So pag regular, before lunch. Pag intermediate acting, before dinner. Pag long acting, before breakfast the next day. So they don't have to memorize the hours. Oo.
Okay.
Tapos yung initial symptom ng hypoglycemia.
Ulit, sir.
Diaphoresis. Yeah.
Ulitin
Diaphoresis. Mahina daw.
Paulit nga, sir.
Mahina po yung boses mo, sir.
Okay. Ayos ko lang yung microphone ko.
Yes.
Okay. Yan. Narinig.
Yan, sir. Okay na po.
Okay. So masyadong mataas yung microphone. Okay. Tandaan lang dun sa insulin, para hindi nyo na to i-memorize, always remember, pag regular, hypogly occurs before lunch. Pag intermediate acting, before dinner. Tapos pag long acting, before breakfast the next day. And then the signs of hypoglycemia, remember the D's, diaphoresis or cold sweats, dizziness, then difficulty of problem solving. Okay? Hi, our Gapos baby sa Cebu. Good day. Maayong buntag. Okay? And then, tama yung hina-highlight ni Prof. Jem. So, tandaan nyo, yung peak of action, that's when hypoglycemia occurs. Okay? And then, if hypoglycemia occurs, you have to counteract by administering a glass of juice or any rapid-acting sugar. Okay? Hard candy could be appropriate. Example ng hard candy, Jem.
Penis? Candy ba yun? Kasi hard din naman yun Charot.
Example of okay. Yung 5 pieces.
Charot
Hard
lang.
candies pwede na. Okay? Ilang pieces daw ng hard candy? 5. So, ilan dapat ang boyfriend? 5. Okay? I would like to highlight that, making sure that everybody understands about when hypoglycemia is most likely to occur. Okay? So, way to go, Prof. Jem. Alam mo na highlight yung Cushing's. Remember you, everything is up except potassium. And then sa addison B, everything is down except potassium. Everything is down except potassium. Okay, way to go, 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 go.
Okay, so again, to repeat, the excess cortisol in Cushing's disease is often a result of a loss of the normal diurnal secretion pattern. Again, what to remember for this, everything is up except for potassium. So hyperglycemia, hypernatremia, hypertension, and hypokalemia. Okay? So the exact opposite of that is your Addison's disease. So Mrs. Spricketick's diets need to be modified to control her symptoms. Which diet would be most appropriate? Definitely, you need to consider high protein, low calories because there's already hyperglycemia, and restricted sodium diet because there's already hypernatremia. Okay, Miss Calcal's veins. Kalkal talaga. In all of the following areas appear easy to enter. So which area the nurse used first? Okay. So here, okay, the answer is the back of the hand. Okay. Okay. So when starting an IV infusion, this one is related to IV infusion. Okay, so this one is IV infusion. So what we do, the nurse initially uses the veins low on the hand or arm. Okay, so we must always consider whether there are damages or problems with the skin integrity of our patient. So we need to prevent those things when inserting an IV. Okay, so 47. Miss Calcal, okay, undergoes left nephrectomy after it is determined that her left kidney is non-functional. Her post-operative order states that daily urine specimen to be sent to the laboratory. Miss Calcal has indwelling Foley catheter attached to urinary drainage system. So which procedure for collecting a urine specimen is most often recommended? So definitely it's letter A. Okay, remove urine from the drainage tube with a sterile needle and syringe and place urine from the syringe into the specimen container. Okay, so what we need to remember, we have to maintain the sterility when we collect something from the Foley catheter. Okay, 48. Miss Calcal also has urethral catheter in place. A priority nursing action, definitely. Ensure that the catheter is draining freely. The purpose of having that catheter is to help in passing out the urine. So there should be no obstruction, keeping it in right position, lower than the bladder, to keep it patent. Number 49. Okay, where should the nurse take Miss Calcal? So this one is girl, no? Usually when you talk about Foley catheter to be placed, it is on the patient's inner thigh. And for boys, we usually use the lower abdomen. Okay, lower abdomen for boys, and patient's inner thigh for placements of indwelling Foley catheter to secure and prevent that urethral irritation. Number 50, Miss Janjaran's Miss Janjaran's blood urea nitrogen level is elevated. This most probably occur because of, definitely the answer is reduction in renal blood flow. Okay? So urea. Urea is an end product of protein metabolism, and it is normally, okay, excreted by the kidneys. So therefore, if there is problem with the kidneys, okay, BUN supports, okay, the data which signify that there is no acute kidney injury. But if you're going to consider which one is most sensitive to the kidney damage, we consider the serum creatinine. Okay, so the normal BUN that we consider for the test is 10 to 20. Anything above consistently, anything that we consistently above 25 will be considered an indication of a renal impairment for BUN. Okay, if Miss Ginger and Jen's potassium level were to continue to rise, hyperkalemia, then they should be prepared for which of the following emergency situations? Cardiac arrest. Why? Hyperkalemia can trigger severe cardiac dysarrhythmias. Okay? Okay. So that's why when we consider damage to the kidneys and the potassium level is more than 7, we expect that the client should be in dialysis. Okay? To prevent the complications as well. Okay, which of the following symptoms would nurse expects Mrs. Turner to report during this assessment? This time with Mrs. Turner, the problem now is related to cystitis. Okay, please write down to your material cystitis. And if the patient is suffering from cystitis, this can cause burning and frequency with urination. Usually you develop cystitis if you have left an untreated UTI. So for a UTI, that should be completely treated so that it will not cause a complication leading to bladder infections or inflammations. Okay, so next, number 53. A midstream urine specimen is ordered and the nurse tells Mrs. Turner how to collect the specimen correctly. So which of the following should nurse include in the instructions? So this one is a midstream. Okay, midstream urine specimen. So the answer is void directly into the sterile specimen container. Right? Yes or no? Yes. Okay. So usually naman, it would just take like 30 ml of urine would be needed for this type of specimen. Okay, but the patient of course can do it by herself. Okay. Number 54. The specimen is sent for a sensitivity test. The primary purpose, the culture and sensitivity would mean to identify the specific microorganisms so that it would give us the right medication to treat the problem. Okay? So number 55, Mr. Bardangisi complains that what's that? Okay,
Bardang kasi ibig sabihin pinagtampuan ng gluta.
Ang miyembro ng gabinete. Okay. So, Mr.
Bardangisit yun. Oh.
Ayun pala yun.
Oo.
Feels nauseated at least part of every day. The nurse should explain that nausea is the result of, definitely, the accumulations of waste products like urea in the blood can increase the client to feel nauseous. Nauseous. So usually naman this can be removed by means of dialysis. Okay? Okay, next, ready? We have number 56. During Mr. Bardangisit's dialysis, the nurse observes that the flow of dialysis stops before the full amount of solution has drained out. What would be appropriate nursing intervention? So usually this is peritoneal dialysis. If there is just a decreased flow rate during peritoneal dialysis, turning the patient from side to side can actually cause a drainage to increase. Okay? So what is basically considered here, you just have to help the patient to reduce that obstruction that can impede the drainage system with the use of peritoneal dialysis. Tada! Ayan. Natapos natin tong set na to. Okay. Meron pa ba tayong set? Okay. Ay, Sir Ray, meron pa yata ko isang set. Okay.
Ikaw pa.
Yeah. Set 1. Set 1, 2 for life. Charot.
I think set E.
Set E, yes, sir. Set.
Okay.
Okay.
E, go,
So
go.
we'll continue the discussions. Please bring out your set E. Okay, set E. Yeah. Okay, there you go. Tantanan. Uy, natututo ba kayo dyan, mga kabubbles? Okay, mga kabubbles, NCR bubbles. Okay. So, yan. Worldwide pala tayo ngayon. May nanonood ba sa atin ngayon from different countries? Charot. Excel.
Oo. May sa atin sa ano, galing ng Barrio Tokok, Pangasinan.
Tukok Elementary School.
Galing Gumamugam. Okay.
Okay, mga kabubbles, pakicheck naman po ang ating materials.
Jem, Prof. Jem, may tanong ako sa'yo. Anong part sa Cebu ang favorite mo na nami-miss mo na?
Namimiss ko ang Oslo.
Eto Sera, sa Puente Osmeña lang tayo pabalik-balik. Meron pala kila Jasper, Barangay Pukatod. O, di ba?
Okay,
Barangay
Pukatod.
Pukatod. Sa amin may Barangay Tukok. Wag kang ganyan. At may tukok. May tukok. Ano ba?
Elementary School.
Dadaanan ko yun pag pumunta ako sa amin. Ano Prof. Jem, ano naman nami-miss mo sa Davao?
Namimiss ko sa Davao, yung food.
Ako last time, dinala nila ako dun sa yung parang Little Baguio on top of the hill.
Ano yun?
Doon kumain-kain kami ng ihaw-ihaw.
Oh. Okay, ano yun? Di pa ako napunta ron kasi usually yun lang ako sa city. Charot.
Okay.
Okay.
Game tayo. Take it
Okay.
up, Prof. Jem.
Yes, sir Ray. Thank you also. Again, okay, Okay, set E na tayo. So are you prepared now for the set E? Okay, so let's have some pointers about your set E. Ready? Number 1. This one is more of psych, no? Okay, so this practice of trying to comprehend psychological state of another or trying to perceive how he feel. Usually we use this term when we want to understand one's experience or feelings. And we commonly know this as your empathy. Empathy is the quality of being aware of feelings and emotions of another and perceiving how he feels. Usually we have that saying, okay, you put yourselves into the shoes of others, no? Yun yung mga, nagbibigay sa atin ng sense of empathy. Okay, so
Prof. Jem, anong difference ang empathy sa sympathy?
Okay, sympathy implies a warmth, okay? Or a warm toward or urge act to alleviate distress. So it means parang ikaw naman yung naaawa pag sympathy. So it's more of non-therapeutic.
So sympathy is being subjective, di ba? S, sympathy, subjective. Empathy is maintaining objectivity.
That's true.
Okay.
Okay, so which one is better? Empathy.
Empathy.
Okay, number 2, Mr. Pak Ganern. Bakit naman ganun? Okay, Mr. Pak Ganern is concerned that the information he gives the nurse remain confidential. So which of the following comments would be best the nurse to make in these situations? So the answer here is, if the information you share with me is important in relation to your care, I shall need to share it with the staff. That's true. Although what we consider as we are caring for our patients, maintaining confidentiality and privacies are very important. But the fact that the treatment would include knowing the data about our patient, then there's no breach of confidentiality when you share it to those healthcare workers involved in caring for a patient. Okay? So most especially if it's suicidal, no? Okay, so you always include the healthcare team involved in caring for the patient to know about the situations. Okay? Number 3. Okay, on the day following an interview during which Mr. Pak Ganern talked at the length tearfully about feeling useless and unmanly since his retirement, he fails to keep an appointment with the nurse. Which of the following action would it be best for the nurse to take? Answer, seek him out. okay, at the end of the scheduled interview time and tell him he was missed today. Why? Because as a nurse caring for our patients, okay, we have to maintain the professional and therapeutic relationship. Okay, so in that case, okay, patient will not be reluctant and hesitant to tell everything about their problems. And maintaining a good relationship with the patient professionally and therapeutically will help us, will help us to find a better solutions for the problems of our patients. Although, as much as possible, we let our patient to identify their own problem and we just assist them to explore it, the possible solutions. Number 4, while Mr. Pac Ganern is taking ternylcypromine, this one is Maui. Okay, one type of food should most certainly be taught to avoid because of its high thiamine content. We know this very well, no? That aged cheese, okay, processed products, okay, canned products are avoided while taking Maui, such as your tronylcypromine sulfate, because it increases hypertensive crisis. Okay, so one thing for sure, we have to be very careful, okay, in avoiding those thiamine-rich foods to prevent that hypertensive crisis while taking monoamine oxidase inhibitor drugs. Okay, okay, so just in case you need to consider, okay, an antidote that we can use for hypertensive crisis, we use phentolamine regitin. Okay, so next, Mrs. Stephanie Channeling. Aga 56 insists on being taken to her room immediately upon admission to the hospital. She orders one nurse to unpack her clothes, another to bring her some coffee, and a third to get her agent on the phone for her. She states, I am greatest actress since Sarah Bernhardt. I will take my meals in my room. You may prepare my bath now. Mr. Channeling, okay, says his wife that has not slept for 3 nights and has spent her days writing checks to charitable institutions. Wow, yeah, man. Which they can ill afford to do. Mrs. Channel has bipolar. Grabe, yun lang pala yung sakit ni Mrs. Channelin. Na-channelin pa ako. 5. Okay, bipolar disorder manic phase. Mrs. Channelin puts out her hand and says to the nurse, watch out, here I come. She then puts her hand down and sits in a chair. At this time, after the nurse determines that the patient is not about to harm anyone, it would be best for the nurse to intervene by talking to the patient, taking the patient to a punching bag to exercise to release excess energy. Okay, so what we used to consider at this time is helping the clients to act out the aggressive behavior so it will not cause too much problem when they express it in a different way. So we provide that type of activity so that it will not cause any harm or threat to others later on. Okay, so we try to manage their hyperactivity, aggressiveness, overactive behavior. Okay, so to prevent harming others as well if it's gonna be performed in a different manner of behavior. Number 6, the nurse knows that Mrs. Chanelin is too busy investigating the units and overseeing the activities of other patients to eat much dinner. To help Mrs. Chanelin obtain sufficient nourishment, which of the following plans would be best for the nurse to remember, hyperactive patients should have this foods that they can carry, the portable foods where they can actually bring. Even if they are having hyperactivity. So therefore, the answer is serve foods that she can carry with her. Okay, so just allow the patient to bring foods whenever she is suffering from hyperactivity. Number 7, while watching the televisions in the lounge, Mrs. Chanelin says quickly and abruptly to the nurse, the sun is shining, my son is in Virginia, who's afraid of Virginia Woolf. Which of the following disorders is the patient displaying? Flight of ideas. Okay, so when we talk about the flight of ideas, it's basically rapidly shifting of thoughts. Okay, no, rapidly shifting of thoughts. Commonly seen to those patients having problems with their thinking. So usually, if this is an indication of flight of ideas, usually this progresses to having slurred speech later on. Okay, so ma'am, how do we actually help the patient to reduce that flight of ideas? Asking the patient to stay calm, okay, and focus on the conversations or subject of the conversation. Okay? Okay, next number. Okay, Mrs. Mary Butchok, 49, is admitted involuntarily to a psychiatric hospital. Her admission 30 days by court order document said with her side, among other things, that she will not eat because she feels her stomach is missing and her bowels have turned to jelly. She views this as just punishment for past wickedness and for evil I have brought on my family. To be evaluated as being legally committable, which of the following criteria did Miss Butchok most likely have to meet? So the answer here is the patient must have tried to harm himself or others. Okay, why? Okay, so again, okay, if the situation calls for patient's impairment with the reality, okay, we have barangay dulpit. Okay, we have to make sure, okay, that there could be no occurrence of injury or harm, okay, that can be performed by the patient to himself or herself, okay, to others as well. Number 9, Mrs. Butchok has not been eating. After serving the patient her tray, which of the following action by the nurse is most likely to encourage Mrs. Butchok to eat? Since Mrs. Butchok feels like having depression, okay, and having possibility of suicide later on, okay, how do we encourage the patient to eat? Okay, presence, okay, together with the patients, okay, so sit beside the patient and place the fork in her hand. Remember, when we are caring for, okay, when we are caring for a patient who is depressed and with suicidal ideation, the best way to encourage them to do activities is the one that we can provide and set the schedule for them. So if we can do that, okay, for our patients, since they are passive at the moment, they will be encouraged to do it. And the fact that we sit beside the patient, it actually encourages or motivates them to do something. Okay? Okay, so yes, yan, yung mga ano ni Sir Ray, sample, pakibasa na lang sa chat, no? Okay, thank you, Sir Ray. Number 10, okay, Mrs.
Joke yung definition.
Sorry, hindi ko nabasa. Akala ko nag-ano na. Suicide is best defined following the suggestions. Okay. Ang nabasa ko, avoid coke in can.
Tama yon, yung coke in can. But yung rosary beads is okay.
Yeah, that will not cause death.
Pero yung rim of books kasi, pwede nilang tungtungan yon para magbigti.
True. Okay, so avoid those things that can be used for suicidal attempts. Number 9, okay, and number 10, Mrs. Butchok demands to be left alone to die. If you try to cheat the Avenger, you will suffer. Mrs. Butchok tells the nurse which of the following possible replies by the nurse would be best. Okay, I leave you alone for 15 minutes, then I will be back to see how you are doing. Remember, when the patient described in these situations wants to be left alone to die, it is best to leave the patient for a few minutes, but return to see how the patient is getting along. Okay? What you just did initially is you acknowledge the patient's request. Okay, but we have to also make sure that it will not be performed. Okay, and that can be possible when we go back immediately, short after, okay, we left the patient. Okay, and we always consider, okay, we have to consistently monitor the patient frequently, okay, in an irregular intervals. Okay, so we could prevent the patient to do the suicidal plan. 11. The nurse is careful not to act rash or impatient with Miss Corey and gradually learns that the patient is very down and feels worthless and unloved. In view of the fact that Miss Corey made a suicidal gesture, previously were unhappy, which of the following interventions by the nurse is indicated at this time? Okay, so the answer is she should ask the patient frankly if she has thoughts or plans of committing suicide. You know, when we talk about suicidal, the best therapeutic communication that we can implement is direct questioning about her plan to commit suicide. Okay, in that sense, bringing that subject directly to the suicidal patients may be more beneficial to talk about it. Okay, so a patient may implore, the patient may talk about it once we ask them directly. Okay, number 12. A friend of Miss Cor's depressions asked the nurse, what is the best way to act around her since she's been so blue? When the nurse considers therapeutic to behave with Miss Corey, it would be best for her to recommend that friend avoid behaving. Okay, so wait, there's someone who is actually doing household chores. May pumapok-pok. Okay.
Nagbubunot.
May gumagawa pa yata ng bahay while preparing for the board exam. Okay.
Meron lang ako na-receive na tanong sa messenger ko. Kailan daw ba ang board exam? Diyos ko, kanina pa tayo nagdadaldal dito sa rundown. Tapos tatanungin kailan daw ang board exam. Matawa ka naman, Diyos ko. Ipagdasal natin sila at sila hindi nila alam ang kanilang ginagawa. Nalilito na.
Reality disoriented pa. Okay? So again, why do we avoid being cheerful in front of a depressed or suicidal patient? Because that would make them feel more guilty and more unworthy. Kasi nako-compare nila yung pinapakita mong behavior sa nararamdaman nila. So as much as possible, we avoid that being cheerful. Okay, no, when caring for our patient who is depressed and suicidal. So in short, we should act naturally and professionally. Okay, number 13. Miss Corey complains that her mouth feels dry after she takes amitriptyline, which is basically normal. That's a side effect. Okay, so for about a week, which of the following measures would be least desirable to relieve the dryness in the patient's mouth? That's true. Sucking on hard candies will make us more thirsty, or feeling dry, or having more experiences of dry mouth. So possible that we can tell the patient to suck would be chewing sugarless gum, drinking generous amounts of fluids, and rinsing the mouth with water, rather than sucking on hard penis. Charot. Okay, 14. Which of the following intervention should be of primary concern to the nurse about after Jenny's physical condition is no longer critical? Oh, definitely, we always consider a safe environment. Okay, safety is a priority. Okay, and next number, for suicidal patient, we should always consider safety. 15. Family therapy sessions are initiated for Jenny, her parents, and her older brothers, and which of the following statements reflects the most important reason why family therapy is initiated in this situation? You know, by just merely looking at the term family therapy, you know that there is dysfunctional relationship within the family. So therefore, it is initiated for a dysfunctional parent-child relationship affects everyone in the family. Okay, so adolescents would usually show signs of dysfunctions and acting out behaviors when they live in an unhealthy family environment. So therefore, we always have to consider the feelings of rebellions, insecurities, rejections of an adolescent could also be related to the environment they have from their family. Okay, if this dysfunctional relationship have occurred in a family, then it would be necessary for them to have that family therapy. Number 16. Jenny tells the nurse that before her admission, she had one homosexual experience with a classmate. And is feeling confused about this encounter.
Buy now, gay later.
Okay, ako ba to? Charot? Okay. So, which of the following statements best describes most homosexual experience? Kailangan ko ba sabihin? Charot.
Prof, is it still considered as a form of mental illness?
The homosexual preference?
No, it is not.
Yeah, it's not.
Considered as an alternative lifestyle.
That's true.
Diba?
Correct. Mabuhay ka.
kung hindi ka na-enjoy, o edi maghanap ka kung saan ka mag-enjoy.
Ano?
Tama?
Yes. Sabihin mo, tara, enjoy tayo. 88. Ay, 8 years, 8 mine. Charot! Okay.
Kaya nauuso ang mga BL series ngayon sa YouTube eh.
Oo nga. Pero hindi ako
Ano
masyado
favorite mong
papanood.
BL series doon? Dati favorite ko yung Ben and Jim eh, tapos pumangit yung story nung may bayad na.
Ano ba yan? Minsan talaga po pangit ang pag may bayad.
Oo, sabi ni Ian Sup espadahan daw. O, di
Pwede
ba?
din. Kaya ko din
O, yun na yung uso ngayon. Ano ba? O.
I love,
Makiuso na kayo.
I love fencing. Charot.
O, game na.
Okay, go back to the question. So the answer is actually a homosexual experience is not an unusual occurrence during adolescence.
Do you agree, Prof. Jem, that it is not an unusual experience?
I agree, because it's a form of knowing yourself as well.
What?
Being a homosexual
So,
and
anong motto mo? Kapwa ko mahal ko, ganon?
Okay, well, yes, I must say
Is that
so.
your motto?
Yes. Kinain ko ang kapwa ko. Ganun.
Alam mo yan ang kaibahan ng mga ng mga bading sa mga kanibal.
Bakit?
Ang kanibal, kumakain ng kauri.
Ang mga bading.
Kumakain ng kaari. Nanggugulo din naman ako.
Okay. So anyway. Okay. So may kumakanta habang tayo ay nagde-lecture. I-mute kita muna. Okay, anyway. So again, a homosexual and heterosexual experimentations occurs during adolescence. So we cannot say that if you are an adolescent years, you fall in love with the same sex, it means that it's not valid. Okay? So you experience those things because you are also trying to identify yourselves. And the thing is, according to the research and recent evidence, so the acceptance, rejections, a form of lifestyle may be related to looking or finding for the right preference for you. Okay? So next, 17. Carrie says she would rather die than to be pregnant. Which of the following would be most helpful for the nurse to make?
May sagot ako dyan.
Which
helpful for Carrie, i-refer mo siya kay Basing.
Abortionist. Okay. Baka kasama pa sila Aning.
Magmarkada sila ni Aning.
Correct. Okay.
Considered, the principal o the teen?
Bakit nagka-deep? Nakakaloka.
Tatawa naman ako. Okay.
As a principal. Okay, well, anyway, yung number 17 naman is not that critical. You just have to answer it in a therapeutic communication. So you are very upset means acknowledgement. It will be easier for you to talk about it if you can relax. So basically, you are suggesting informations and also exploring the needs to talk about it. Verbalization. Okay, number 18. Miss George teaches Carrie about sexual intercourse, contraceptions, and the like, for which the following behaviors will the nurse most probably be indirectly responsible for increasing in caring. So definitely the patient's responsibility for sexual encounters, because this is individualistic. When you perform something like sexual activity, it is something that you motivate yourself to do it. So it's more of individualistic, okay? So sex education, has the goal of increasing one's knowledge about sex. And this ordinarily leads to persons taking more responsibility for his or her sexual behavior. So whatever you do as a form of sexual activity, it is you as an individual will be responsible to do that. Okay? So you should not blame the teacher who taught you about sexual education, the others who have actually showed you to do it, but it is you as an individual should be responsible for it. Okay? So after 3 days of taking chlorpromazine, it's antipsychotic. So Thorazine, Mr. Rand shows an inability to sit still. He has motor restlessness, fidgets, and tend to pace around the units. Of the following EPS adverse reactions the patient is showing signs of, we commonly know this as your akathisia. Okay? So next, number 20.
Jem, yan ba yung kinakamot? Akatisha?
Makati siya yun.
Restless leg syndrome. Okay.
Restless leg syndrome. Okay, so the exact cause of akathisia is unknown. Okay, but there are some situations that it can be related to the use of stomach medications, like mga antacids.
Antacids, Mayalox.
Mayalox. Okay, 20, Mrs. Wallace curls into a fetal position in bed when she is upset. So which of the following defense mechanism is she using when she displays behavior reminiscent of an earlier level of emotional development? So from the term itself, curls into fetal position. So that's basically what we know as your regression. Okay, it's a typical emotions as response to anxiety, emotional disturbance. Ma'am, is it okay to use defense mechanism at some point of our lives? Definitely yes. Because we don't have a balanced life that we only experience those positive things in life. So when we feel anxious, when we feel upset, it's okay to use defense mechanism to fight against the anxiety and some sort of emotional problem. Okay, but of course, it became pathological if you use those things or those defense mechanism in a non-reasonable situations. Okay, 21, to help evaluate Mrs. Wallace's progress, the nurse pays close attention to nonverbal communication whenever conversing with the patients. Which of the following statements best describes why nurses' observations of nonverbal messages are important? Okay, so here, the nonverbal communications convey feelings more accurately than do verbal communications. It is also somewhat the same with what we have always say, no? That actions speak louder than words, right? Okay, so those are important, no? It has been shown that nonverbal communication usually conveys feelings more accurately than spoken words. Okay, because sometimes the words very often are used to cover feelings, while nonverbal communications offers less opportunity to hide true feelings. Ganun pala yun. Kaya minsan we most believe on the actions rather than promises. Kasi
May hugot. May hugot.
Marami naman nag-promise, pero mas marami din na nag-break.
Malay mo naman may kumanta sa'yo, Prof. Jen, na bakit ba hindi ka nakilala nung ako'y malaya pa? Oh, di ba?
Ano yan?
At hindi ngayon ang puso ko'y may kapiling na.
Hindi ko na siya alalahanin. Ibinigay ko lahat. Okay. Binigay ko lahat. Tumuwad ako eh. Iniwan pa rin ako. Charot.
Pati naman ang wallet binigay.
Okay. So anyway, number 22. Restraints are ordered for Mrs. Wallace to be used according to nurse's discretion, with which of the following offenses could nurses be charged? In the event she uses the restraints on patients without good cause and legal suit develops, so the answer is false imprisonment. Remember, when we perform restraint, it has to be reasonable, and it has a medical reason to do it. Restraint should be performed if the patient cannot follow the verbal instructions, and we see that there could be potential harm to self and others as well. Okay, so if you do it without a good reasons, because you just fail to do it so to stop the behavior of the client, then that can be charged a nurse for false imprisonment. And usually if you are charged with false imprisonment, this comes also with battery, because touching without consent, assault because the patient feels threatened also about the situation. 23. Okay, diazepam volume is prescribed for J to help control his anxiety. Of the following considerations, the one that represents most serious associated with regular use of most anti-anxiety agents is potential for drug to be abused. That's true. Okay, so anti-anxiety agents are among are among the most often prescribed abused drugs. Okay, usually, no, because of this side effect, no, that causes dependence, which makes the clients more to become abusive with this type of medication. Okay, number 24. The worst thing that could happen if you abuse and you develop that dependence, there might be some worst effect in terms of withdrawal. Okay, so 24, Mrs. Santos is to undergo a series of diagnostic tests to determine whether or not her organic brain disorder is treatable. Treatable forms of dementia, those with symptoms that can be arrested or reversed, include all of the following disorders except by multiple sclerosis. Multiple sclerosis is another problem. Okay, multiple sclerosis is a progressive chronic disease. It cannot be reversed. The problem in multiple sclerosis is not reversible, but patients may develop remissions. Okay, so when we talk about remissions, patients may have some situations or days that the patient is not suffering from signs and symptoms, but this can be triggered and can lead to exacerbations. Okay, so multiple sclerosis is another problem. Okay, and it's not reversible. 25. Mrs. Sanchez is allowed to reminisce about her past life. What effect can reminiscing an elderly patient be expected to have the patient's functioning in the hospital? Definitely, it decreases the patient's feelings of isolations and loneliness. Remember, reminiscing can help reduce depressions in an elderly person and lessen feelings of isolations and loneliness. So if they want to talk about their past, then allow them to talk to. Okay, so it's basically important for them to have that life review. Okay, that can lessen their sadness or feelings of loneliness. Okay, 26. Patients' government is often an important component in the therapeutic milieu. So the nurse's most important advantage of this activity is that it's a milieu. We talk about that environment. Okay, so bridges the gap between the hospital and community environments. Okay, so remember, patients are helped to bridge the gap between the hospital and community environments where they can learn to function in leadership, membership, and decision-making positions in activity that increases their awareness of democratic processes. So with this type of interactions in the same environment, we learn different things by means of being aware and also developing the decision making. Okay, so 27, an attitude on the part of the nurse that would most likely foster a therapeutic relationship between the nurse and Monica, who tries to manipulate people, is an attitude of consistency. Consistency.
True.
Okay, it is most important for the nurse to maintain an attitude of consistency when dealing with a patient who manipulates. So the fact that we see on the test that the manipulative behavior of our patient, consistency is best. Okay, always consider to show them the rights, rules in the units, so they would not cause any reinforcement of negative behavior from our patients. Number 28. It did not bother Monica that her trick playing, teasing, and running away from home may have caused others to suffer. According to psychoanalytic theory, this lack of remorse is due to a defect in the functioning of superego. Remember when we talk about that superego, id, and ego? Superego is the one that says that you should not do something bad because this is our moral, this is our conscience. So if you don't have that conscience and morality, or poor in your personality, that affects your superego. Well, id is basically the pleasure principle. Okay, that strives for what we want or what we like to be achieved. And then when we talk about the ego, usually the ego is the balancer between the id and the ego. Okay, so next, number 29. Miss Twill has become attached to Miss Brill, a part-time nurse, and frequently refuses to share her story with any other staff members. She tells Miss Brill that other staff members mistreat her, that she can trust only her, and fears for her safety during Miss Brill's balance. Okay, what does it mean? Splitting. Okay, splitting personality. No, splitting refers to a defense mechanism. Okay, it is also a learned behavior in which manipulation becomes an adaptive style. So if you do manipulate different situations based on your satisfaction, then that is splitting. Okay? Okay. So 30, hospital policy. What is the best way to reduce the splitting? Usually consistency should also be implemented with this type of clients, so that they will not manipulate the situations with different staff or different people surrounding them. Okay,
Yes, Jem, meaning you have to assign the patient to only one
one
nurse.
nurse, yes. Consistency. 30, hospital policy requires that the patient's belongings be searched for contraband on admission. So in view of Mr. Wanana's drinking problem, which of the following possession is most likely to be confiscated by nursing staff? So this one is related to what? Alcoholic patients, who might be on an alcoholic detoxification. Okay, so you consider antiseptic mouthwash often contain alcohol. Okay, it should be taken from patients entering a substance abuse units. Okay, so remember, if the patient wants to continue recovering from being alcoholic and they are given with medication that can reduce the craving for it, avoid anything that contains alcohol. And one of those is actually the antiseptic mouthwash. Okay, 31. Mr. Wanana's wife agrees to meet with her husband's therapist, but says she has about had it with her husband's foolishness and bad temper, which the following organizations would probably be most helpful to her in obtaining additional assistance and support in coping with her alcoholic spouse. We remember the different self-help group. Okay, if this requires a family member to be involved in rehabilitations, then the best is your Al-Anon. If we consider just the individual to recover from alcoholic, we use to consider the AA. Okay, AA or Alcoholics Anonymous. If it's family related, Al-Anon. If it's just for adolescent or teenagers, okay, then we consider Al-Team. Okay, so this one is related to alcoholic spouse. So you involve the family members. So it's best to be rehabilitated in a group Al-Anon. Okay, 32. The nurse who admitted Mrs. Baxter comments to another nurse, cirrhosis, she must be an alcoholic. Oy. Okay, the practice of automatically attributing an overindulgence in alcohol to people with cirrhosis is an example of being what? Stereotype. Okay, stereotype, no? So stereotype means labeling that categorizes a person into a common groups. Okay, number 33. The nursing staff is concerned about possible HIV exposure among other patients on the units and themselves, which is least important of the following precautionary measures. Definitely a private room. No, HIV cannot be contracted or cannot be developed with just merely talking to someone. Okay, it is commonly contaminations from the blood or secretions of a patient with HIV or AIDS. No? Okay, but with just talking to the patient, being with the patient without doing anything, okay, no, you cannot have that type of infection. Okay, next, number 34. By the fourth meeting, the members are able to start sessions by themselves and relating to each other in a warm, considerate manner. They are proud of each other's successful dieting attempts and able to cope supportively with an occasional member's feelings of discouragement. This unity in spirit illustrates a group quality known as cohesiveness. So what is cohesiveness? The quality of group cohesiveness is present when members are relating to each other warmly and are part of their progress and are supporting members who becomes discouraged. So in short, when we talk about being cohesive, we can talk about our positive and negative behavior. We can share it to the other members as well. Okay, we are comfortable in sharing what we have, whether it's positive or negative. Okay, so 35, physical manifestations most likely to be found during nursing assessment. Okay, this one is related to eating disorder. Eating disorder. Okay, so bradycardia, hypertension, and cold sensitivity. This is more likely an anorexia. Okay, anorexia nervosa for number 35. Okay, Maluwa. Maluwa is a 20-year-old college student, okay, who was admitted to a psychiatric unit with 4-year history of severe bulimia. So the nurse anticipates that Miss Wong's current signs and symptoms will most likely, what differentiates an anorexic to bulimic is the presence of binge eating. Although we don't discriminate the fact that in anorexia they also have this binge eating pattern, but it is more frequently seen to patients with what? Bulimia. So patients with bulimia could usually have normal to slightly underweight, okay? Then binging, vomiting, okay, purging, no? And low serum potassium level. Okay, so that's what we commonly identify to bulimic patients. Okay? Another 137. Emergency department staff observed that Mr. Ramos is hyperventilating. Which of the following electron imbalance is most likely to occur when the patient hyperventilates? We've been discussing this all throughout our discussions for today. No, it's respiratory alkalosis. Okay, 2 is the symptoms caused by hyperventilation. Which of the following measures would be best for the nurse to try first? Okay, we know that to revert that respiratory alkalosis, we need to ask the client to rebreathe or breathe into a paper bag. Number 39. Mr. Ramos' feelings of distress are communicated to the nurse during counseling session. The nurse perceives his distress begins distress as well. Which of the following statements of intent would be best for the nurse to make? I need to leave for a few minutes to deal with my feelings, but I will return shortly. You know, okay, when we talk about emotions, we also have the emotions being felt by everyone. Definitely, we are equal in terms of emotions. When the nurse is being adversely affected by the patient's feelings, it is best for her to leave if her anxiety is too high for her to function effectively. In short, it is very important to always manage our emotions towards our patient's behavior. Otherwise, it can affect the way we function or the way we care for our patients. So if you know to ourselves what should be our emotions in dealing with the emotions of others, then that could definitely help us better in caring our patients. 40. As the nurse learns more about Tao's family, which of the following characteristics is she least likely to find to be true about domestic violence? Least likely, again, between episodes of abuse is a warm, empathetic relationship with his wife. No? Remember, when we talk about abusive families, we see lack of empathy. Lack of empathy characterizes the relationship of abusive families. A history of family violence, low self-esteem are common among abusers. Okay? So the idea that only poorly educated or poorly employed men are abusive is not true. It's just a myth. So what is basically a fact? Those clients who had their history of abuse in the family have the tendency also to develop that family or domestic violence or abuse in a family. Okay, 41. Mrs. Santos told the nurse how much we wish we had taken that trip to Europe last year. Greg wanted to go, but we foolishly pulled it off. It makes me furious that we didn't go as originally planned. Which of the following stage of adaptation to dying Greg's mother most likely experiencing? With this statement, this family appears to be experiencing anger. Anger. Okay, so that normally happens when we are trying to adapt in a situations that we need to surpass. No, we have that type of process of grieving. Okay, sa dabda. Okay, so this one is more of anger. Okay, next, number 42. The time of death for Greg was accorded at 5:40 a.m. While there is no universally accepted definitions of death, the current trend in the United States is to define death as occurring at a time when there is irreversible cessation or functions of the person's brain. Okay, so what we expect if there's already no functions of the brain can be found through the electroencephalogram. That could also mean the declarations of death for a person. That's it. Wow,
Ah,
Okay, wow! Okay, nakatapos ulit tayo.
tapos ka pa lang, meron pa ako. Now, my
Okay,
time to, yes, set F, my time to consolidate everything that we learned today. So, kindly download, Gapos Babies, kindly download your handouts labeled set F.
set F.
Yes, rundown set F. Ayan. Wala pa kayong sagot nito. So, kailangan masagutan natin. Kamusta ka na, Prof. Jem? Ready ka na to take your lunch? Nagpabili ako na snack natin doon. Mauna ka na. Nandyan sa pantry.
Wow!
Oo. Oo. Nagpabili ako ng pizzang dugyot.
Ano yun? Angel's Pizza.
Yung mumurahing pizza lang, kao naman, no? Siyempre, pag pizzang dugyot, yun ang mumurahing pizza lang. So, yung mga nandito pa at talaga namang nakatutok pa sa atin hanggang ngayon, kahit na mag-aanim na oras na tayo dito sa ating ginagawa, okay? Paki-type lang dyan sa inyong at sa ating chat box, I will tap the board. Go!
Yeah, actually, sir, may nagme-message sa akin.
I will tap the board. Ayan, ano na sinasabi ng nagme-message sa'yo?
They are watching the Facebook and they don't know how to get through.
They don't know. Oo, hindi siguro sila nag-register. Wala silang handout. Oo.
Yeah, dapat mag-register.
Correct. Nanonood sa Facebook, sa napakaraming Facebook accounts consolidated sa nanonood din sila sa YouTube. So marami tayong viewers ngayon. Okay, let's go. I will tap the board. Come on.
Ayan. Nag-hi nga sila sa atin, sir. Hi!
Yes. Hi, I will tap the board. Diba? Nag-type ng I will tap the board. Tignan mo na doon, Ma'am Jem, kung sino yung tap.
Because I will be the bottom. Charot!
Okay. O samahan mo ako dito, Prof. Jem. Dito tayo sa number 1. A home health nurse is planning his visit for the day. Which of the following client should the nurse plan to visit first? So, sino ang unahing bisitahin? Dalawa ang titignan mo dito. Una, sino yung may acute case? Pangalawa, sino yung may major case? Ang chronic case, considered yan na stable. So wag mong i-rationalize sa akin na pipiliin mo yung COPD kasi ang problema airway. Ayan, nangunguna na si Alexander Klein. Sabi na kasi priority airway, mali. Pag chronic ang sakit, least priority yan. So, options A and B, isa dyan ang tama. Okay? Pareho silang nasa acute phase. Yung isa 2 days lang, yung isa 3 days lang. But, sino ang may major surgery? Yung nasa letter B. Radical mastectomy, the answer is letter B. Ayan, yung siguradong tama, nagisiguradong mali. Hindi laging airway ang titignan. When you're being asked whom to prioritize, acute cases are prioritized over chronic cases. Remember our functional concept, Prof. Jem? Correct. Okay, so let's move on. Number 2. Who among the following clients is most at risk for suicide? Isa lang titignan mo, the elderly male. O asan ang elderly? Dalawa, B and C. Kaya lang yung B, female. Yung C, yan, elderly male. They are most successful on their first try. 50% of those who commit suicide become successful. So the answer, B. O, di ba? Dali lang. 3. Which intervention has the highest priority when a nurse is caring for a client receiving blood transfusion? So stay with the patient for the first 20 minutes and try to see if they are having adverse effects. It could either be allergic reaction, hemolytic reaction, it could be transfusion-related acute lung injury, that's your TRALI, okay? Yes. Or try to figure things out if the patient is manifesting allergy. So the answer for number 3 is A. Instruct the client to notify the nurse if itching, headache, or dyspnea occurs. You have itching here, this could be allergic reaction. Allergy ang tawag dyan pag mayaman, pag mahirap, galit. 1 unit of blood equals 250 ml, ha? Ideally, it is infused within 2 to 4 hours. Okay? Pero usually, hindi na yung pinapatagal ng 4 hours. Usually, 2 hours lang. Okay? Number 4. Due to the high census, it has been necessary for a number of clients to be transferred to the postpartum unit. Sino ang itatransfer mo sa postpartum unit? Definitely, yung may problema sa reproductive system. Letter B. Look at hysterectomy. The patient will have to have the uterus removed. Okay?
Uterus?
Uy, wag niyong kakalimutan ang delegation, especially sa test 1 tsaka sa test 3, which can be delegated. Ano yung functional concept natin dyan? You cannot delegate assessment, teaching, evaluation, and sterile procedures. So ano ang pwede mong i-delegate? Routine procedures. So yung letter A hindi pwede kasi assessment, B teaching hindi. Yung letter C, medication administration, MICVA yung patient, you need an RN doing that. The answer is letter D. This is routine procedure. You can delegate to your nursing assistant. Next, number 6. A registered nurse is providing instructions to a licensed practical nurse who's preparing to care for a client. The RN notes on the client's record that the client's eyes will be donated. The nurse avoids doing which of the following? So, i-donate ang mata. Okay? So, avoid technique longest. Close the client's eyes and place a dry, sterile dressing over the eyes. Okay? Usually, di ba, wet saline gauze ang nilalagay, hindi dry, sterile. Look, letter C and letter D are opposite. So always remember, the correct answer could be one of two opposite statements. Okay, number 7. The safest way to verify a patient's identity initially is to check the identification bond. So the answer is letter C. Okay? Now, asking the patient his name, this could be associated with the identity theft. Pwede siyang magpanggap. So, hindi pwede yan. So, the safest is to check the identification bond. Number 8. Which of the following persons cannot have free access to the patient's record? The lawyer. Okay? The patient, the physical therapist, the pharmacist can have access to the client's record. By the way, the chart is owned by the hospital. So even the cousin or relative of the patient don't have an access to the client's chart. Number 9, the appropriate needle for blood transfusion is, ito wag mong kakalimutan,
Correct.
18 gauge angio catheter, hindi angio iliana, angio catheter. Okay? Next, number 10, the doctor has ordered transcutaneous electrical nerve stimulation. This is a form of complementary treatment. Okay? Now, yung transcutaneous electrical nerve stimulation, parang malaking BP cuff yun na iniro-roll sa sleeves ng patient. Tapos meron siyang mga gagalaw, okay, na electrical nerve stimulator. So it could potentially cause skin irritation. So what will you tell the patient? Okay? Please report skin irritation to the doctor. Okay, and that is letter B. Number 11, a 10-month-old infant who has short bowel syndrome, okay, is receiving total parenteral nutrition. Take note. The total parenteral nutrition solution is being prepared by the dietitian, and it is to be administered by the registered nurse. Okay? Now, the TPN is usually metabolized in the liver. So you need to check the AST and the ALT. So the answer is letter B, aspartate aminotransferase. Amylase is being checked if your patient has pancreatitis, blood urea nitrogen if your patient has acute kidney injury, and of course hematocrit if there's going to be blood dyscrasia. Number 12, following a subtotal gastrectomy. Now, the patient is prone to pernicious anemia because of the gastrectomy. A patient has a nasogastric tube attached to low intermittent suction after surgery. Patient complains of being nauseated. Okay? So, once again, yung technique natin, look for the answer that begins with check, identify, determine. Letter D, determine the patency of the patient's nasogastric tube. 13, the nurse would determine that a client is experiencing Kind-Stokes. Pag sinabing Kind-Stokes breathing, waxing and waning yan. Waxing and waning. So, pag sinabi nating waxing and waning, there is hyperpnea. Okay? Progressive increase in the rate and depth of breathing followed by apnea. So, the answer is letter A. Hyperpnea alternating with periods of apnea. It's not tachypnea. Tachypnea is just increase in rate. Hyperpnea is increase in the depth. Okay, so hyperpnea that alternates with apnea is the one that characterizes your Kind-Stokes breathing you find in the dying patient. It's like when the patient breathes like, yeah, that's Kind-Stokes. Okay, 14, the laboratory calls to state that a client's lithium level is 1.9. This is more than 1.5. This indicates lithium toxicity. So the answer, immediately report the finding to the physician. It's dangerously high. A is the answer. 15, a 2-month-old with tetralogy of Fallot is to be discharged with prescription of digoxin. The normal digoxin is 0.5 to 2. Assessed for vomiting and bradycardia. Those indicates toxicity. So when the patient would have feeding difficulties, that means that's digoxin toxicity. So the answer is B. feeding difficulties, and vomiting occur. Okay, let's move on to number 16 now. When monitoring a patient who has respiratory acidosis, now when we have respiratory acidosis, look for the pH below 7.35. We have two options, B and D. And then since you have an acidotic state, look for the CO2 that is above 45, okay? And we only have one. The answer is letter B. Okay. Next, number 17. Which of the following laboratory results, if identified in a patient who is experiencing vomiting and diarrhea, is suggestive of hypovolemic shock? Hematocrit of 58%. This is elevated from the upper level of 45%. So 58% simply means that the patient's circulating body fluids are diminished. Okay, so you expect the patient to have decreased urine or oliguria. Okay, number 18. A patient is with a high-risk pregnancy is to undergo contraction stress test. Now remember, this correlates your fetal heart rate with uterine contraction. And this is contraindicated when the patient had vaginal bleeding because the test could actually increase the risk for preterm labor. Next, number 19. The nurse reviews a client's laboratory data, notes the following hematology values. You have your 43% hemoglobin, 15%, 43% hematocrit, 15% hemoglobin, RBC 5 million, WBC 7,500, platelet count. The normal platelet count is 150,000 to 400,000. So the highest priority here is that the patient is at risk for potential has potential for bleeding because of the decrease in platelets. Therefore, your priority intervention is to avoid invasive procedures. Okay? Avoid invasive procedures. Okay. Next, number 20. To obtain an accurate reading of CVP, okay, central venous pressure normally 6 to 12. So always remember that the zero level of the manometer should be at the level of the right atrium. Letter A. 21. When assessing an ECG, the nurse knows that PR interval represents the time it takes for the impulse to travel from the atria to the ventricles. Okay? Travel from the atria to the ventricles. Sorry for the misprint. The answer is letter D. Now remember, P wave represents atrial depolarization, QRS ventricular depolarization. Wag kakalimutan. PR interval, the time it takes for the impulse to travel from the atria, P wave, representing the atria, to the ventricle. R wave represents the ventricle. Okay? So, patient has a positive MAN2 test. Now remember, MAN2 test is a screening test. It's not a definitive test. It actually tells us if the patient has already been exposed. So once na nag-positive ka na sa MAN2 test, forever ka na magpa-positive. Sir, there's no use of repeating your MAN2 test. Talagang nag-positibo ka na, positibo na yan. Okay? So it means that you have been exposed to TB. You have to check the patient for induration. Okay? If the patient is HIV positive, an induration of 5 is already considered as positive. Although in the general population and those people with general medical conditions, an induration of 10 is considered positive. When you're assessing for the induration, you just measure the area of skin elevation. The area that is red is not included in the measurement. Okay, the area of redness around the skin elevation is not included in the measurement. Okay, next, to make a definitive diagnosis of tuberculosis, the nurse understands that the physician must order. So we are talking here of definitive test. That's going to be your sputum for acid fast testing. The best time to gather the sputum or the torkak in Ilocano is early in the morning upon awakening. Upon awakening, hindi before awakening. Pag before awakening, di tulog pa. Okay? Next. Okay, the nurse has taken the blood pressure of a client hospitalized with MRSA. Which action by the nurse indicates an understanding regarding the care of MRSA? Methicillin-resistant Staphylococcus aureus is a communicable disease. So therefore, dedicate equipment specific for the patient's use. kung ano yung gamit niya, yun lang dapat ang gagamitin niya. Para yung na COVID, may sarili siyang BP app sa room. So iwanan mo dun sa room niya yung iyong ginamit. So A, the nurse leaves the stethoscope in the client's room for future use. And for clients with MRSA, implement contact precautions. Next, in arranging home care for a 55-year-old male with TB, the nurse should identify the following members as at greatest risk for contacting TB from the client. The immunocompromised client. Sino bang immunocompromised? Yung nagtitake ng steroid. Sino pa? Yung nagkikimo. Sino pa? Yung nag-radiation therapy. Okay? So the answer is letter C. Yeah. Bakit nawala ang mga number dito? Next, a mother asked the nurse how to tell the differences between measles or rubella and German measles or rubella. Remember, rubella, dalawang L, dalawang salita, German measles. Rubiola, isang L, isang salita, measles. Pag measles, anong type ng precautions? Airborne. Pag rubella, anong type ng precautions? Droplet. What would tell you that the patient is having measles? What is pathognomonic of measles? It's not the rash, it's not the fever, it's the Koplik spots found in the patient's oral mucosal lining. Okay, so the answer is A. Next. Yeah, number 14. A client in labor starts screaming, the baby is coming. The first nursing action would be to check the perineum. Remember, assess, check, identify, determine. Yan, check the perineum. Okay? How will you check it? Are you going to check it with the tongue? Of course not. Next, okay? Number 28. A woman is receiving Pitocin for induction of labor at the peak of successive uterine contraction. The heart rate changes to a baseline of 150 to 110. So pag bumaba, ang tawag dyan, deceleration. So pag may deceleration, anong gagawin mo? The fact na bumababa yung heart rate ng bata, ibig sabihin, hindi niya natatagalan yung pag-contract ng uterus. Ano yung nag-cause ng contraction ng uterus? Yung Pitocin. So, itigil mo yung Pitocin. The answer B, stop the woman's Pitocin infusion. 29, okay? Which of the following findings in a pregnant woman's history would identify a need for a woman to receive ROGAM? Now, ang ROGAM ay binibigay lang kung yung nanay ay RH negative at COMS negative. Ano ibig sabihin ng COMS negative? COMS negative, hindi pa siya nag-develop ng antibodies against the RH positive blood. So therefore, let's summarize and put everything into perspective. You give ROGAM when the mother is RH negative, COMS negative, and when the baby is RH positive. Okay? Next, 31, the physician adjusts a client's dosage of digoxin and warfarin sodium. The antidote that the nurse should prepare. Now, this is for warfarin sodium, vitamin K, protamine sulfate is the antidote for heparin. Now, a toddler has swallowed liquid drain cleaner. Naku, may pangarap itong toddler na to. Nag-swallow na siya ng drain cleaner. Pangarap maging janitor. So ang answer dito ay dilute with vinegar solution. Do not induce vomiting, otherwise the esophageal lining would be damaged. Next, 33. A 3-year-old girl has gluten-induced enteropathy, celiac disease. Remember, avoid barley, rye, and wheat. Okay? Ang oats allowed na. Okay? Letter D. She loves spaghetti with tomatoes. As remember, yung pasta is made of wheat. Okay? Ibig sabihin, basa. 34. A new mother of an infant diagnosed with PKU meets with the nurse who informs autosomal recessive inheritance. It means both parents should have the trait for a child to have the disease. Yun ang ibig sabihin ng autosomal recessive. Dapat parehong carrier ang magulang para ma-transmit sa anak. So the answer is letter A. Autosomal recessive inheritance, each baby has 25% of having the disease or they have 50% of inheriting the trait. Mamamana yung trait, 50%. Mamamana yung sakit, 25% with each pregnancy. 36. When a 12-year-old boy who received tick bites, so meron siyang Lyme disease. Okay? So tatandaan mo, your tick bites would usually cause rounded rings of rash in exposed body parts. So tatandaan, paano mo to explain sa bata? The insect bites gave you an infection, but there's a medication that will stop it. Tetracycline in a 28-day cycle, yung treatment ng Lyme disease. 37. Okay, a client with sickle cell disease is prone to develop sickle cell crisis. What triggers sickle cell crisis? Dehydration. And when will you expect dehydration? When the patient would engage in cycling activities kung saan pagpapawisan sila. So cycling up to mountain trails, yes. E paano pag ginawang cycling up to Baguio yan? Yes pa rin. Okay? 38. Which of the following findings in a 5-year-old who has Kawasaki disease would be most helpful for nursing diagnosis of impaired skin integrity? Desquamation of the palms and soles of the feet. Although the beginning sign of Kawasaki's disease would be a 5-day high spiking fever that comes with strawberry tongue. Okay? And then magbabalat-balat, mauuna yung fever and strawberry tongue. Then after a week, magbabalat-balat yung kamay. Yan yung desquamation. Kaya pag nagbalat-balat yung kamay ng bata, huwag mong sabihin may mapupulot na pera. Hindi. Okay? Baka may Kawasaki disease. So what is the treatment? Administration of aspirin to decrease the inflammation and to prevent, okay, cardiac involvement. And then the diet should be clear liquid diet. So what would be your discharge instruction for the parents with whose child has Kawasaki disease? Teach them how to do CPR, because there's a chance that the child eventually could potentially have thrombus formation and may have heart attack. Okay? 39. Nursing care of a patient who has polycythemia vera. So pag may polycythemia vera, kailangan mo ng phlebotomy kasi masyadong mataas yung RBC niya. So the patient becomes prone for CVA, or they become prone to blood clotting or thrombosis. So the answer is letter C. Okay? Kaya usually ang treatment niyan ay binabawasan sila ng dugo. Okay? Oo. Next. Phlebotomy. 44. Which of the following symptoms would most likely indicate pyelonephritis? That's going to be costovertebral angle tenderness, letter B. Pyelonephritis is caused by ascending infection that could begin as cystitis. Polyuria is associated with either diabetes mellitus or diabetes insipidus. Ascites is associated with liver failure, like that. Something that happens in patients with liver cirrhosis or Wilson's disease. Number 45, the nurse is assessing a client who is complaining of numbness in the hands and wrist from carpal tunnel syndrome, which test is measured by placing the blood pressure cuff. So ilalagay mo yung blood pressure cuff. This is Fallen's maneuver. Pero actually, pag Fallen's maneuver, simple lang, i-occlude mo lang. Okay? Yung iyong wrist. Or yung ginagawa ni Prof. Jem, yan. Okay? Yan. Reverse prayer or the prayer position. Yung Tinel sign naman, you tap over the nerve. And usually there's gonna be a sensation of pins and needles or tingling sensation. That's typical of client with carpal tunnel syndrome. Okay? Pag Vostek sign, when you percuss the facial nerve, there's facial muscle twitching on that side. Now, Turner sign or Gray Turner sign is purplish or bluish discoloration in the flank. Okay? So 46, the nurse is assessing traction of a client with fracture. Assessment reveals the presence of loosened pin on the bone. Which action is appropriate? You have a loosened pin, notify the physician. 47. A patient had above the knee amputation of the right leg. What do we need to keep at the bedside? Tourniquet, because a common complication of amputation would be bleeding. They could also experience phantom limb pain, which is, take note, a real type of pain. It is due to the continuous signal sent by the peripheral nerve endings to the brain that is interpreted as pain. Okay? So for clients with a leg amputation without prosthesis, we teach them, okay, the 3-point gait. But if they have the prosthesis, then we teach them the 4-point gait. Huwag niyong kakalimutan ang mga crutch walking gait na tinuro namin sa inyo. 48. The nurse performs full range of motion on the client's extremities. When putting an ankle through range of motion, the nurse must perform dorsiflexion, plantar flexion, eversion, and dorsiflexion, plantar flexion, eversion, and inversion. Okay, so letter D. 51. A patient is suspected of having systemic lupus erythematosus, which is a common finding in SLE. Rash on the face across the bridge of the nose is known as butterfly rash. Okay? Which is different from the slap cheek appearance of rashes. Pag slap cheek kasi, minimal lang sa bridge of the nose. Unlike sa SLE, okay, meron siyang talagang thick rashes on the bridge of the nose. Now, slap cheek appearance of rash is found in clients with Fifth's disease. Okay? 52. When completing the history and physical exam of patient diagnosed with osteoarthritis, which would the nurse assess? We're talking of osteoarthritis. So you will need to assess for local joint pain, dog. Iba po ang osteoarthritis sa osteoporosis. Osteoporosis is due to loss of bone density. Postmenopausal women are at risk with osteoporosis because of decreased estrogen. And that's the reason why you need to increase their sources of calcium in the diet. And tofu or tokwa is very high in calcium. Okay, 53. The nurse is caring for a client with increased ICP. We're talking about Cushing's symptoms. So letter B, increased temperature, decreased pulse, decreased respiration, increased BP. Okay, letter B. Okay, 54. Clients with myasthenia gravis, Guillain-Barré syndrome, multiple sclerosis, amyotrophic lateral sclerosis, they would have increased risk for respiratory complication because of muscle weakness. Now take note, sa amyotrophic lateral sclerosis, there's usually degeneration of upper and lower motor neurons. Anong outstanding sign ng ALS? Muscle weakness. Ano ang common cause of death? Respiratory complication. So anong priority mo? Airway. So what would be your priority nursing diagnosis? Ineffective breathing pattern. Okay, number 56, we have a patient with burns. Ang formula dito ay madali lang, no? Pag sinabi mong Parkland formula, use constant number. Ano yung constant number? 4. 4 times percentage of body surface times weight in kilograms. So 4 times 35 times total body surface area. That's the total body surface area, 35, plus the weight in kilograms. Okay? So after mo, ma-multiply yan. So 4 times 35 times 100. So that's approximately 14,000. So how do you divide it? The 50% will be given in the first 8 hours and the remaining 50% of 14,000 will be given the next 16 hours. So 50% of 14,000 would be 7,000. So the answer is letter B. 57. Cushing's syndrome, as the nurse, why has my face become so round? This is mooning of the face, and this is due to excess or abnormal distribution of fats. Okay, this also gives rise to your buffalo hump and truncal obesity. So letter B. 58. Which of the following parameters should be given priority when caring for a client with hypoadrenalism or Addison's disease? Monitor the blood pressure because a severely decreased blood pressure indicates Addisonian crisis. Okay? 59. A client is admitted to the hospital with acute adrenocortical insufficiency or Addisonian crisis. So corticosteroid is actually given to the patient. Okay? During drug therapy, which of this assessment of the client is important? How do you know if the patient's shock has been addressed properly? When the urine output is normal, because that is a reflection of the adequacy of circulating fluid volume in the body. So the answer is letter C, recording urinary output. 60, don't forget, thyroid storm is caused by increased amount of thyroid hormone in the blood. And what is a common manifestation of thyroid storm? Increased temperature and increased pulse rate. So if after thyroidectomy, the patient will have increased temperature and increased pulse rate, okay, you have to note that this is associated with a complication. So you have to report this to the physician. Next, Jem, a beautiful princess, was recently visited by her German boyfriend. Upon arrival to the country, the German boyfriend, Mark Supshopoten, was so mad because he wasn't allowed entry in the house of Princess Jem. So he climbed the fence of the house to gain entry. He was surprised to find Princess Jem bedridden due to superior vena cava syndrome. O, explain mo yung sakit mo, Jem. Okay, what is the outstanding, not the manifestation, but usually what causes superior vena cava syndrome? Pag may tumor, di ba? May tumor na malapit doon sa aorta at nakukompress, di ba? Okay, so this is lung cancer. So the answer is letter D. Okay, next. The most common symptom of superior vena cava syndrome, facial edema. Letter C, na-compress. Kasi yung blood na ipon sa upper part ng body, so usually yung muka na banat, nag-edema siya. Okay? Next, 63. As part of the diagnostic workup, you're planning him for a computerized tomography scan. So what will you ask the patient? C, are you allergic to seafood or iodine? Why? The contrast medium is iodine based. So if the patient's allergic to iodine or seafood, chances are after the procedure they could be Okay, developing an allergic reaction. 64, daily dose of prednisone is prescribed for the patient and you instruct him that the best time to take the prednisone is early in the morning after breakfast. Okay, do not give it before meals because before meals, it could cause GI irritation. So give it after breakfast, but early in the morning so that you maximize the effect of the prednisone. 65, the physician orders furosemide or Lasix, which is a diuretic. So this could lead to a decrease in potassium. So letter D. So a patient who's taking Lasix could be at risk for hypokalemia. Next, Father Lichun Baliwag was diagnosed with an endocrine condition known as Paris disease. Okay, saan ba common ang Paris disease? Common ba ito sa pare? Naalala ko tuloy yung janitor at saka yung security guard, nag-aaway sila. Sabi nung janitor, wag kang ang ganyan, baka magasgas mo yung sasakyan, kay father yan. Sabi ng security guard, anong kay father yan? Kay mayor yan. Hindi kay father yan. Sabi nung janitor, sabi ng security guard, sige, patunay mo sa akin, paano mo nalaman kay father yung sasakyan na yan? Sabi niya, tignan mo, basahin mo, ano nakalagay? Safari. Okay. Now, Paris disease is multinodular goiter. Lumaki na ang boklong mo. Okay? And because of the presence of those nodules, it actually stimulates the production of your thyroid gland. So in essence, pag may Paris disease ka, meron kang hyperthyroidism. So pag may hyperthyroidism ka, hyper alert. Diba? So hyper alert, so nagwe-weight loss ka kasi kung ano-anong ginagawa mo. So, mali na kagad yung letter B kasi nakalagay lethargy. Ano ba ibig sabihin ng lethargy? The letter that comes after letter F. Lethargy, hindi. Okay? So, ang pagpipilian lang yung may weight loss or C or D. Kaya lang, okay, look at letter D. Kasama sa letter D ang lethargy. Di ba sabi natin di kasama ang lethargy? Correct. So the answer is letter C. Weight loss, exophthalmos, and restlessness. Ang mga matang mala Simpson. Okay, 67. He is scheduled to have subtotal thyroidectomy. Pre-op instructions now. You need to tell the patient that there's usually a potential for bleeding after surgery. So you need to instruct the client to support the head with the hands when changing position. So C is the answer. 68, he is also bound to receive Lugol solution. Now, the purpose of the Lugol solution, it's given 2 weeks before thyroidectomy, is to decrease the size and vascularity of the thyroid gland. So the answer is letter C. Now, sometimes nami-misprint yan sa exam, nagiging Dugol solution. Lugols yan. Okay, 69. Post-operatively, you should plan to have, you need to have a tracheostomy set at the bedside because after thyroidectomy, there's usually a potential for accidental removal of the parathyroid gland. Pag natanggal ang parathyroid gland, you will have decreased parathormone. When you have decreased parathormone, you will have decreased calcium. When you have decreased calcium, that leads to laryngospasm. That's why that could potentially lead to airway obstruction. So to prevent that from happening, you have to have that tracheostomy set at the bedside. O, di ba? Tatanda mo lagi anong equipment at the bedside. Yung pasyente na, okay, kunwari, may Sings taken Blakemore tube, you need scissors at the bedside because you need to deflate eventually the balloon, okay, if aspiration occurs, di ba? So, for patients naman, post-thyroidectomy, you need tracheostomy at the bedside. Dapat alam mo yung mga ganyan. Like for patients with, for example, if the patient has varicose veins and deep vein thrombosis, you need a tape measure at the bedside because you need to always monitor the leg circumference. So you always have to be conscious about which equipment you need to prepare at the client's bedside. 70. Post-operatively, he exhibits carpopedal spasm. O, na ganyan, nanigas yung kamay. This is due to calcium imbalance. So you have to administer calcium gluconate. Okay. Next, Ray was found to have hypertension, hypercalcemia, hyperglycemia, hypermetabolism. Alam ko na to, pheochromocytoma, tumor of the adrenal medulla. What is the priority here? Check the BP because hypertension could develop. Pag mo kakalimutan yan, pheochromocytoma, hypertension, hypercalcemia, hyperglycemia, hypermetabolism. Okay? Ngayon, among this H, yan ang apat na H na yan, hypercalcemia is usually a complication. Okay? Okay. Now, this diagnosis indicates that this person his hypertension is caused by excessive hormone secretion coming from the, okay, saan pa ba nagpumula yan? Kundi sa adrenal medulla, letter C. Okay, next. 72, you realize that which assessment is critical. O anong priority mo dyan? Kasi sabi ko lang, blood pressure. When assessing him, you are most likely to detect, okay, elevated blood pressure. So letter D, 176/88. And then number 74, accurate test for detecting pheochromocytoma would be a 24-hour urine test. Anong tawag sa test na yon? Vanillyl mandelic acid test. Okay, the normal level of vanillyl mandelic acid in 24 hours would be 2 to 7 milligrams per 24 hours. Pag lumagpas siya sa 7, then you most likely you have pheochromocytoma. 75. He is eventually admitted to the hospital with acute hypertensive crisis. To reverse the hypertension, ano binibigay? Pentolamine, the drug of choice for hypertensive crisis. Next, JB was admitted due to visual impairment, which lab test results would suggest to you that a client has corticotropin secreting pituitary adenoma. The answer is B, low corticotropin and high cortisol levels. 77. He has undergone transsphenoidal hypophyseectomy. Where is the incision dito? Yan. Okay? The upper gum line between the lip and the gums. That's why eventually you need to modify oral hygiene. Di siya makakapag-toothbrush. So 77, in the upper gingival mucosa, in the space between the upper gums and the lips. So letter D yan, hypophyseectomy. Post-operatively, it is most important for you to monitor his, okay, anong i-check mo? Ang complication kasi ng transsphenoidal hypophyseectomy could be, okay, an interference in the secretion of your antidiuretic hormone. So eventually, the patient could develop diabetes insipidus. How would you know that there is diabetes insipidus? The specific gravity of the urine falls below 1.005. Therefore, ano i-check mo? Specific gravity of the urine. That's letter C. Okay? Which aspect of normal post-operative care will you modify for him? Oral hygiene. Di siya makakapag-toothbrush dahil ng incision dito. Ayan, ganyan. Ay, confident ito. Teeth by Dr. Morjani of Makati. Promote, no? Okay, ang aking
so much.
80. The physician prescribes corticotropin as a replacement therapy. Masyado na itong high-tech. Prof.
Yeah.
Number 80. But the answer is letter C. It interacts with plasma membrane receptors to produce enzymatic actions that affect protein, fat, and carbohydrate metabolism. It regulates, hindi nakasama yung letter D. So hanggang letter C lang ang tamang sagot. Okay? That actually completes our session today. Okay, babies, check on your emails tonight for the CHN materials that are going to be used.